Welcome back to Legalese 123, where we are covering cases across America. Hello, and welcome to Legalese 123. I'm your host, Missy K. It is Monday of the Mondayest. I'm a little late, I'm sorry. It is August the 3rd. Hello. We are in the thick of things with the Lindsay Clancy case. I don't know what's going on with my hair and why you only see part of my hair, but this is what we're rolling with today. I don't know why. Maybe am I too close? I don't know. Oh my goodness. Okay, it's Monday. Let's tell everybody that we're live so you can join us. It is day 5 of the Lindsay Clancy case. So yes, a lot's going on. We're going to hear we're starting to get into it. We're probably going to hear a lot of experts coming in. We probably need to hear a lot from the medical professionals who took care of the children and perhaps some that took care of Lindsay. Okay, link below. Okay. Well, I hope everybody had a great weekend. Lots going on. I'm just trying to get everything situated so that we can begin. Hello. Oh my goodness. I'm all over the place / nowhere. It's a Monday. All right, where are we? Okay. Trying to let everybody know that here we are. Let's see if that's going to work. Let's do that again. All right. Perfect. Okay. Hello. All right, let's do TikTok and let everybody know on TikTok that we are live. all the things you have to do. Oops, stop that. No, stop that.
For a full day out.
Stop that. It's a Monday. Okay, here we go. Make sure to join me live right now on YouTube. Same channel name, Legalese123. We are in day 5 of the Lindsay Clancy case. Come join us and talk about what's transpiring, who we're going to see, and what experts are going to testify today. All right.
Make sure to join me live right now.
Got to see me do my TikTok. All right. So got a lot going on. I can't spell. All right, I did that. All right, law lovies, we're going to go ahead and get into it. Hopefully, people will join in and find me. We got a big day ahead of us, so we are going to just start plowing through it. Nothing says Monday like let's go. And then we'll have a little bit of Zoom room, etc. Okay. All right, day 5, Lindsay Clancy. All right, law lovers, lovies, let's go. Let's go. Maybe. Are you gonna get your stuff together? Okay, it's gonna be just fine.
Hey. All persons having anything to do before the Honorable William Sullivan, Justice of the Superior Court, now sitting in Plymouth, within for the Commonwealth. Draw near and give your attendance, and you shall be heard. God save the Commonwealth of Massachusetts. This court is now in session. Please be seated.
Good morning, Your Honor. May I proceed?
Yes, please.
Your Honor, before the court today, we have the continuation of the jury trial in the matter of Commonwealth versus Lindsay Clancy. Ms. Clancy is present. She is represented by Attorney Kevin Reddington. The Commonwealth is represented by Assistant District Attorney Jennifer Sprague and Assistant District Attorney Shannon Buckingham.
All right. Thank you, Madam Clerk. Well, good morning, everyone. I hope everybody had a restful weekend. So what I want to do is just kind of tell you, first I'm going to go through those questions, make sure everybody was able to follow my instructions. Then I'm going to go over what today's schedule is, and then we'll return to the Commonwealth's presentation of evidence. All right. And so let me ask those questions. First question: has any member of the jury read, seen, or overheard anything from any source about any aspect of this case that would affect your ability to be fair and impartial? All right. Next question: is there any other serious matter or concern bearing on your service as a juror in this case that anybody needs to bring to my attention? All right. Again, thank you for following those instructions. Now, today's schedule. Let me say first thing about schedule. I know I haven't always been completely correct on some of the schedules.
Yes.
But I want to just let you know that those decisions about the scheduling is on me. All right. And sometimes I have to take into consideration other factors or things that are going on. So what I really wanted to tell you is that don't speculate why we might go a little late or a little early on any certain days, but certainly don't hold it against either side in regards to that. The person who's making those decisions or that decision is me. All right. So you should be aware of that. So that being said, the thought is today we should go into the afternoon. All right. And if that changes, I'll let you know. And what we're going to do at this point, we're going to return to the Commonwealth's case. And with that, Commonwealth, call your next witness, please.
Your Honor, the Commonwealth will call Michael Snyder.
Okay, number 18, Michael Snyder.
While we're waiting for Dr. Snyder, can we just approach?
Oh, sure, yeah.
Thank you. Apologize.
Can we approach? even though we were sitting here for doing nothing. Sorry. It's Monday. It's Mondaying already.
Good morning. Do you solemnly swear that the testimony and the evidence that you shall give to the court and the jury will not find between the Commonwealth and the defendant without confusion? Thank you. You may have a seat, sir.
All right, good morning, Doctor.
Good morning.
All right,
May I inquire?
Attorney Buckingham, please.
Thank you. Good morning, sir. Could you please tell the jurors your first and last name?
Yep, Michael Snyder,
Do you mind spelling your last name for the record, please?
Snyder.
And how are you employed?
I'm a physician at Beth Israel
And how long have you been a physician?
since 1998.
Can you tell us a little bit about your educational background?
So undergrad at UMass Amherst, I did medical school at Tufts University, and then I did my residency in emergency medicine at Boston University.
And how long have you worked at Beth Israel?
Since 2014, 12 years.
And do you primarily work in the emergency department?
Yes,
I'm going to draw your attention to January 24th of the year 2023. Do you recall working in the emergency department on that day?
yes,
And in the evening, were you made aware of multiple pediatric traumas that were coming into the emergency department?
yes.
And when you are made aware of people coming in, how does that occur?
So we'll typically get a call on the EMS phone that something's coming in that they want us to know about up front.
And do they provide you with some basic background information about what's occurring or what occurred on scene and what's occurring during the transport?
When possible, yeah.
And when the emergency personnel, the EMTs or paramedics arrived at Beth Israel, there were 3 patients, correct?
Correct.
And you were assigned to treat 1 patient.
Correct.
Do you recall which patient that was?
Cora?
And prior to EMS arriving, did you learn more about Cora's presentation and what was occurring?
Yeah, so we had heard that, all 3 were in cardiac arrest, and the Cora in particular, they were still working on doing CPR and doing what we call pediatric advanced life support, so medications to try and restart the heart. And they also mentioned that they had used what we call a defibrillator to shock the heart to try to restart it. And they were still doing CPR when they were arriving.
And is this information important to you as you're assessing a patient coming into the emergency department?
Yeah, it's important to know, what things look like in the field, how long the patient might have been without a pulse or how long they may not have been breathing for, so we can kind of expect or know what injuries to look out for, what we can potentially reverse.
And were you aware of the age of Cora?
Yes.
And she was 5, correct?
Yes.
And as far as the medications that you were aware of, what medications had been provided?
So prior to coming to us, she had been given epinephrine, which is the primary medication we use in a cardiac arrest.
And do you know how they had administered that medicine to her?
Yeah, so she had what we call an intraosseous device in her right tibia. Sometimes it's very difficult to get an IV in, so we can go directly into the bone or the bone marrow.
And were you aware of whether she had been intubated en route?
So she was not intubated en route.
When she arrived at the emergency department, were you there to greet the ambulance?
Yes.
And what happens when a patient comes in through the emergency department via ambulance?
So when the patient first comes in, we immediately have our team, start to sort of take over care so there's no gap. And then we also get a sign out from the paramedics and EMTs and any other staff that had been involved in the case.
And do you and your emergency room staff then perform your own initial assessment of the patient?
Yes.
So what do you do for that?
So initially, we sort of go through our ABCs, airway, breathing, circulation. So initially, focusing on the primary things, such as making sure we're getting air and oxygen into the patient, keeping the heart going, so continuing CPR at that point.
And as far as Cora went, did you observe that she was breathing?
So she was not breathing on her own.
How about the heart? Did you observe that her heart was beating?
There was no heartbeat.
How about her physical appearance? What observations did you make of her physical appearance?
So initially, when she had come in, some of the things we notice is sort of a blue tint to the skin, which typically, we can see when there's less oxygen or lack of oxygen. And then the other things on a quick survey is there was some areas of bruising on the neck and around the eyes, called petechia, kind of little bleeding episodes of bleeding under the skin, and I believe a small amount of blood coming from the nose.
Were you able to make observations of her hands or other parts of her body?
So the hands definitely had that, what we call cyanosis or blue hue.
Now, as far as the eyes, you mentioned petechiae around the face and the eyes, as well as the neck. Did you notice anything else about her eyes?
So the pupils were fixed and enlarged.
Why is that significant to you?
So oftentimes when we see it coming in, it can indicate two different things. Some of the medications like epinephrine can cause the pupils to dilate, but also if the brain is starting to become damaged or not functioning, then you start to lose initially some of the signals that would make the pupils smaller, so they'll tend to start to get enlarged or dilated if there's brain injury starting or has occurred.
Now, you indicated that when Cora arrived, she was not intubated, meaning she did not have a breathing tube in. Did you and your team attempt to intubate her?
Yes.
And did you do that on your own or with the assistance of other parts of the emergency department or the hospital?
So we had anesthesia there. After we got the phone calls of multiple patients coming in, typically we'll have all the help that we could possibly need there to be able to take care of all the patients. So I had an anesthesiologist in the room with me who put the breathing tube in.
In instances where an individual might have suffered some sort of injury to their neck, does that complicate the insertion of a breathing tube?
It can, yeah, because normally you might need to move or tilt the head to get a direct view where you can put a breathing tube in. But when there's a concern for neck injury, we stabilize it typically with a collar or manually. So you don't have the ability to move the head and the neck around to try and get a better view.
Once a breathing tube was put in, were you and your team able to manually give breath to Cora?
Yes.
Now, did you then perform an assessment, a cardiac assessment of her?
Yeah, so in addition to listening to the heart, feeling for a pulse, we'll also tend to use an ultrasound machine in the room where we can kind of get a direct view of heart function.
And you were aware that they had defibrillated her twice in the ambulance. Why is that significant when you're treating a patient that's in cardiac arrest?
So when they defibrillate a patient, it's typically the heart's or might be in a rhythm where it can't pump blood. So it might be sort of out of sync or quivering, where we may attempt to use electricity to kind of shock it back into a rhythm.
Once you performed the ultrasound, the cardiac ultrasound, were there any attempts made further to use a defibrillator or?
Yeah.
Throughout your course of treatment with her, did you continue with various medications?
Yes.
And was CPR ongoing throughout your entire time with her?
Yes.
Were you consulting with any other colleagues or any other hospitals in regards to the care of Cora?
Yeah, so we actually had, in addition to all my colleagues in the emergency room, we had intensive care physicians from Children's that were on the phone with us, kind of working through any things that may have come up in the case, also expecting that they would be receiving the patients from us.
Is your hospital at the Beth Israel equipped to handle this type of pediatric trauma?
So we can do the initial stabilization, but then we need to ship the patients out to either get a specialty care or continued inpatient care.
And how long did efforts in treating Cora continue?
So in the emergency room, roughly 30 minutes.
And fair to say that all of the efforts that you made were not successful?
Correct.
And at approximately 1928 or 7:28, did you finally declare Cora deceased?
Yes.
Thank you. I have nothing further.
Anything?
I have no questions. Thank you, Doctor.
Thank you,
Thanks.
Doc.
Thanks.
All right. Clip that. StreamYard, clip that.
Commonwealth calls
All right.
Dr. Andrew Ferraro.
Hello, everyone, and thanks for joining. This was just our first witness, just in case if you're just like, oh my goodness. This was Dr. Michael Snyder, as you kind of heard. He was working on Cora. He used many methods to revive her. Well, they shocked her. They used epinephrine. She had no heartbeat. She was tinted blue. She had bruising around her neck, petechiae in the eyes. She had hand cyanosis, which were blue. Her pupils were fixed and dilated, and they worked on her for approximately 30 minutes. And unfortunately, she did not survive, and she was called at 7:28. All right, we are moving on to number 19. So if you're just joining me, hi, I'm Missy K. I bring you law cases. Let me know in the comments where you're coming in from, etc. And welcome everybody. By the way, if you didn't know, it's going to be a long day. You're like, oh no, this trial is just going to be a couple hours. No, they are going the full day. The Judge Sullivan, came on and stated how long things are going to be today. They've got all this morning. He didn't say when they were going to break, so he left that out. But they are going to go through this afternoon. They did state that. So we're in for a lot of people coming through today, which is this is the way a trial should go. All right, number 19.
All right, good morning, Doc.
Feme,
Yes, please.
thank you. Good morning. Can you please state and spell your name for the record?
My name's Dr. Andrew Capraro, last name Capraro,
And your date of birth, please?
July 9th, 1970.
What do you do for a living?
I'm an attending physician in the emergency department at Boston Children's Hospital
And how long have you done that?
for the last 26 years.
Can you just briefly describe for us the training and education you had to qualify for that role?
I went to Providence College undergrad and then went to Brown Medical School. Subsequently, I went to Connecticut Children's Medical Center for my pediatric residency and then did fellowship training in pediatric emergency medicine at Boston Children's Hospital from 2000 to 2003 and have been an attending there ever since.
And what's involved with being an attending at Boston Children's Hospital?
It means that I am guiding the care and treatment for the patients that I am seeing during my particular shift.
And are you assigned to a specific location or area of the hospital?
I'm always in the emergency department, and the emergency department is broken up into different zones, of which I am sort of the primary attending for one set of rooms.
I want to direct your attention to January 24th, 2023. Were you working that evening?
I was.
And at some point in time, did you learn that a patient named Clancy was going to be transported to your hospital?
I did.
And do you recall where he was being brought from?
From Beth Israel, Plymouth, I believe.
And was he being med flighted to your facility?
Correct.
And were you provided with some information about the patient in order to prepare for his arrival?
I was.
And what did you learn?
We have a communication center where facilities that are transferring patients to us call to let us know that the patient is coming. And so that comm center had been notified about this patient, who then got in touch with me as the attending who would be caring for the patient to let me know what had happened there and the condition of the patient when he was arriving.
And what did you learn about the condition of the patient, Clancy, as he was being flown to your hospital?
What I was told was that it was believed that the patient had been strangled, and when he arrived at Plymouth, he was in cardiac arrest, that they had intubated him and initiated CPR, and they had gotten return of spontaneous circulation, and that they were then going to transfer him to us for further evaluation and care.
And at some point in time, did Callan arrive at your hospital?
That is correct.
And were you able to observe him physically?
Yes.
What observations did you make about his physical condition?
He was cold on arrival, and he was quite limp, was not making any purposeful movements on his own. His pupils were fixed and dilated, and he had ligature marks about his neck with some swelling of the neck.
And his pupils being fixed and dilated, is that medically significant for you?
Yes, it is.
And why is that?
It typically means that significant injury has happened to the brain, such that there is brain swelling that has sort of what do I want to say? It has overwhelmed the capacity of the skull, such that the swelling has made the brain sort of herniate through the base of the skull.
Does that mean the brain's swelling so much it's pushing through the skull?
Correct.
And what observations did you make of his heart rate?
His heart was beating, and we did have to provide him with an epinephrine drip to keep his heart rate and his blood pressure within normal limits, but it was beating on its own.
And how did you know that you had to provide the epinephrine for him to stabilize that heart rate?
It was initiated at BI because they had noticed that his blood pressure was low, and you need to have normal blood pressure for the blood to perfuse your organs and keep them healthy. And so we were looking for certain parameters to sort of maintain that, which we did on that epinephrine drip.
And when you say BI, you're referring to Beth Israel?
Yes, I'm sorry about that.
That's okay. And so as far as his breathing, was he breathing on his own?
He had been intubated at the outside hospital, and he was needing a ventilator to breathe for him. Occasionally, he would have sort of a breath on his own, we would notice. We were able to see that because when he attempted to take a breath on his own, he would trigger the ventilator to continue that breath. But it was rare. For sure, he needed the ventilator to maintain his ventilation.
Would it be fair to say that the majority of his breathing was being done by the ventilator?
Yes, the vast majority of his breathing.
Now, once you have received this information while he's coming in, and then you've made your own physical observations of Callan, are there certain tests that you have run on him?
Yeah, our job once we received him was to perform further evaluation and stabilization to help determine what the next steps of his medical care would be. So prior to him arriving, we had contacted our trauma team and our ICU doctors to let them know that he was coming and that we would need their assistance. And then under my care, we performed some routine blood work, so a head CT, a neck CT, and a chest X-ray to sort of help us guide the next steps.
And from the head CT and the other testing that you did, what were you able to learn from the results of those tests?
The head CT in particular showed significant brain swelling consistent with hypoxic ischemic injury, which was which was the most significant finding that we found.
So could you please explain for us what is hypoxic ischemic injury?
Hypoxic is just a fancy word for not getting enough oxygen, and ischemic is just a fancy word for not getting enough blood flow. And so when your organs don't get enough oxygen and blood, they sort of suffer injury and therefore get to swelling. And so his brain was showing evidence of that.
So would it be fair to say that his brain wasn't getting enough oxygen and blood flow, and then because of that, it was damaged and swelling?
Correct.
Now, this type of swelling and injury, as you're describing it, can that be caused by strangulation, the injury of the brain?
Most certainly.
And you mentioned earlier that you did see some marks around his neck. Is that correct?
Correct.
And what were those consistent with?
Strangulation of some sort, most likely from an object, based upon the linear aspect of the bruising.
And when you say the linear aspect of the bruising, does that mean it's in a straight line?
Correct.
Now, once you had the results of this testing, was there, did you make a decision on what to do next?
Yeah, the main thing was to help us figure out, did the patient need to go to the operating room for some sort of other procedure to help with this, or was this something that could be dealt with medically? And so once we had the results of the head CT and then the neck CT as well, it was felt that the next appropriate step in his medical care would be to be transitioned to the intensive care unit for them to take over care.
Why was it that surgery was not an option to help Callan in this situation?
Yeah, the neurosurgery doctors were there to sort of help us make that decision. There was no significant bleeding, for example, that would need to be evacuated. There was nothing that they felt from a surgical point of view would help alleviate the problems that we saw in the CT.
Okay. And so was his care transferred to the ICU?
That is correct.
And once Callan was transferred to the intensive care unit, did your care for him end at that point?
Correct.
I have nothing further. Thank you.
Thank you. Mr. Reddington?
No questions. Thank you. Doctor.
Thank you, Doctor. Please step down.
StreamYard, clip that. Okay, that was Dr. Andrew Caparo, who was taking care of Callan in the emergency room. So you can kind of see that they're calling people in to talk about the care of Callan. So just spoiler alert, Callan was there for a couple of days before he was pronounced. So we're going to see what doctors were caring for him and then the one who pronounced him. So that's kind of the progression. Thanks for joining me.
All right, good morning, Doctor.
Good morning. Morning, Hunter.
Treat Sprague.
Thank you. Good morning. Can you please state and spell your name for the record?
Surely. My first name is David. My last name is Casavant. It's spelled Casavant.
And your date of birth, sir?
5263.
What do you do for a living?
I'm an ICU physician at Boston Children's Hospital.
Can you briefly describe for us your educational and training background?
Sure. I went to college out at Holy Cross in Worcester and then to medical school at Boston University. I did my initial pediatric residency at Mass General Hospital, and then went back and did a fellowship in ICU medicine at that hospital as well.
And where do you currently work?
I currently work at Boston Children's Hospital in the medical surgical ICU.
And how long have you worked at Boston Children's Hospital?
18 years.
And have you always worked in the ICU there?
Yes.
I want to direct your attention to January 26, 2023. At that point in time, did you take over the care of a patient named Callan Clancy?
I did.
And prior to taking over the care of Callan Clancy, did you do anything to familiarize yourself with his treatment and care?
Yes, I did. One of my colleagues had taken care of him the day before in the ICU, and I spoke with her, and so I was familiar with his case.
Okay. And did you also review reports and testing that had been performed while he was at the hospital?
Yes, I did.
Okay. And after reviewing the reports and the test results and speaking to your colleague, can you tell us what you learned from all of that?
It seemed that Callan had a severe neurologic injury based on both testing and the examination that I did at the time.
And when you say a neurologic injury, is that a brain injury?
It's a brain injury. Yes, it is. Yeah.
And did you review specifically a head CT scan of Callan?
Yes, I did.
And what did the head CT scan show you or tell you about his condition?
The head CT is a picture of the brain, which was done in the emergency room when he was admitted to Boston Children's Hospital, and the CT scan showed an enormous amount of swelling of the brain itself.
And that the swelling of the brain, is that medically significant?
Very much so. When you have an injury to the brain that is caused by anoxia, which means a lack of oxygen, I describe this with families that the injury is very much like being out in the sun. You don't notice it at the time, but swelling occurs over the course of time. And one of the things with a lack of oxygen to the brain is the injury occurs and then swelling starts to happen over the course of time. Typically, typically peaking at 48 to 72 hours. When you see swelling that happens that early in a case, as in Callan's, it means that there's been a very significant lack of oxygen and therefore injury to the brain itself.
So, for example, some types of injuries that would withhold oxygen from the brain would be more mild and the swelling would occur over time. Is that correct?
That's exactly correct, yes.
So if a severe injury happens that withholds oxygen from the brain, that's when you see that immediate swelling like Callan had?
Very much so. Sort of the comparison of a sunburn to a burn that you might get from a stove. This was a stove. It's very, very profound.
Did you perform a physical examination of Callan?
I did.
And what did you observe?
Well, one of the first things that I noticed as I approached him was that he had a breathing tube in place, and I knew from my colleague that he was not on any sedation, which is very difficult to tolerate, having a breathing tube through the vocal cords if you're not sedated, and he was not sedated at the time. The next thing is that when I approach a patient in their bed in the ICU, we always start with a quick introduction that we're going to be coming near them in case they're asleep. And I usually start with something along the lines of, I'm Dr. Dave, I'm just going to listen to your heart. And I'd usually address them by name and to see if they start to respond. And then I'll go ahead with the rest of the exam, but that's just to sort of warn them that someone might be touching them. And then they'll listen to heart, lungs, and then to move forward to see if how responsive they are. So if you get no response at all from the initial, just using your voice, the next thing is and then from the exam, if they don't move around, then you start to sort of think, well, let's see how responsive they are. And so the next thing is sort of a gentle touch off into the bottom of the foot to see you stroke the bottom of the foot and you see if they pull away. And then you can move. If you get no response from that, we'll do something that's a little bit more noxious or painful, where you can sort of pinch a little bit of skin to see if they start to react, or pushing on the fingernail and the nail bed pressure, which is actually very noxious. And if you can see two types or several types of response, either no response, or you can see a very specific response where they pull away from that area. And that's a specific, or you can see generalized response, which are all sort of graded, graded along those that as we're sort of getting a sense for what their level of consciousness was.
So if I could go over a few of those things that you just mentioned.
Sorry.
You said that that the first thing that you noticed that was significant was that Callan had the breathing tube in place through the vocal cords.
Yes.
Without any sedation. So without sedation, would having a breathing tube in that place cause pain?
Yes. No one would be able to tolerate it.
And so Callan was able to tolerate it without any sedation.
Yes.
Would that indicate he wasn't feeling that pain at that time?
Yes, exactly.
And you mentioned that you would address the patient by name and talk to them. Was there any reaction from Callan when you did that?
No, there was not.
And then you mentioned you would rub maybe something along the foot. Was there any reaction?
No, there was not.
And did you do what you described in pinching the fingernail or pinching somewhere on Callan to see if he responded?
Yes.
And did he respond?
No, he did not.
And what did these interactions and tests on Callan tell you about his condition?
This told me that he was unresponsive. He was unresponsive to both things that would cause discomfort and things that would cause pain.
Did you also do anything in terms of looking at his pupils and any tests on his eyes?
Yes. So after all the other things that we look at the pupils, and so one of the things is we have it's a reflex response. If a light is shown in an eye, the pupil constricts. And what I noted about Callan was that his pupils stayed widely open and did not constrict.
And when someone's pupils stay open and wide when you shine a light in them, what does that indicate medically?
Well, the eyes are a direct extension of the brain, so that's why we focus a lot on them as an area of investigation. And the lack of a response to light indicates that there's that there's some abnormality to that, and in this case, it was a brain injury. You can also there's medications that can keep your eyes open if you've ever had an eye exam, but that was not the case with Callan.
And just to be clear, when you're talking about brain injury, we're not talking about some type of trauma that was inflicted on the brain. You're talking about the lack of oxygen and blood flow causing an injury to the brain, correct?
That's exactly correct. Yes.
At that point in time, did you work with another doctor to do more in-depth testing regarding his neurological status?
Yes. So at Children's, we have multiple teams that come together for a patient, for many patients. But for Callan, the neurology team was there from the beginning. And when in a case like this, when we see no response in an unresponsive patient, we start to get our neurology team. And one of the things we start to do is brain death testing to see if they could be what we call brain dead, meaning that the brain itself is not functioning, and that even though their heart is still beating.
How is it that someone's heart can be beating if their brain is dead?
It's a really good question. So there's actually two parts to the nervous system. The one is the part that we see the most in people when they react, and they react to us and they speak and they do things. The other one is the autonomic or automatic system. And the automatic system is largely in charge of the things like the heart, if the heart has not been injured. And so it was sort of continuing on.
And does that give you any indication, the fact that the heart was still continuing on, about where the injuries were in the brain?
Yes, it does actually. Yeah,
Where would that be?
Yeah, so the large part of the brain that we sort of think of as when we see the pictures of the brain, that's the cerebellum, and that's the biggest thing in humans that is most developed, and that's in charge of our consciousness, our reaction to things, whereas the brain stem, which is another part, and that's really part of the autonomic system, and that's the same in almost all vertebrates and mammals. And it's much more automatic. And so it tells me that it seemed the cerebellum, which is that part that makes us sort of the human side of what we do, that's much more sensitive to a lack of oxygen, to an anoxic injury. And it told me that was really where that injury was in that part of the brain, much less so in the brain stem itself.
So would it be fair to say that the brain stem itself that controls those automatic responses was still functioning somewhat, but the part of the brain that made Callan was not functioning?
That's exactly correct, yeah.
And can you describe for us the brain death testing?
Sure. So the brain death testing at Boston Children's it's a very strict testing that includes some of the things that I just mentioned, but we work with our there's a checklist that we work on with our neurologic colleagues, and we sort of go through each of what we would expect for responses from someone, and we actually then work through different of the nerve sets that we would expect them to respond to. We have it set up so that there's an ICU physician is there, and then a neurologist is there, and the neurologist and the neurology team, they're the ones who perform the brain death testing. And then the test is then repeated again 24 hours later, just to make sure that there's no piece of that is different or incongruous with a diagnosis of brain death.
And while the neurologist is doing this testing, are you there present, watching the testing and seeing the results as it happens?
Absolutely, yeah. So we're sort of committed to being there for the whole time. And the brain death testing itself goes through some really basic things. Again, as I described earlier, the things that would be painful, and do they pull away or not? The eyes, looking at the reflexes of the eyes. There's also other reflexes too. Things like if you stroke the cornea, which is the front of the eye, people blink, and that's so the blink reflex, cough, gag. There's also a reflex where they actually put cold water into an ear, and that gives people a disequilibrium. And so those are all the things that we think about. And then also there's some breathing components to that as well.
Is one of those breathing components an apnea test?
Yes, it is. Yeah.
And what is an apnea test?
So apnea is a word that just describes not it describes a lack of breathing.
And how do you test that?
So in a patient such as Callan, what we do, and in any patient when we're doing brain death testing, what we actually disconnect them from the ventilator. And the reason that we do that is we want to see if that autonomic system in the brain will start to react as the carbon dioxide starts to increase. So our body makes carbon dioxide all the time, and the way we get rid of it is by exhaling. And where we breathe in fresh oxygen, and then we breathe out CO2. And what we do is we disconnect from the ventilator to see if, knowing that their carbon dioxide will start to rise, and the normal response for that autonomic part of the brain would be to sort of increase breathing. That's why we breathe when we sleep, because as we go to sleep, the conscious part of our brain stops, but the autonomic part kicks in, and then we breathe right through our sleep because that carbon dioxide rises.
So in a patient who has brain death, would it be accurate to state that as the carbon dioxide level increases, the automatic response would be to take a breath to get more oxygen, but a patient who's brain dead won't do that?
That's correct.
And did you do all of these tests, or did the neurologist do all these tests on Callan while you observed?
Yes, they did. Yeah.
And did he have any response to any of the physical tests where you were looking for a reflex or a reaction?
No, he did not. No response to any.
And what was his reaction or results on the apnea test?
So the apnea test, again, we do all the brain testing one day, and then we wait at least 24 hours for the second one. The first, and what we expect with the carbon dioxide is that it will increase. We have it written in our, so it's all in writing for our protocol, that it will increase by 20 or get to a level of 60. A normal CO2 would be around 40. And the first time we did that, on the first day, it actually went to 59.7, not 60. And again, it was in our protocol as has to get to 60 or increase by 20. And I actually talked to my colleagues, including neurology. I said, I know this is very close. It's 59.7, but it's not 60. I repeated that piece of the test later on that day to make sure that it was valid. And as I say, I checked with everyone to make sure that I was doing the right thing. They all agreed that we should just, and the second time it went to 87. So that was, everything else was the same. And we made sure that there's things that we look at too, to make sure that there's not on any medications, that there's no changes in his temperature, there's no abnormalities of the salts in the blood, what we call the electrolytes. So all those conditions were the exact same. And I repeated that later on in the day, and it did come back positive.
Why is it so important that you meet that specific criteria? Why is 0.3 of a point so important?
Well, I wanted to make sure that there was no question about the data that we were gathering at the time.
And you said that this testing is again repeated 24 hours later, correct?
Yes, it is.
Why is that?
Well, that's just to make sure that if there were any lingering effects of medications, if there was anything that else might have changed in the patient's level of alertness or level of response, to make sure that it still meets all those requirements 24 hours later.
And is it because you want to be sure that there's brain death before you remove life support?
Yes, and again, it's too important. It's too important a discussion and a gathering of data to not be very exact about it.
And so when you did observe the testing and then the following day on Callan, were the results the same in terms of no reaction and the carbon dioxide increasing?
Yes, they were.
And at that point in time, did he meet brain death criteria?
He did. He met. So we had determined that it was that he had met death by neurologic criteria.
And at that point in time, was a decision made to stop life support.
Yes, it was.
And that's done in consultation with the family, his father, correct?
Yes, that's true.
Okay. And was life support ended for Callan Clancy on January 27th, 2023?
It was, and one of the things is there's when you determine that someone has met criteria for neurologic brain death, that although we know that their brain is not functioning at that point, there's often a period of time where we don't have to remove, his heart is still beating, so we don't have to remove the endotracheal tube at that time, and we often will give families, once it's been confirmed that the brain is no longer functioning, we often give families a period of time to able to process it, and a window of time. Sometimes there's relatives who will need to travel and things like that, and so we'll often then choose a time later on to accommodate the rest of life, knowing that they're stable at the time to when we would actually remove the tube, and that would be the declaration of death.
And was that done in this case? Family was given an opportunity to see him, and then life support was ended, and then his heart stopped.
Yes, that's
And
exactly.
he was declared deceased.
Yes.
Thank you.
Attorney Reddington? Thank you, sir. Thank you, Doctor.
Thank you so much.
StreamYard, clip that. Okay, so that is super heavy, right? So in looking at this, they needed to make sure that they did everything that they were supposed to do in order to they were doing everything that they needed to do in order to sorry, I'm trying to get this. It's not working. All right. They were doing everything they could to try and make sure. So he's on life support, right? Callan's on life support, and they want to do everything that they can to make sure that he is totally incapacitated, right? They've done all the neurological tests, the pinching, the whatever that's responsive to pain, etc. He's on no pain medications, and yet, you know, he was kind of breathing on his own to an extent, and then he wasn't. He was on life support, and they have to go through all of these tests in order to make sure that can he survive on his own, even for a short period of time? And the answer was completely no. And so I liked how the doctor explained, oh, well, you know, we give the family some time to come in and be with the patient before they terminate the life support. And so that is why Callan wasn't pronounced until the 27th versus the 24th with the other two children. So that's why the extended day. Okay, so that was witness number 20. We're going to continue on. Maybe.
Your Honor, at this time, the Commonwealth would move to admit the Boston Children's Hospital records for Callan Clancy into evidence. There's 2 volumes.
Objection.
Your Honor, I have no objection because we both have the records. We both want them in evidence, so I have no objection to any of the records that they have. We signed releases for them. For like Beth Israel, Brigham and Women's, South Shore, they all can go in.
That's a yes.
It may be admitted.
That's a yes. Yes. Yes, they can come in.
Yeah, I went to A and B. Yeah.
37A and B.
All right, thank you.
both would call Kelly McDonough as staff's witness.
I'm sorry, if you say the name again?
Kelly McDonough.
Okay, sure.
All right, Kelly McDonough.
Hey, good morning.
Good morning.
May I inquire? Thank you.
Yes, please.
Good morning. Could you please tell the jurors your first and last name?
Kelly McDonough,
Can you spell your last name for the record?
MCDONOUGH.
And what do you do for a living?
I'm an emergency medicine physician.
And how long have you been a physician?
11 years.
Can you tell us a little bit about your educational background?
I went to medical school at the University of New England in Maine. I did my residency at Kent Hospital in Rhode Island. I subsequently worked at Kearney Hospital in Dorchester, and I've been at South Shore Hospital since 2021.
And in what, are you primarily in the emergency department at South Shore Hospital?
Correct.
Have you been in any other department at South Shore Hospital?
No.
Are you licensed to practice in Massachusetts?
Yes.
I'm going to draw your attention to January 24th of 2023. Were you working in the emergency department that evening?
I was.
At some point, were you advised that a patient was being brought into your emergency department?
I was.
And were you aware of that patient being Lindsay Clancy with a date of birth of 8/11/90?
Yes.
And what kind of information were you given upon learning that the patient was coming here? What were you expecting to receive?
I was expecting a trauma 1 response, a patient who had fallen out of a window from a height and didn't know much more than that.
Okay, and so when you say trauma 1, what does that mean for you?
So we had 2 designations for trauma responses, a trauma 1 and a trauma 2, and there's certain criteria for each. And there's a long list of criteria that are determined by the resource nurse who receives the EMS call.
Okay, and so when we say 1 and 2, which is more serious than the other?
Trauma 1.
And so what do you do to prepare when a patient is coming in and you know coming in that it's likely a trauma 1 situation?
So we gather in the trauma room and make sure that we have all available staff needed to take care of the patient.
And what kind of staff are with you in the room, in the trauma room?
So for a trauma 1 response, it would be the emergency medicine physician, it would be anesthesia, the trauma surgeons, sometimes neurosurgery will be there.
And fair to say you also have a whole host of other staff, including nurses, emergency room techs, all of those people are also available to assist and if you need it.
Correct.
Now, when this individual came in, when Lindsay Clancy came into the emergency department, were you aware from EMS that she had already come in with some sort of neurological deficits?
I think that from my best recollection, we knew that she was unresponsive, found down outside of her home.
Were you advised that it appeared she might have a spinal injury?
Yes.
And that she was not she may have been moving her arms and her head, but not her legs.
Correct.
Now, when the team was assessing her in the emergency department, what types of steps do you take to perform that assessment of the patient?
So there's a series of steps that we go through to assess a trauma patient that are followed every single time. ABCs, airway, breathing, circulation, and then we do a secondary survey.
Okay. And in this circumstance, was the patient breathing?
Yes.
And when she came into the emergency department, was she breathing on her own or intubated?
She's breathing on her own.
At some point, did the ER staff have to intubate her?
Yes.
And why was that?
For airway protection, there was a concern that maybe she would have a head injury and she would decompensate later. And so to protect her airway, she was intubated.
Now, is that a standard protocol when there's concern for head injury?
Yes.
Did you see any obvious signs of a head injury when she arrived into the emergency department?
No.
What kinds of things would you see if somebody had?
Okay, I don't know what just happened. I don't know if it was my earbuds. I'm having a issue today, but I all of a sudden didn't hear anything. 1 second, sorry.
Had an obvious head injury.
Okay, let me go back.
Did you see any obvious signs of a head injury when she arrived into the emergency department?
No.
What kinds of things would you see if somebody had an obvious head injury?
You might see bleeding or lacerations or abrasions.
Now, did you observe any other obvious injuries to this patient?
I did. She had some superficial lacerations of her neck and wrists bilaterally.
Do you recall if she came in on a backboard with a C-collar?
She did.
And do you remove the C-collar at some point to assess the patient for injuries?
We didn't completely remove it temporarily to visualize and feel her neck and then put it right back on.
Okay, and you said you did observe some injuries to her neck, correct?
Yes.
I'm just going to show you some photos that have been marked. That's okay, on the screen next to you. This has been marked as exhibit number 111. Is that an accurate representation of the neck injuries you observed?
Yes.
You also indicated that she had some other injuries to her wrists.
Yes.
And I'm just going to show you 112. Is that accurate as to the injuries to the wrist you observed?
Yes.
Now, you described the injuries as superficial. The injury that's kind of in the middle of the photograph there, can you describe what part of the body that injury is?
You're describing the one that's sort of open?
Yes.
Yeah, so that's the anterior aspect of her wrist.
And were you able to examine that injury?
Not in detail.
Okay. Was it something in your emergency, your assessment of the trauma 1 situation, was that something acute that you had to address?
No.
And is it fair to say that that injury goes through kind of the subcutaneous tissue of the skin?
Yes.
Did you observe any injuries to an artery or a vein or anything in that area?
I did not.
And then just showing you exhibit 113, which is the other wrist. Same thing. Did you observe anything in your assessment, your trauma 1 assessments, to say whether these were acute at the time?
I assume that they're acute.
Okay, but as far as treatment of them, did they require you to immediately address it
No.
or manage blood flow?
Mm-mm. No.
What was the more serious, or what was the focus of your assessment of her in the emergency department?
I think the main concern was for a head injury and or a spinal cord injury.
And you said that as part of the assessment team, you had a neurosurgeon available as well as a trauma surgeon, correct?
There was no neurosurgeon there that day.
Okay. Was there a trauma surgeon?
There was.
Who was that?
Dr. Christina Carpio.
Did you order any series of tests in order to help you assess the nature of whether there was any head injury or what the extent of the spinal injury could have been?
Yes.
What kinds of tests did you order?
CAT scans.
As part of the emergency room protocol, do you also draw blood for patients that come in?
Yes.
And how is that usually done?
It's usually done on arrival by the nursing staff.
And do they draw blood according to a physician's orders, or do they draw blood for various purposes? Explain to us how that works.
So it's usually like what we call a rainbow. So they just draw all the tubes of blood as soon as the patient arrives in anticipation for orders.
Okay. And so what happens to the blood after somebody in the emergency department takes it from the patient? Where does it go?
It gets tubed to the lab.
And fair to say that at South Shore Hospital, they have a pneumatic tube system, correct?
Correct.
And that it goes to a separate laboratory.
Correct.
And once a physician then assesses a patient and determines what kinds of testing needs to be done on those samples, how do you communicate that to the laboratory?
So orders are put into a computer and they go through the computer to the lab.
And as you're treating a patient, is it oftentimes necessary to change the orders or order additional tests?
Yes.
And so in this particular case, blood and urine was collected from Lindsay Clancy upon her arrival, correct?
Correct.
And then sent to the lab.
Yes.
Now, going back to the imaging tests, you said that there were some CT scans that were ordered.
Correct.
What areas of the body were the CT scans for?
It was her entire body, her head, her neck, her chest, her abdomen, and her pelvis.
Now, as far as the CTs for her head, were there more than one CT test for the head?
I don't remember. I'd have to look at my record.
Well, what are the normal, or what are the options for CT head scans?
It's usually just a CT head plane, but you could also do a CT angiogram, depending on your concern for injury.
And do you recall which one you ordered here?
For a trauma, one, it would be a plain CT head.
And why do you order that particular test?
Well, we're trying to assess for skull fractures, intracranial bleeding, things like that.
And when you say a plain CT, what's the exact order that's put in for that type of a CT?
CT head.
Okay, and are there CT heads with contrast?
There are.
And are there CT head scans without contrast?
Yes.
And approach the witness. I'm gonna show you some documents, if that's okay.
Sure.
I apologize, there's no series of pagination, so I'm just gonna draw your attention to this page that's black. If you could just take a look at it. Sure.
Mm-hmm.
Okay, and I'm just gonna flip to the next page as well. The next page is blank, but is this the extent of what you would have received as far as information regarding a head CT that was done without contrast?
Yes.
And I'm going to just draw your attention again to another flagged page here towards the end. It's actually 2 pages from the end of the document, if you could take a look at that.
Mm-hmm.
And does that reflect the report you would have received for the head CT ordered with contrast?
Yes.
And in addition to getting a report from imaging, you also receive some actual images, correct?
Yes.
And do you review those?
Yes.
In this particular circumstance, when it came to the patient of Lindsay Clancy, was there anything remarkable in either of those head CTs?
Not that I recall.
And in fact, the head CT with contrast indicated the impression was unremarkable. CTAF had no evidence intracranial aneurysm, arteriovenous malformation, or abrupt occlusion, correct?
Correct.
What does that mean?
It essentially means it's a normal study.
Now, as far as the other CT scans that were conducted, there were findings, remarkable findings on some of the others, correct?
Correct.
And what did they reflect in your experience as far as her injury goes?
From what I can recall, I know she had a thoracic spine injury.
And how about the CT that was done of the chest area?
I don't recall.
If I may approach. Does that refresh your memory?
Yes.
And what was the extent of the results on the chest CT?
So it talks about her thoracic spine injuries.
Okay. Now,
Okay, I don't know about you, but this one's very painful. And I don't know if it's because the doctor's just like, I can only answer XYZ, or that this prosecutor is very clunky in her questions and answers. But again, I talk about, why is it specific that this person's coming to testify? What is it that the prosecution wants the jurors to know? And if it's clunky and it's all over the place, jurors tend to just zone out, which I am at the moment. What is it that you want the jury to know?
After reviewing all of the images, all of the CT scans that were done here, the cervical spine, the head CTs, the thoracic spine, what was the plan for this particular patient? Was she able to be treated further at South Shore Hospital?
The decision was made by the team that her injuries were too severe to stay at South Shore Hospital, and the decision was made to transfer her to a tertiary care center.
Were you able to stabilize her before transporting?
Yes.
Is that something that's important to make sure a patient is stable before sending them off in the ambulance or a helicopter?
Yes.
And so as far as this particular patient goes, are you aware of whether any surgical intervention had to be done before she was stabilized and transported?
I was not aware of any intervention being done.
And again, you had Dr. Carpio, who was also there to assess that.
Correct. We work as a team.
Kind of going back to those injuries on her neck and her wrist very briefly. Can you explain to us the difference between bleeding in maybe an artery or a vein and how that might present itself in an emergency situation?
Venous bleed would be a little bit slower, darker blood, and arterial bleed would be pulsatile and bright red.
And is it fair to say that when you strike either an artery or a vein that they're of different pressure systems, and so the manner in which the blood comes out is different?
Yes.
In either circumstance where an artery or a vein is struck or nicked or cut, would that be something that you'd have to stabilize for a patient in order to make sure that they don't bleed out?
Yes.
Was that done here?
It wasn't necessary.
Now, this particular patient at some point was noted to be, I think it was referred to as hypothermic.
Mm-hmm.
Do you recall that?
Yes.
Do you recall at what point in your treatment of her was that noted? Was it as she was coming into the emergency department, or did that develop while she was in the emergency department?
I don't recall.
What was the course of treatment for a low body temperature?
We placed something called a bear hugger on them, which is a warming blanket.
And can you explain to us what could cause a person's body temperature to drop to, I think it was 82.1?
There are many reasons, but it could be a metabolic disarray or exposure.
In this circumstance, did you know what the source of the drop in the body temperature was for Ms. Clancy?
No.
And do you recall how long she was in the emergency department before she was transported approximately to the Brigham?
I think it was about 4 hours.
At this time, Your Honor, I would move to enter into evidence a copy of the South Shore Hospital medical records for Lindsay Clancy from January 24th, 23 as the next exhibit.
Is that by agreement? All right. That may be admitted. Or they may be admitted.
Okay, so you asked whether or not about like if she was had a sense of hypothermia, and then you talk about like the bear blanket or whatever it is. Did she get that? Was she? You didn't answer that question.
And I would also move to enter as the next exhibit a certified copy of imaging records from the South Shore Hospital for Lindsay Clancy from January 24th, 2023.
It may be admitted.
So finally, Dr. McDonough, did this defendant receive surgery at South Shore Hospital?
Not that I'm aware.
Did you observe any cuts, abrasions, or blood on the area of her head?
No.
And based on your review of those findings on the CT scans, was there any noted injury from the head CTs that you could tell?
No.
And were you able, after using that bear hugger device, able to get her blood, her core body temperature back up to normal?
I don't recall.
did you ever observe those wounds that you observed on her neck or her wrists ever start bleeding actively again?
No.
I have nothing further.
Just ready to.
Okay, so thank you. In the end, you finally answered it. Oh my goodness. Okay, let's see if Reddington has anything to say.
Right.
Morning.
So, would you agree with me that when Lindsay was brought into the South Shore Hospital, that she was unconscious?
I recall her eyes being open, but she was nonverbal.
Okay. So, as an experienced emergency room doctor, can you tell me when someone's unconscious, what is that? What are the symptomology of it? What does that mean?
Usually means they're completely unresponsive with eyes closed,
Okay. Was she responsive?
not verbally.
Was she responsive at all?
She was responsive to pain.
So that means that you would do something to cause pain, perhaps the bottom of the foot or whatever it is, to see if they have a reaction.
Correct.
And would you agree with me that when people even have very, very serious brain injuries, that they can respond to pain stimuli
Sometimes.
sometimes? So her eyes were open. Were her pupils equal and reactive to light?
I don't recall.
You don't recall. What does it mean with PERL, pupils equal reactive to light? What does that mean?
Exactly what you just said. It means her pupils are equal and reactive to light.
And as a doctor, what does that tell you?
It tells me that there's no significant neurologic injury.
And in this case, you don't recall if her pupils were equal or reactive to light?
I don't.
Okay. And that's when you take the little flashlight sometimes and you put it over the eye and see if there's constriction of the pupil.
Correct.
Did you do additional evaluations of her to see what her neurological function was?
She was pretty quickly intubated from what I recall. So after that, it would be difficult to assess her neurologically.
Sure. Was she on any pain medication, if you remember?
I don't remember.
You recall, did she have difficulty being intubated? I mean, would you agree with me that if you're not under some type of medication or sedation or unconscious, it hurts to be intubated, doesn't it?
We wouldn't intubate somebody without first giving them some induction medicines.
Okay. So what would the induction medicines be?
They're not universal.
Well,
That would depend on the
what are the
case.
induction medicines that you used on Lindsay Clancy?
I don't know. I'd have to refer to my record. And also, I wasn't the one who did the intubation.
So she was intubated, had the tube coming out of her mouth. She's laying on the table, and you are continuing an assessment. You were the lead doctor in the emergency room for Lindsay Clancy, right?
I wouldn't say I was the lead. I think the trauma surgeon and I worked together.
Right. Her temperature, her core body temperature was 82 degrees. Is that right?
If that's what the record states, then yes.
I'm sorry?
If that's what her medical record states, then
Well,
yes.
as you sit here, you don't know what her core body temperature was?
I saw her 3 years ago. I see about 200 patients a
I'm sure you're very busy, but this is a murder trial.
Oh my goodness. Reddington is giving it to her. This doctor, she's just like, I don't know. I don't know. I don't know. I don't know. Like, I'm too busy. I'm busy. I don't even know why I'm here. My gosh. Let me know in the comments what you think about this doctor. She's just like, she's so evasive. I don't know why. And also, you know what? Give her the medical report. Will this refresh your memory? So again, we ask, why is this doctor on the stand? What's so important that the prosecution, because she's called as a prosecution witness, needs to testify to? And I'll tell you, it was all about the wounds, whether or not her wounds needed to be tended to, whether they're superficial or not. I think that is primarily what it is. But Reddington needs to get to, these were her injuries, et cetera, et cetera, et cetera. So I'm going to go back. I'm going to back up. So hang on.
Doctor.
medical record states, then
Well,
yes.
as you sit here, you don't know what her core body temperature was?
I saw her 3 years ago. I see about 200 patients a
I'm
month.
sure you're very busy, but this is a murder trial, doctor. Did you review your records and your notes?
I'm happy to look at my record if you bring it here.
Did you review your records and notes before you came in here today to testify on this case?
Sir, I did, but I don't have a photographic memory.
Did she regain consciousness at all while she was in your emergency room?
No.
Can you tell me what CSF is?
Cerebrospinal fluid?
Yeah. Is that what that is?
But it
CSF?
could be. I'm not sure in what context you're referring to it.
Well, how about if there's a massive leakage of CSF from her nose? What does that tell you as a doctor?
It could mean that there's a skull fracture.
Did you notice any clear fluid coming from her nose?
I did not.
Is that something you would look for?
Yes.
How quickly do you get the results of the x-rays when you're in the emergency room?
Well, these were CT scans, but fairly quickly in a trauma.
I'm sorry, CT scans, x-rays. So you had CT scans that were able to show you the damage to her neck and upper chest, is that right?
Yes.
And what did those CT scans show you?
Well, what I remember is a thoracic spine injury.
And when you say a thoracic spine injury, would you agree that top part of your neck, your throat area would be cervical, right?
Correct.
And that's when the numbers go C1, 2, or whatever they are. That would be the actual vertebrae in the cervical area of the upper body, correct?
Yes, the cervical spine.
Okay. And then below the cervical spine would be the thoracic spine. Is that correct?
Correct.
And the thoracic spine would be, and sometimes they're delineated as T1, T2, meaning thoracic 1, thoracic 2, all the way down to what, 5 or 6?
12.
I'm sorry?
12.
12. So when you looked at, and the lower portion would be the lumbar, is that right?
Correct.
Now, when you looked at the CAT scans, did you determine the extent of the injury to the spinal cord?
I could determine the extent of the injury to the bony thoracic spine.
Okay, what was that?
I don't recall exactly the level. I would have to look at the report.
What does that mean? The level of the T?
Correct.
Was her cervical spine injured?
I don't recall. I'd have to look at the report.
Were you aware that her thyroid was crushed?
I don't recall.
Do you know that her cervical spine vertebrae was fractured, destroyed?
I don't recall.
Doesn't that control a person's breathing? Does that have anything to do with breathing?
It can.
I'm sorry. I'm just laughing all the way. I don't recall. I don't know. This was 3 years ago. I don't remember. Oh my God. Did you review your notes? Yeah. I don't recall. Show her the notes. If you want this information in, show her the notes. I don't know why she's being so combative. I mean, that's the word that I'm using. So I don't know. Oh, Christina, this is, Dr. Kelly McDonough. She was the ER physician at South Shore Hospital when Lindsay Clancy was brought in. So she was treating Lindsay. She, with another neurologist, was treating her. And then they prepped her to go transport to another hospital. So I don't know how long she was in the custody and care of this doctor. But obviously she wasn't very memorable.
What do you remember about looking at the damage to the spinal cord depicted on the CAT scan?
What sticks out most in my mind is her thoracic injury.
Okay, and what was the thoracic injury?
I don't recall the exact level.
What does it mean by effect level?
The exact level.
I'm sorry. Were you aware that there was a complete transection of the spinal cord on T5 and T6?
I'm sure I was aware at the time, yes.
Okay. And just, can you tell me what does it mean when it says a complete transection of the spinal cord at a particular, apparently that would be at thoracic 5 and thoracic 6, right?
Mhm.
What does that mean with a complete transection?
It means the bones are no longer one on top of the other. They're moved apart.
Were you aware that there was a significant edema noted in her chest?
If that's what the report says.
Okay, and what is edema?
Swelling,
And does it also refer to fluid?
it can.
Did it refer to fluid in this case?
I'm not sure. I would have to read the report.
So in addition to the edema that was noted, was there edema noted around C7, T1, T2, T3 to T4?
Again, I would have to have the report in front of me.
When you noted her base temperature as being 82 degrees, what does that tell you as a doctor?
It means that her body temperature is lower than normal,
And what is normal?
98.6.
And if a person goes from 98.6 to 82 degrees before you place her in the bear hugger, what does that tell you? Does that affect the body at all?
Yes, the body works ideally at 98.6. So anything outside of that range, not ideal.
To what effect as a doctor? What effect, if any, on the body if a person has an 82 degrees base temperature?
The list of things that could go awry is quite long.
Can you give me an idea, maybe the top three?
She could have a metabolic derangement,
What's a metabolic derangement?
meaning her body wouldn't be processing things the way that it was before. Her cells are not working the way that they should because it's too cold.
Would you agree with me that when you were looking at the injuries to the wrist and to the both wrists, actually, you noted lacerations in the volar aspect of the wrist?
Yes,
What is a volar? What does that mean?
it's the anterior aspect. of it.
Interior? Okay, thank you. Would you agree that on both wrists there was deep laceration?
I wouldn't characterize them as deep.
You would not? And when you made reference to her being transferred to a tertiary care center, what does that mean?
It means that it's a hospital that has more services and specialized care than we do at our hospital.
Now, when she was at the South Shore Hospital, counsel asked you about whether or not you noted any injuries to her head. You did not notice any bleeding or scrapes or bruises of that nature, right?
Not that I recall.
Did you notice any injuries to her lower body, her legs, her feet, let's say her feet or her buttocks?
I don't recall.
Oh my goodness, this is so painful. I'm trying to think. Okay. I'm trying to think why she's so combative in this. And I think that she just wants to be precise. She's a doctor. So he wants her to speculate. He wants her to speculate to say, "Oh, well it could be this or it could be that." And she didn't give an inch to the prosecution. She's not giving an inch to the defense. She's just there to talk about what she did and treated Lindsay Clancy. So she wants to be specific. If she can't look at her report, so what you're supposed to do is you're supposed to review your report before you get on the stand. You're not going to know everything. And so if they want something very specific, that's why she keeps saying, if I could look at my report, I don't, you're not getting blood from turnip in this doctor.
At any time while she was at South Shore Hospital, did she have a cardiac arrest?
Not that I recall.
Do you know she had a cardiac arrest when brought to the Boston Hospital?
Did not know that.
How about blood? Was there any blood transfusion at South Shore Hospital Medical Center?
I don't recall.
Are you aware that she had a massive transfusion of blood once she hit Brigham and Women's?
No,
What does that tell you? Massive transfusion of blood. What does that mean?
I couldn't comment on why they gave it to her.
Okay, I often talk about why they're asking certain witnesses questions that don't pertain to them. right? They're doing this often, right? Did you know this and did you know that? And I talk about, this is where I say that the lawyers are testifying, right? Did you know something that occurred over here? And she can't testify to that because she wasn't the medical doctor who transfused her, right? But they're getting it in, even though, so lawyers' questions aren't evidence, but the jury hears them. And to me, I perhaps maybe the judge might make some sort of statement to them, but depends on when they make the statement. They might not remember, and so they might remember a question that was asked and what the answer was. And in that context, you let me know what you think. In that context, you hear that, and you cannot unhear it. Right? Once the bell is rung, you can't unhear it. Once the horse is out of the stall, it's hard to get him back in. So again, these are lawyer tactics. There should be lots of objections to these things, but I don't know why these lawyers aren't objecting to each other. Maybe they're just like, let's just let it go. So this is just, it's really weird nuance that they're doing this. And he's not going to get anything from her. She's not going to speculate.
Were the police in the hospital when she was there with you?
I don't recall.
The answer is yes, we already
Chained to the
know.
bed by handcuffs?
I don't recall.
Stop by your head. This isn't going well,
Redirect.
Mr. Reddington.
Very briefly.
Really.
I'm just gonna give you
Give report. Oh, thank you.
I'm gonna just take a look at
Give
it
the
and then
woman her
I'm gonna
report.
look up my notes.
You need
Do
this
you
one.
want to just flip through the rest of them to see if that makes sense of the note that you had in the record?
How long is your report, honey? It's probably pages long. What do you want to know specifically?
Okay. Thank you.
Now, counsel asked you on cross-examination about pupils, right?
Mhm.
Was there anything notable, according to your now review of the notes, about Lindsay Clancy's pupils?
No.
So what did that tell you about a possible head injury?
It just indicates that there's no obvious head injury or brain herniation.
Now, you indicated that she was somewhat unresponsive, but her eyes were open. She was nonverbal, correct?
Correct.
Did you observe her to be moving her arms around at various points?
She did move her arms on exam in response to painful stimuli.
And as far as the intubation goes, you're aware that she was in fact sedated in order to maintain intubation.
Again, I'm not certain of that because I was not the one who performed the intubation.
And you were asked about CSF. Having now kind of looked through your notes with your interaction with this patient, was there any note of cerebral spinal fluid, in either your assessment of them or your review of any of the CT results?
I didn't see any mention of that in my physical exam.
Now, as an emergency department physician, you're not treating all of these spinal injuries, correct?
Correct.
Your focus is to assess, stabilize, and get them where they need to go, right?
Correct.
And so that's what you did with Miss Clancy.
Correct.
When the injuries that were described as a volar aspect, counsel mentioned that terminology to you, right?
Yes.
You've now in direct examination identified those injuries as superficial. What characteristics make you say superficial?
Because I wasn't able to visualize any active bleeding or muscle tissue or injury to tendons.
And is it fair to say that oftentimes patients that come into the emergency department might be, if they have some sort of injury to their spine, you don't want them to move, right?
Correct.
So they might be at some point kind of either put in soft restraints or restricted on the bed.
Correct.
Thank you. Nothing further.
Is there anything further? All right, thank you, Doc.
Thank you.
Okay, you guys let me know in the comments what you think of this doctor. Oh my goodness. I think partially because she I wish they would have asked her, how long were you there with Lindsay, right? And I'm glad that the prosecution was like, all right, you're just there to treat her and move her along, right? Like an episode on ER. She comes in, you assess her, you stabilize her, etc., and you get her out, right? It's a processing station. So I asked this question, if Kevin Reddington, Lindsay's lawyer, and or the prosecutor need to get specific information from this person and they're not being responsive to your questions, can you get these questions answered through somebody else? Why are you persistent on asking this person? If they're not going to give you the answers that you're looking for, that it's so pertinent that you ask these questions, is there somebody else that you can get them? Can they come in through somewhere else? Why do we have to sit through painful testimony? This woman she's just like, I'm here to just tell you that Lindsay came in and this is what I did and this is it. I'm not going to give you anything else. And truly, she's a doctor. Remember, she could get sued if she's testifying to something else that she didn't do. And also, I don't know if she is being sued in the civil cases. So if you know, you know. If you don't, you don't. I don't think so, because I think this doesn't have to do with what kind of medication and stuff Lindsay was on, et cetera, et cetera, et cetera. So I don't know. We'll have to see. All right, here we go. Let's continue. We're on number 22. I also have to state that it was interesting that this doctor who had something with her arm, and I thought that was amazing that she's a doctor that is able to do what she does with that disability. Thought that was great. All right, who is this person? Try to assess medical or police based on her outfit and her hair. Very slicked back. She almost looks like a neurologist, but I could be wrong. Oh, nope, she's police. I knew it. She's got a badge.
Thank you. Good morning.
Good morning.
Could you please tell the jurors your first and last name?
Rose Stoffers,
Could you spell your last name for the record?
Stoffers.
And what do you do for work?
I'm a sergeant on the state FFERS.
Name?
Hang on, guys.
Rose Stoffers,
Could you spell your last name for the record?
Stoffers.
And
Okay.
What do you do for work?
I'm a sergeant on the state police in the crime scene services section
And how long have you worked for the state police?
since January of 2019.
Can you tell us a little bit about what the crime scene
MSP,
services section is? of the
Mass State Police.
Sure.
There
So
we go.
get called to all different kinds of crime scenes. Our main job is to document the scenes with photos and videos. We can also process evidence on scene, or we collect evidence and bring it back to our lab and we process it there. We're processing for fingerprints, and then we do fingerprint analysis, try to identify any fingerprints we find on the evidence.
And fair to say the state police crime scene services have labs across the state, right?
Correct.
And what office do you work at?
Right now I work out of the Boston office.
Going back to 2023, were you working out of the Lakeville office?
She's not with the Norfolk District Attorney's Office, people, so she's not involved in that. Just FYI, not all Massachusetts State Police are corrupt. Just wanted to put that out there.
Yes. And so fair to say the troopers that are out of that Lakeville office do respond to a lot of scenes here in Plymouth County?
Correct.
I'm going to draw your attention to January 24th, 2023. Do you recall being called out to the South Shore Hospital in Weymouth on that night?
Yes.
And do you recall approximately what time you arrived there?
I arrived at about 8:35 p.m.
Were you by yourself or were you with anyone else from the unit?
I was by myself. I met then Trooper Lawler there. He's from the Plymouth Detective Unit. And I also met the forensic scientist there.
And can you explain to the jurors a little bit about that relationship that you as a trooper have with forensic scientists that work for the lab?
The forensic scientists are civilians who work for the lab, but they will come out to scenes as well. They do mostly testing of like biological evidence that we don't do. So we work closely with them both at scenes and they share our office in Lakeville.
And fair to say that they're actually part of a different unit with the State Police Crime Lab called the Crime Scene Response Unit.
Correct.
But oftentimes is it the case that when you're responding to serious crime scenes like this one, that you're working in tandem with a forensic scientist from that unit?
Yes, that's correct.
Okay. And so in this circumstance, you indicated that Maureen Hartnett also was at the South Shore Hospital with you?
Yes.
When you got to the South Shore Hospital, what was the purpose?
Hartnett. Oh, wasn't she the main person in Karen Reed who put together the plastic pieces and testified? Ooh, Maureen Hartnett, I think. We'll wait and see. Hold on.
For you being called out there, what were you asked to do?
So my instructions were to document the defendant, any injuries that she had. Forensic scientist Hartnett was going to be taking swabs, and anytime they take swabs, we have to document the areas in which they swab.
So when you got to the South Shore Hospital, do you remember where you went in the hospital?
Yeah, I went to one of the trauma rooms in the emergency department.
Okay. And so were you able to make observations?
Okay, sorry. I'm like super Maureen Hartnett she was from the Massachusetts crime thing. She was the one who went to the Sally Port in Karen Reed's case. She's the one, she's got blonde hair, she's got glasses. She went to the Sally Port and she was the one that assessed the car. So she found the hair and I don't remember what else. So she the damage to the car, the taillight, the scratches on the bumper, and the apparent pieces of glass resting on the bumper. That was Maureen Hartnett. So if you know, you know, she was that person there. Maybe she's going to come testify here. Ooh, see, these things overlap. The people overlap. Just saying. Sorry. Excited. Hang on.
Of Lindsay Clancy.
Yes.
And do you see Lindsay Clancy in the courtroom?
Yes.
Sorry, record may reflect the identification.
Thank you. What were your observations of her when you saw her?
Did you see her eyes? She looked at her.
She was covered in like blankets and like heating devices, and she had a neck collar on. So when I first walked in the room, I couldn't see anything on her body because she was under the blanket other than like the neck brace and her face.
May I approach?
Gonna show her a picture. This what you look like?
Is that a fair and accurate representation of how you observed Lindsay Clancy?
Yes.
So we'll admit this as the next exhibit.
Any objection?
I have no objection to any of the photographs.
All right, that may be admitted.
Oh. Is this any different than what we've already seen?
I'm just showing you now it's been marked as exhibit 140. Can you see that from where you're sitting?
Yes.
And so this
Okay, I just got to take a picture real quick.
blanket,
Okay.
that's how you observed her in the trauma room.
Yes.
At some point, did you and other medical staff remove the blanket to document injuries?
We didn't remove the blanket, but we did remove her arms out from underneath the blanket.
And so were you able to do that on your own, or did you need assistance?
I needed assistance.
And why did you need assistance?
When I first attempted to pull out her right arm, she was uncooperative and pulling it back and fighting against us a little.
So did you enlist the help of the nurses to help you to remove her arm from the blanket?
Yes.
Were you able to make any observations of kind of the temperature in the room at the time that you got in there?
Yes, it was very hot in the room.
Okay. And that blanket that you observed, were you aware that blanket was to kind of bring her body temperature up?
Yes.
Did she know that you were a police officer?
You were able to view her
Question mark?
arms. When you first saw them, did they have anything on them?
There was a red-brown stain on her hands, and there was gauze on like her wrist area.
Did you enlist the help of the medical staff to remove the gauze?
Yes.
And why was that?
To document any injuries that might have been underneath.
And were you able to observe injuries?
Yes.
In addition to, well, strike that. The injuries that you observed or the areas of the body that you documented, what were they?
I documented, I took that first overall photo of her. I took a close-up of her face and the neck area that I could see. I documented both her hands, both sides of them, her wrist area underneath where the gauze was, and then the nurses assisted in opening up the neck brace, and I took photos of her neck as well.
And in addition to documenting the defendant herself, did you document any other items that were at the South Shore Hospital that evening?
Yes, I documented any personal belongings that were brought in with her.
And so you're aware that they removed clothing from her?
Yes.
And so you documented the clothing?
Correct.
And that she had 2 rings?
Yes.
And that you photographed those rings?
Yes.
And you're aware Trooper Lawler had retained those items?
I'm not sure who retained them from there.
Okay. But your role was just to document them?
Correct. I didn't take anything.
Okay. In regards to this particular, well, go back for 1 second. In the crime lab, how does your unit or how do you identify particular cases that you work on?
As in like being called out to something?
Well, is there a way that you, once you get called out to a case and do work on a case, is there a way to track what you did with each case by some sort of case number or lab number?
Yes, we have a case number associated with it.
And as far as lab numbers go, you're aware that the crime lab follows pieces of evidence using the same lab number?
Yes, that's correct.
And does that track items that go through your system?
Yes, it. So our lab number goes into a computer system and it tracks everything. It keeps every report written on that case. It tracks the custody logs. It tracks every piece of evidence that's been involved in the case.
If it helps you, there's no issue as to chain of custody or foundation or anything like that.
All right, thank you.
Thank you. Other than
Okay. If you're from Boston and you know the Karen Reed case and or you know anything about Massachusetts State Trooper Michael Proctor, former Massachusetts State Michael Proctor, and chain of custody and stuff, Massachusetts State Police has a problem, especially, or maybe just it's Michael Proctor, and chain of custody issues and stuff. So it was nice that Mr. Reddington said, we don't have a problem with that. Why? Because in certain cases, they follow the protocol. So here is an example of a case that they followed the protocol.
going out to the South Shore Hospital on January 24th, do you recall being called out to another location later in relation to the same lab number?
Yes.
And that would have been on January 6th, 2023?
February 6th.
Or excuse me, February 6th. Thank you. So where did you go?
I was called to the Plymouth Detective Unit's office in Brockton.
And did you meet or speak with one of the troopers from that office?
Yes, I did. Trooper Rabbit.
Trooper Rabbit. And what did he ask you to do on that day?
He asked me to photograph a bag of medication and some documents that were inside that bag that had been brought to their office.
Okay. And did you do anything else with the items that Trooper Rabbit had in his possession on February 6th?
No, I just photographed them and left them with them.
Okay. And again, is that something that your unit sometimes is called out to do?
Yes.
Nothing further.
Attorney Reddington?
So, is it trooper or are you a chemist or?
Sergeant.
Sergeant, sorry. Sergeant, you had a search warrant apparently when you went into the house, I guess, with trooper.
Oh my God, Mr. Reddington, do you not know who these witnesses are? Oh my gosh, I'm sorry. I'm sorry. It's so funny. Are you a chemist? She just testified that all she did was take pictures of the scene and go. She took pictures of Lindsay's injuries. She took pictures of her in the hospital, and she went to Plymouth to go. She's just an evidence collector. Sorry. Sorry. I'll back it up. It just cracks me up.
So, is it trooper or are you a chemist or?
Sergeant.
Sergeant, sorry. Sergeant, you had a search warrant apparently when you went into the house, I guess, with Trooper Rabbit?
I didn't go into the house.
Oh, so he just gave you the bag. In other words, you didn't go in the house and take pictures of any of the rooms or anything like that?
No, the bag was at their office when I went to their office.
Oh, okay. All right, that's all I have. Thank you.
Oh my God, Mr. Reddington. Where have you been for the last 5 minutes? Did you not listen to any of the testimony that she gave? What the heck were you doing? Are you scrolling on your phone? Oh my gosh. Anybody, help me. Oh my gosh. Besides that, don't you know what she's coming in to testify for? I realize there's tons of witnesses, and just FYI, it looks like Mr. Reddington, and probably he has a paralegal or some other people, but it looks like it's just him doing this by himself. It's a tremendous amount of work for one attorney. And Mr. Reddington, he's not a spring chicken, right? Anyways, great laugh. Let's go on.
Anything further, Attorney Buckingham?
Oh my goodness.
All right, thank you, Sergeant.
Thank you.
Oh my goodness.
Yeah, please.
I'm typing. Hang on just a second. I assume that the bag of pills that they took a picture of was the ones that Patrick Clancy gave to the Plymouth police department.
In here,
Okay.
Okay, thank you.
Okay, what do they do? I have some Zoom room. So hold on. Are the attorneys going to argue about something? Oh, let's see. Okay. Forget number 23. What's the argument? So we don't get to always see all of them arguing about motions.
All right, so we'll be in recess on this matter.
Okay.
Thank you.
All rise.
Well, there's Mr. Reddington on his phone. Okay, so we have some Zoom room. They're taking a break. We don't need a break because I started a little bit late. Let's see if we're going to get there or if I'm going to catch up in real time. Hi. Or if this is their weird break. Oh, here we go. Hold on. One moment, please. And then we're going to catch up. It's okay. Mr. Reddington has a whole bunch of boxes on his table.
All right.
I hope Lindsay doesn't need to see the computer. Right? Okay. I thought there was going to be argument. Apparently, we don't hear anything. I don't know what's going on.
Discourse now.
Commonwealth versus Lindsay Clancy. All parties have
Call your next witness, please.
we call Rochelle Amity.
Rochelle Ambity.
Hey, good morning.
Good morning.
Inquire?
Yes, counsel, please.
Thank you. Good morning.
Morning.
Could you please tell the jurors your first and last name?
Rochelle Amity,
Do you mind spelling your first name for the record?
Rachelle. Last name is Amede.
Thank you. And how are you employed? What do you do for work?
I'm a nurse at Brigham Young Women's Hospital, the trauma surgical ICU.
How long have you been a nurse?
Almost 27 years.
And can you tell us a little bit about your educational background?
I have a bachelor's in nursing from Salem State University.
And how long have you worked at Brigham and Women's?
20 years this week.
And which unit did you say you worked in?
The trauma surgical ICU.
How long have you worked in that unit at Brigham?
8 years.
Going back to January of 2023, were you working in that same unit?
Yes.
And what was the shift that you normally worked?
I work the night shift, which is 7 p.m. to 7 a.m.
And what was your schedule like for any given week? Did you work back-to-back shifts or?
I can sometimes work back-to-back shifts.
Okay, but you always worked the night shift?
The night shift.
Okay. I'm going to draw your attention to a particular patient that you had some interaction with in January of 2023, and that was Lindsay Clancy. Do you recall treating her?
Yes.
And was she in that trauma surgical intensive care unit?
Yes.
Do you remember the first time you interacted with her?
Yes. I got her.
And would that have been on the first night she was there on January 24th?
Yes.
How did she come to your unit at the Brigham?
She came from the emergency room, went to MRI, then came to the ICU to me.
And were you aware that she had been seen at a local hospital?
Yes.
In Weymouth, the South Shore Hospital?
South Shore.
While you were treating her on that first night, were you the main nurse assigned to her care?
Yes.
And what were your responsibilities as the nurse assigned to her care on that first night?
First night, she was intubated, came to me intubated. We had to maintain her blood pressure at a certain number, just care, regular nursing care.
Okay, and were you aware that she was on what's called a 1-to-1?
Yes.
What does that mean?
That means patient usually can't be left alone, and also depending, you always have to have somebody outside the room with to monitor the patient.
And is that because that patient has been identified as a potential suicide risk?
Yes.
Now, on that, the 24th into the early morning hours of the 25th, was there a particular event that you were witness to for this particular patient?
She coded.
What does that mean?
Means her blood pressure dropped for her. It meant her blood pressure dropped and it wasn't sustainable with life.
So what did you do when her blood pressure fell and she coded?
We started CPR, we did compressions.
And this event occurred approximately at 3:30 in the morning, correct?
Yes.
Was she eventually stabilized after that code?
She was.
And did they do something as far as intervention to try to maintain her blood pressure?
We increased her pressors. We added 2 more pressors. She was already on 2. They placed chest tubes in, started what we call a massive blood transfusion protocol.
And did this all occur in the trauma surgical intensive care unit, or did she have to be taken to a different
No,
unit?
it all occurred in her room.
And other than medical staff that was treating her that particular night, did you observe anybody else present?
She had 2 police officers outside the room.
Okay, and so did they remain outside the room for the duration?
Always outside the room, yes.
As far as your interaction with the patient on that particular night shift, was she responsive at all during the
No.
time that you saw her?
No.
And with intubation, you mentioned she was intubated. Is a patient often sedated in order to maintain intubation?
Yes.
Why is that?
Helps them not fight the vent, breathe better, and make sure that they're comfortable.
And what does sedation do to an individual?
You're calmer, you're sleeping.
Makes them more relaxed?
Relaxed, yeah.
Other than that night, that first night, the 24th into the 25th, did you have the occasion to treat this patient at other points within that week?
Yes, I have.
And I'm going to draw your attention to January 26th of 2023. Do you recall interacting with her on that day?
Yes.
And is it fair to say that on the 26th, she was still intubated?
She was.
And under sedation?
Yes.
Well, during this time period on the 26th, was she arousable, meaning could you initiate some communication with her?
Some, yes.
And were you able to kind of give her commands in order to care for her that she was able to follow?
Yes.
And when I say able to follow, obviously.
Simple, commands.
What kinds of
Like, can you
commands?
squeeze my hand? Can you wiggle your toes? Just basic neuro check to just make sure she's alert and she's able to follow, understand what you're saying to her.
And for this particular patient, you're aware that she presented with a spinal injury, correct?
Correct.
And so movement of the lower extremities was not something that she did.
Correct.
But did you observe her to move her head around and move her arms around?
Yes.
Now, you also had the occasion to treat her in the overnight shift of January 28th of 2023, correct?
Yes.
And during that time, she was also still intubated?
I believe so. I'm not sure. I've had her both intubated and
Okay.
extubated.
While she was still intubated, did you have a system that you could use to communicate with her?
Yes, board. We have a whiteboard or clipboard that sometimes patients can write on.
Did you observe her to utilize that whiteboard to write on it?
Yes.
And at this point, when she's writing on the board, her eyes are open and she's responsive.
Yes.
And she's able to tell you how she's feeling, correct?
Yes.
And fair to say she used that whiteboard to tell you she was confused and that she couldn't feel her lower extremities.
Yes.
And do you recall her complaining of having pain?
I don't recall.
During this time period on the 28th, do you recall whether the patient was placed into restraints?
Yes.
And why was that?
Well, we restrain all patients that are intubated for safety.
And why?
So they don't pull out the tube or pull out any lines that they have.
Okay, and so as they're not at that level of sedation anymore where they're just completely asleep, there is danger that they could move and cause damage to
medical equipment out of the way.
Okay. And so in this case, as far as the restraints go, fair to say that they were soft restraints.
Soft, yeah.
And what does that look like for a patient?
Meaning?
Well, like what does a soft restraint look like?
A soft restraint, it's like maybe I would say a cushion restraint, and then it's tied to the sides of the bed. So it's all the way around your wrist.
Okay. At some point by the end of that shift, you recall that she was extubated.
Yes.
Can you tell us what extubation is?
That means you remove the tube. You usually stop all sedation.
And were you able to make observations of the patient once she was extubated?
Yes.
Did her presentation change at all from your previous interactions with her?
No.
Did you have the occasion to treat her again on January 30th?
Yes.
And again, at that point, she has already been extubated. And are you able to then make an assessment of her without the tube in about her orientation and her alertness?
Yes.
Is that something that you kind of do each and every shift?
Every shift, yeah.
Was she still on sedation medication at that time?
No.
And what was your observations of the patient's demeanor now that she's extubated?
She's flat. No emotion either way.
And is that fairly consistent with what your observations were of her during the course of your time treating her?
Yes.
How about being alert and oriented? Did you observe her to be alert and oriented?
She was.
And did you observe her to identify sleep as an ongoing issue?
Yes.
And so, as part of the plan for treating her, did you address the sleep?
Yes.
And how did you guys address sleep?
The plan was to start the first sleeping medication for her. I don't remember exactly which one, and then wait a couple hours, see if it worked, and if not, try another medication.
Okay, and this actually occurred over the course of a few days.
Few days.
Correct?
Yeah.
During the time when you observed her to be flat, as far as her affect goes, did you also observe her to be cooperative?
Yes.
Meaning she followed your directions?
Yes.
Did you treat her, or were you the overnight nurse for her on February 2nd? Do you recall?
Yes.
On this particular night, February 2nd, do you remember her making a particular request of you or ask you for something specific?
I think that was the night she wanted to reach out to her lawyer.
And did you note that in your nursing notes?
Yes.
Why did you note that particular request?
Objection.
Can I see counsel?
Ooh. Ooh. She's up and alert enough to want a lawyer. I don't know why you're objecting to it. You already said.
Night. Thank you.
You,
So
I don't know why he's objecting to it. You've already stipulated that she did what she did. Anyways, we'll see what is going to come in.
Counsel, go ahead.
Thank you. So on this particular night, the 2nd, she made a request of you for her lawyer, correct?
Yes.
Was that something she had asked you before?
No.
And so did you think it was something worth noting?
Yes.
Why would you note something like that?
Because that was the first time she referred to anything going on with the case. So
Okay, and so you had the occasion after she was extubated to have some casual conversation with her, correct?
Yes.
And this was not a conversation you'd had before?
No.
What did you do when she made that request? What was your response?
I sent what we call a consult to the social worker in order to coordinate reaching out to her lawyer.
In any of the shifts that you had been caring for this particular patient, did you see anyone besides medical staff and the law enforcement that were outside of the room come in and speak with her?
No.
Were you aware that she was not to have visitors?
Yes. I was told the first night.
And is that something that you've seen before in your work as a nurse when there are police on site?
Yes.
Were you present at one point when some troopers came in to take photographs of her?
Yes.
And were you in the room when they took the photographs?
Yes.
Do you recall assisting them in viewing the injuries to her wrists and her neck?
I don't know if I don't remember assisting.
Okay, but you were present.
I was present, like in the room with her.
And fair to say, your contact ended with this patient on February 3rd when she was transferred off of the trauma surgical ICU unit.
Yes.
So one moment. Now, you were not the only nurse to treat her on the night shift, correct?
Correct.
So on days that you didn't work, another nurse treated her.
Exactly.
And were you familiar with the nurse who was generally assigned to treat her during the day?
Yes.
And who was that?
Megan Collins.
Megan Collins.
Mhm.
And is it fair to say that with the law enforcement presence and this patient's particular situation, the amount of medical staff that were treating her on a regular basis was fairly limited?
Correct.
Meaning it was the same
Yes.
people all the time?
Mhm.
Thank you.
Attorney Reddington.
Morning.
Morning.
First of all, you have the certified copies of the records for Brigham Women's Hospital. I'd like copies.
Commonwealth, any objection?
What the
It
heck?
was on a disc. I was going to put the disc in instead of all the paper.
Why don't we put both in?
Sure.
I'd wonder what those boxes were. Reddington. I just love Reddington.
You can do A and B.
He's so great. I thought he was going to bring up, here, can you review these records to her? Oh my goodness.
A lawyer first, since that was the last that they asked you about. And correct me if I'm wrong on any of these dates or facts. She was admitted on the 24th of January. Is that correct?
Yes.
And do you have a memory as to approximately what time was it in the evening?
Well, she got to the ICU. It was around 3.
Okay. You're very soft spoken.
Sorry.
You can just keep your voice up so all the jurors can hear you.
She got to the ICU around 3 a.m.
Thank you. And she came by med flight?
She came to me from MRI.
And MRI obviously would be when you're taking the pictures.
Picture,
And that would be on the 24th of January in the early morning hours, correct?
I think it went into the 25th.
Into the 25th?
I think so.
Counsel asked you about the whiteboard that she would write on. And I think it was, again, if I'm wrong, correct me, was it January 28th that she used for the first time the whiteboard to communicate?
Yes.
And the whiteboard basically is just a whiteboard and,
Yeah.
and you write on it. Is that correct?
Erasable.
And she was not able to speak because she was intubated, right?
Yes.
And she was in the restraints that you've described as well, right?
Right.
Moving forward, January 28, 29, 30, into February 1st, February 2nd. It was on February 2nd that counsel asked you about, and do you know who her lawyer was at that time?
No.
Had you seen him before?
No.
Did you know, is his name Attorney Gelb?
No.
Make any reference to you?
No.
Do you know that whether or not she had conversation with Attorney Gelb regarding her status as being under arrest by the numerous police that were guarding the room?
I don't.
Do you know whether or not she was ever able to talk to Attorney Gelb, or did you refer her to the social worker people?
I've put in a consult for the social worker.
Okay, thank you. When she was admitted on the 24th, would you agree that she was in the state of cardiac arrest shortly thereafter?
Shortly after arriving to me.
So I'm looking at the medical records that have been introduced for the jurors, and I'm referencing on page 18, if I may.
Ooh, we get to see some medical records.
This is one page of 400 pages of medical records.
Can you see that?
But looking at this,
Okay, hold on. I'm going to take a picture of it. Wee, this is terrible. Ah, sorry. Hold on. I did it bad. Hold on. Oh, hold on. Sorry. 1 second. Just FYI, I'm tweeting this out and I'm also putting it on my Facebook in case you're like, I don't know what that said.
yeah, it's an SICU course.
Surgical ICU.
I'm sorry?
Surgical ICU.
Okay. And that makes reference to the fact that shortly after arriving in the ICU, the patient had a cardiac arrest. Is that there?
Yes,
Were you there then?
I was.
And when it says the etiology of the arrest, she got 2 rounds of CPR before obtaining ROSC. Can you tell me, please, what is CPR? 2 rounds, and what is ROSC?
Meaning we did chest compression. She was already intubated, so she was getting oxygen.
Okay. And then bilateral chest tubes were placed in her body.
Yes,
Does that mean from both sides?
both sides.
Okay. And they punctures through the chest into what? The lungs?
The lungs.
Okay, the lungs. And when they placed the chest tubes, at this point, shortly after admission, there was 100 to 300 cc's of blood from each chest tube. What does that mean?
That's the output they got once they put the chest
Sorry
tube.
again, just can you keep your voice?
That's the output they got once they put the chest tube in?
Okay. So when they put the chest tube in, it drained 100 to 300 cc's of blood. Is that correct?
Correct.
And then after that, again, shortly after admission to the hospital, coming from South Shore Hospital, she then got a massive transfusion protocol, which you told us about, right?
Yes.
And what does that mean?
Means she gets, we have a protocol that with blood, depending blood products,
Okay.
she gets infused rapidly.
And was there a notice shortly after arrival to the ICU, she was being turned and had 30 cc's of clear fluid that came out of her nose? Is that right?
Yes.
And what is that? Was there a suspicion that that was what's called CSF?
Yes.
And what is CSF?
It's spinal fluid.
Okay. Going to the next page, which would be 19. Does it indicate, again, on there, if I can just bring this up a little bit better. So she now has noted acute blood loss, anemia, right? What does that mean?
She has a low blood count.
And do you know what happened to the blood or any idea?
I do not.
So she
I don't know if it's the lawyer or the person who's doing this, but you can't see everything. I'm doing the best that I can.
and do you know what happened to the blood or any idea?
I do not.
So she had very low, lost a lot of blood, right?
Yes.
And she had anemia. That would be what, low blood or something?
Yes.
And she required multiple transfusions immediately following her arrest, right?
Yes.
And when it says arrest, does that mean arrest by the police or does that mean the cardiac?
Cardiac.
I want to make sure that's clear. It's cardiac arrest, nothing to do with the police, okay? And she had required multiple transfusions. And you were there for that, correct?
Yes.
Were you aware of the extent of after you had the not x-rays, after you had the MRIs and the CAT scans, were you aware as the lead nurse or treating nurse as to what the extent of her injuries were?
At that point, I don't believe so.
At some point, did you become aware of that?
Yes.
Okay, so, and again, I've got the records, you don't, so let me do it this way, just to make it easy. Do you remember that she had a burst fracture of C1?
Yes.
What does that mean?
Means a cerebral fracture.
That'll be up here? So this is the cervical spine
Cervical.
up here?
Mm-hmm.
And then T5 and T6, there was a
Thoracic.
transection. What does that mean?
Thoracic.
Okay, so
On
that'd
the
be about
spine.
down
Yeah.
here. And when it says transection, what does that mean?
It's severed.
And then T1, 2, 3, 4 also were injured as well, right?
Mhm.
What is neurogenic shock? What does that mean? If you know.
Neurogenic shock.
Sorry, yeah, neurogenic shock. It just makes reference on.
These are not my notes, so I can't really.
That's fine. I understand. And this would be on page 65. Do you recall?
Again, he's trying to get in evidence through her that was somebody else's. Okay.
Reviewing the documentation as to what's captioned present illness.
I mean, I would object. Your Honor, no, this can't come in through this witness. But it's just like, nah, nothing to see here. We'll just continue going on. Oh no.
In the records. Did you know that she was presenting as a transfer from South Shore Hospital?
Yes.
Did you know that that under present illness and the history would be that she's a 32-year-old female with history?
This witness. She's like, yes. Like, where is this going? Like, she's bored. I'm bored now. I'm bored.
Significant for postpartum depression. Did you know that?
Yes.
And did you know that after the fall with the C1 burst fracture and the complex transection of T5 and T6, she also had rib fracture, correct?
Yes.
Okay, I want to know. He just said, did you know that she was coming from postpartum depression? How did you treat that? I don't know if she can answer that. What are you trying to get at, Mr. Reddington?
Page 66. That would make reference to the time frame going into the 25th, on the 25th, that she was reacting to painful stimuli, right?
Yes.
And that basically means that she's not conscious, if you will, but she's able to react to.
If you cause pain.
Yeah. Okay. There's a notation of a contusion, laceration, and crushing of the thyroid with thyroidal edema. What does that mean?
She has swelling, I'm assuming, around her thyroid.
Okay. And that is.
Again, this is not my scope of practice. So.
Okay.
You've been warned twice now.
The same evening,
this is not her.
Reference to the fact that in addition to the injuries to the spine, that she also had the rib fractures and was currently in shock. Do you remember that she was in shock? Yes, no?
Yes.
Okay. Would you agree, or do you recall that there's a notation that this
I don't know how to answer that.
patient is critically ill, and noting that she has postpartum psychosis on page 72.
I knew it. I
see counsel.
Okay, I knew it. Okay. Why? This is not her notes. This is not she didn't write this, and you can't just blatantly say the things that you're going to say. So this isn't coming in through this witness. Now, he can ask her if what was her observations? Did she observe a psychosis?
The condition is what they've been dealing with and what.
Okay, hang on. Let me go back.
Condition is what they've been dealing with and what injuries they have, right?
We get a rundown or history of the patient.
Sure. And as it goes into the end of January, and she had been communicating on the whiteboard, you were aware at that point why she was in the hospital, right?
Yes,
You knew where she came from, South Shore Hospital, right?
yes,
And you knew that there had been discussion about postpartum psychosis. Isn't that right?
yes,
Okay.
She's getting ready to get up.
And do you recall that, and this would be on, may I approach you under the witness?
You may.
Thank you.
You can maybe if you could show counsel.
I want the date and the time. And the lawyer, legal team.
So he's getting it in. This is good.
Can you tell me in terms of what date is this page from?
But if those aren't her notes,
January 25.
If I'd ask you if you keep your voice, at least speak in the.
Oh, sorry, yeah.
Oh, thank you.
January 25th,
Okay, say what time?
9 a.m., 9:03 a.m.
All right, can I see that for a second? Thank you.
Who wrote the
looking
notes?
at that, do you recall on that date, you had been working with her the night before, correct?
Correct.
Where it indicates that the patient is under arrest, right?
Yes,
And there are police officers at her bedside, right?
outside the room,
Well, it says at her bedside on the record, doesn't it?
in the record, but I'm saying
And the night before,
they were outside her room.
outside the room. You were not there during the day, apparently, right?
Correct.
Okay. And there's a difference from you guys as far as your medical records. If the police officer is at the bedside as opposed to sitting in a chair in the hallway outside the room.
Yes,
Okay. So indicating police officer at her bedside, we will involve social work and legal teams, right?
yes.
Did you see her face? She like rolled her eyes. Okay, Reddington, come on. You're doing good.
And again, on page 72, there's a reference to CSF leak, and that's significant. It says significant amount of fluid coming from her nose. Do you have any memory of observing that in your treatment?
I did.
Okay. And then, of course, there was the code event that you've already described for us. There's the 100 to 300 cc's of blood coming from the tubes. And then it makes reference to, on page 74, to massive transfusion protocol. Is that like a medical term, or is that somebody
Yes,
describing it, or?
It's a medical, like it's a protocol that we have at the hospital.
Okay. And on page 75,
I'm sorry. Mr. Reddington's going through his notes and reading his notes to the court. Remember that his questions aren't testimony, but he sure is testifying, isn't he? Remember like how he repeated everything? There's a reason.
did you make reference to, or did you observe the injuries, for example, to her wrist?
I observed.
Yes. And would you agree with me, page 75 of the medical record, indicating if it says RUE, what does RUE mean? Do you know?
Oh, right upper extremity.
Right upper extremity, 3.5 centimeter deep laceration, volar aspect of wrist. Can you tell me what is the volar aspect of the wrist? I just don't know.
I'm not sure what
Okay,
that's
that's all right.
referring to.
That's fine. Would you agree that there was noted a 3.5 centimeter deep laceration?
Okay, hang on. Sorry. My picture wasn't that good, but it's okay.
I can't say because I didn't measure. This is somebody else's note, so.
Well, when you looked at her, did you
sorry.
observe with your own eyes and your own experience that she had a deep laceration on the?
She had a laceration, yes.
You can't say it's deep or not?
I can't say. I didn't.
You want to say it was superficial?
I can't say that either.
So when you looked at the laceration on her wrist, you
Yeah.
can't tell us if you would agree that it was a deep laceration.
I really didn't get to assess it at the time when she arrived. So,
LUE underneath that left upper extremity, apparently, right?
yes.
2 centimeter deep laceration, again, on the volar aspect of the wrist. You did see laceration on her left wrist?
Yeah, she had dressings.
Okay. And when she was admitted, she had the core temperature of 82 degrees. Is that correct?
If that's what's noted.
All right. Do you remember, did they use a bear claw or something like that? What is it they call it? They put
A bear hugger?
bear hugger. They put a bear hugger blanket on them.
When he says bear claw, is he talking about donuts? Mr. Reddington. It's a bear. Did she get a bear claw on her? Sorry.
And when I say them, I mean people that have a low
temperature to warm them up.
It hopefully raises the temp, right?
Yeah.
And then if it has warm intravenous IVF, that would be putting warm saline in the body?
Yes, through an IV.
All right, all with an effort to try to get the temperature up, right?
Yeah.
And her core temperature was 82 degrees even after she was at the South Shore Hospital and underneath the bear thing and all that. It's still.
If that's what's noted.
Yeah.
Again, that's not my note.
That's pretty low, isn't it?
It is.
Uh-oh. That's not me. Uh-oh. Oh, no. Oh, no. What happened to the feeds? Okay, hang on. They're back. Sorry. Live trials. Very exciting. Oh, we're
Miss
back at
Amity,
redirect.
The
redirect.
first time that Ms. Clancy, the defendant, the patient, used a whiteboard with you was on January 28th, correct?
Yes.
You're not aware of if she used that tool with other nurses on other shifts,
No.
were you?
No.
And the first time that she mentioned a lawyer on the February 2nd, that's the first time she mentioned a lawyer to you, correct?
Correct.
You were asked about the trauma in the chest tube and that she lost 100 to 300 cc's of blood.
Yes.
The transfusion came after that, correct?
Yes.
And fair to say the course of her treatment coming to Brigham was that she first came in through the emergency department, correct?
Yes.
Then she was sent for an MRI.
Yes.
And then she came to the trauma surgery, correct?
Yes.
And you're aware that she had other imaging like CT scans, correct?
Yes.
And that especially when it came to the head CTs, she didn't have any intracranial injuries or anything that required that you be focused on her head injury, correct?
Correct.
So it was more a cardiac issue and keeping her stable and internal bleeding in the chest area.
Yes.
As far as what you're aware of from other treating physicians, you're aware Dr. Anderson was one of the trauma surgeons that was treating the patient.
Yes.
And he was making assessments and giving orders to you and other nurses, fair to say?
Yes.
And are you aware that he identified in the history that this patient actually had a history of postpartum mood symptoms, not psychosis?
I would have to look at the note. I don't remember.
Those aren't notes that you would have written.
No.
And you weren't taking a full history of the patient?
Not at the time, no.
Were you aware that she then subsequently was fully evaluated by the psychiatric team?
I knew she saw psych, yes.
And were you aware that they ultimately identified that there's an inherent uncertainty in her diagnosis?
I do not remember.
As far as the lacerations went, in your treatment of her, again, you treated her overnight shifts for various days, correct?
Yes.
Did you ever have a situation where you had to change her bandages because they were seeping?
No.
And are you aware that a
Except
day,
for the first night, but we didn't get to that because she coded.
because she coded,
Yeah.
and then you're aware that the next day after, another individual, a physician's assistant, excuse me, actually came in and treated those lacerations.
Sutured, yeah.
And
She said sutured.
as far as Dr. Anderson goes, were you aware that on January 25th, he noted that the lacerations to her neck and wrists were very superficial and didn't require treatment at that time?
I was not aware. Don't remember that note.
Would you, if I showed you the record that that's in his note, would you
Yeah.
agree that that's an assessment that he made?
Yes.
Okay. And he didn't instruct you to do anything further with those injuries?
Yes, right.
Thank you.
Very briefly. Sure.
Objection. She can't answer that. She didn't write the notes. It doesn't matter.
District Attorney asked you about the evaluation by the as she put it, psychiatric teams with a determination that there was inherent uncertainty according to the psychiatric teams. Do you know when the psychiatric teams were evaluating her?
I don't know. It was after and during the day. I don't know
Okay.
what day, but
But in any event, I did show you on the thing over there, where the reference was made to postpartum depression, postpartum psychosis, correct?
yes.
And that's all I have. Thank you, ma'am.
Anything further? No. All right, thank you, ma'am. Let me sit down. Thank you.
Okay. That was interesting. We learned a couple of things from her. Again, both lawyers testifying as to what other people did. Okay, Megan Collins is coming. She's the other nurse that took care of Lindsay. So it was stated that, like, if you're under arrest, I don't know if this is protocol or not, but you get like the same people who are treating you. That's kind of what it was alluded to. Let me know if I'm wrong. Look at Megan Collins. She too doesn't look like she wants to be there. Based on what's going on. Is she going to be a Kelly 2.0?
Hi, good afternoon.
Hi.
Ask you to speak into that microphone, keep your voice up.
Okay.
All right. Attorney Buckingham, please.
Thank you. Good afternoon.
Hi,
Can you please tell the jury your first and last name?
Megan Collins,
Would you mind spelling your first name for the record?
Meghan,
And
Collins, Collins.
thank you. And what do you do for work?
I'm an ICU nurse,
And how long have you been a nurse?
11 years.
And did you go to school for that?
Yes.
Where'd you go?
Sacred Heart,
What hospital do you currently work at?
Brigham and Women's,
And how long have you worked there?
8 years.
In January of 2023, what unit were you working on at the Brigham?
The trauma surgical ICU.
Did you work a particular shift?
I did
And what shift was that?
7A to 7P.
So 7 a.m. to 7 p.m. And you just have to answer out loud. Sorry.
Okay, yes.
I'm going to draw your attention to a particular patient that was treated there beginning on January 24th, Lindsay Clancy. Are you familiar with that patient?
Yes,
Were you a nurse that was treating her during that day shift while she was in the ICU?
I was.
Are you aware that she arrived at that Brigham Hospital on January 24th of 2023?
When she was admitted to our ICU, it was overnight.
So as far as the hospital, do you know when she arrived at the hospital?
I believe the evening prior.
And you, a patient who comes to your hospital doesn't automatically come to the ICU, correct?
That's correct.
Where do they go first, usually?
The emergency room.
And you're aware this particular patient actually went through a local hospital before being transferred to the emergency department at Brigham and then to the ICU, correct?
Correct.
And so when you interacted with her, she had already been at the ICU unit for that night shift. Is that fair to say?
Correct. Interacted. She was intubated when she arrived.
And were you with her the entire day of the 25th from that 7 a.m. to 7 p.m. shift?
Yes.
And was she on what's called the 1-to-1 during that day?
Yes.
And what does that mean for you as the nurse if she's on the 1-to-1?
She was 1-to-1 nursing per our ratios because of how critically ill she was.
And so you were there pretty much the entire time?
Correct.
Were there any other people there other than the medical staff and yourself treating her? Were there any other people there?
There were officers, police officers.
And they were outside the room?
Correct.
That's not what she asked. She asked, was there anybody else there treating you? The officers weren't treating her. Sorry, semantics.
Had you taken over care of this patient from another nurse on the night shift?
Yes.
And who was that?
Rochelle.
And you are familiar with Rochelle? You've worked with her before?
Yes, I have.
And were you advised that over the course of the night shift that this patient had coded?
I was.
And when you came on shift in the morning, because of what had happened overnight, were you aware that she was sent for additional CT scans?
We went for CT imaging in the morning when I got there because she was not stable overnight.
Okay. And you said she was intubated, correct?
Correct.
How about, was she responsive during that first day that you encountered her?
The first shift that I had her, we were focused on her injuries and keeping her sedated. So the interactions, responses were minimal, but that was intentional as she was, again, like I said, so critically ill.
And so you also said that she was sedated for the majority of that day, correct?
Yes.
And is that something that often happens when a person is intubated, that they're sedated?
It is.
What happens if an individual isn't under sedation and they're intubated?
It is patient dependent, but majority of patients are not able to tolerate the breathing tube and it's uncomfortable. So we give them medications to keep them as comfortable in tolerating the breathing tube as possible.
Now you mentioned treating injuries and keeping the patient stable as your primary goal, correct? Were you able to make note of some physical injuries that the patient had?
Yes.
And were there some obvious injuries that you could observe?
Yes.
To her neck and wrist area?
Correct.
May I approach the witness?
Okay, so she's very similar to the ER Dr. Kelly. You're going to ask her a question, she's going to answer it, but she's not going to go any further unless like you direct her. So I like this.
Just going to show you two photographs, okay? Does that look familiar to you?
Mm-hmm.
Do you know
Yes.
that to be the patient, Lindsay Clancy?
I do.
And fair to say she has a breathing tube?
She does.
And then the second one, again, just the other side of her neck. Is that familiar to you?
Yes.
Are these very inaccurate representations of the neck injury that you observed for this particular patient?
To the best of my memory, yes.
All right, they may be admitted.
I'm going to show you on the screen what's been marked as Exhibit 142 and 143. And you said that's to the best of your memory what the injuries on her neck look like, correct?
That's correct.
And during your treatment of her, did those injuries require constant attention?
They required dressing changes. It did not require constant attention. She had multiple injuries.
So fair to say she had more significant spinal injuries and other issues that you were working to stabilize her on, correct?
Correct.
Now, you treated her on the 25th, right? And did you treat her on the 26th? To your best of your memory?
I would have to go back and look.
I don't have a problem if she needs her with records, if she has some.
As far as January 26th on that 7 a.m. to 7 p.m. shift, do you recall making notes that the patient required additional sedation due to the tube intolerance?
Yes.
Okay. And that she was started on low dose of propofol?
That is correct.
And that in the afternoon that she had chest tubes and you kind of checked those chest tubes to, it says, interval CXR looked okay with chest tubes to water seal.
Yes, that's correct.
And so she had previously been given chest tubes and your role was just to kind of make sure that everything was fine.
They placed bilateral chest tubes, and monitoring those is a part of my responsibilities in the ICU. And we were concerned for her respiratory status. So that is why I made a note of it.
Okay. And as far as the injuries that were a part of your assessment of her, fair to say on January 29th, you also were treating her that day from 7 a.m. to 7 p.m. and you made a note where you identified injuries, right?
Correct.
And those injuries would have been things that were reported to you based on a doctor's review of labs and images and that kind of thing, correct?
Yes.
You don't make your own assessment about thoracic injuries or cervical injuries.
I do not diagnose.
Also on the 29th or the 28th into the 29th, that is at that point when the patient was extubated, correct?
Correct.
Do you recall making observations of the patient when after she was extubated?
She was not extubated on my shift. I was there the following day.
Okay. Did you note how her demeanor, her presentation the next day?
I did.
And fair to say you noted increased confusion, agitation, and picking at lines and drains, correct?
That's correct.
And fair to say the patient had to be restrained because of the activity.
That is correct.
Is that something that you often see when patients come out of intubation, that when they're extubated, that they exhibit signs of confusion or delirium?
Yes, it's called ICU delirium.
And over the course of the next few days in your interactions with her, did you see that delirium decline or decrease?
Yes, it was a multimodal approach to manage the delirium, agitation, and it did get better and it did improve.
And fair to say during the time that you were treating this particular patient, there was also sleep issues that were part of the treatment plan.
That is correct.
And on January 29th and January 30th of 2023, were you present when the psych consult team came in to speak with the defendant?
Yes, I was.
What was the purpose of you being present?
The purpose is we had consulted the psychiatry team to evaluate and determine capacity. And my role is as the ICU nurse is advocacy on behalf of the patient and to alert the providers if there's any changes in the mental status.
Now, when they came in and you said advocate for their position, you're aware that the patient was looking to change her healthcare proxy, correct?
The patient was changing her healthcare proxy. That is correct.
and that there has to be an evaluation to determine whether she's of a particular mental status and medically able to make that decision on her own. Is that fair to say?
Yes.
And do you recall who was present other than yourself and the psych doctors, the doctors from the psychiatric unit?
There was the social worker, myself, and her lawyer was present.
Had you been present when a lawyer or somebody else was with her prior to this consult?
No.
And fair to say, you were made aware very early on that there was a particular group of people that would be having access to this individual, correct?
Can you clarify?
Well, is it fair to say that the treatment team was kept small on purpose? Meaning the same people were coming in and being the nurse, day and night staff. There was limited access. Is that fair to say?
It was kept to it was kept to a smaller team, but that was also protection of privacy for the patient.
And during the course of time when she's on the ICU, which is between the 24th to February 3rd, there's always law enforcement posted outside the room, correct?
Yes, and it was because she was...
Well, I'm just asking you if there were law enforcement.
There was.
Do you recall having to check with the nursing director and the legal team at the hospital to make sure that it was permissible to allow anyone in besides medical staff?
Yes, that's standard protocol.
And when she was transferred off of the your unit on February 3rd, did you have any further contact with her?
I did not.
I have nothing further. Thank you.
All right. Attorney Reddington.
Afternoon, I think. Yeah. How many years you been a nurse?
11.
And you obviously take that position as very serious, and your concern is to protect your patient. Is that right?
That is.
You made reference to the fact that she was changing her her documents as far as healthcare proxy.
Yes.
Did you know anything? Did you know who she was changing it from? Her husband to her mother and father, or did you know anything about the specifics?
She was changing it from Patrick to her parents.
Thank you. And finally, what is a DNR?
DNR means do not resuscitate.
Do you know what her DNR was?
Her code status was full at the time that I took care of her.
Do you recall that she had indicated repeatedly that she wanted a DNR, that she did not want to be resuscitated if emergency arose?
I was not privy to that knowledge.
Okay, but that's noted in the medical record. It would be noted in the records, right?
It would be, yes.
Thank you very much.
Thank you.
Attorney Buckingham.
Nothing further.
All right. Thank you. Please
Thank
sit down.
you.
Thank you.
Okay, that was really interesting. Okay, hang on. I need to catch up for just a second. Those were really good questions from Reddington. Let me know what you think about that. So we found out that she wanted proxy changed from Patrick to her parents. And that she had a DNR. But apparently it must not have been given to them because they resuscitated her, right? So I wonder if there's like any liability with that. Let me know in the chat what you think. Hang on just a second. Had a cough. All right, here we go. Was the DNR in place before she got to the hospital, or was it changed when the proxy came? That's unclear. Hopefully they will answer that. Okay,
Good
witness
afternoon, Doc.
5.
I'm going to ask you to keep your voice up and speak into that microphone, all right?
Another doctor.
Thank you.
Thank you, Honor.
What is this,
Good
Dr.
afternoon.
Anderson?
Can you please state and spell your name for the record?
Sure. My first name is Sejal, Sejal. Last name is Shah, Shah.
What's your date of birth?
5/8/81.
What do you do for a living?
I'm a psychiatrist.
And can you briefly describe your education and training background that qualifies you to be a psychiatrist?
Yeah, absolutely. So I did my undergraduate in Philadelphia at the University of Pennsylvania, followed by medical school at Jefferson Medical College, also in Philadelphia. I moved. Oh, sure. I moved up to Boston to do my residency in psychiatry at Brigham and Women's Hospital and Beth Israel Deaconess, followed by a fellowship in consultation liaison psychiatry at Brigham and Women's Hospital, and then stayed on as a faculty member.
And where do you work currently?
I work at Brigham and Women's Hospital.
And what is your role there?
I'm Associate Chief of the Division of Psychiatry and Medicine, leading the consultation liaison psychiatry service at Brigham.
And what is the consultation and liaison service?
Yeah, so consultation liaison psychiatry is a subspecialty of psychiatry that works at the interface of psychiatry and medicine. So we work both in the inpatient and outpatient settings. In this particular instance, we get called by other healthcare providers that may need help with their patients or have a question related in the psychiatric realm. And so I would see a patient that's admitted to the hospital and help provide recommendations to the physicians and the rest of the care team that's caring for that patient.
So basically, say at the Brigham, if a patient's being treated there and a medical doctor is treating them and thinks that they need a consultation with a psychiatrist, your department would be called.
That's correct.
Okay. And how long have you been with the Brigham?
19 years.
Now, I want to direct your attention to January of 2023. Did you interact with a patient named Lindsay Clancy?
I did.
And was that on January 29th, 2023?
Yes, that was the first of a handful of times that I saw her.
And why did you meet with Lindsay Clancy on January 29th, 2023?
So my team was seeing Ms. Clancy for a number of reasons, including for psychiatric safety risk assessment. She had come in reporting a suicide attempt, which is a common reason why my team would be called, is to continue to ensure that patients are safe when they're in the hospital. So we make recommendations about kind of safety status, what can we do to help keep a patient safe, but then we also make recommendations related to medications. So that's why my team was following her. So that was one of the reasons why I saw her on the 29th, is to continue that assessment. I was also called to ask I was asked a new question that day, a consult question on whether she was able to make the decision to change her healthcare proxy from her at the time husband to her parents.
And when you consult to help determine whether someone's capable of making a decision like that, changing their healthcare proxy, are you evaluating their medical decision-making capacity?
That's correct.
Okay. How do you go about doing that?
So there's generally 4 parts to medical decision-making capacity. The first is whether somebody's able to voice a choice and whether that choice is consistent over time. The second is whether they understand the situation under which they're making that choice. The third part is appreciation of the risks and benefits. And the fourth part is kind of being able to reason or rationalize that information to be able to come to a choice and how they came to that choice.
Now, if you're doing this evaluation to determine someone's capacity to make decisions, would a traumatic brain injury factor into that evaluation?
It could.
When you evaluated Lindsay Clancy, was she able to voice a choice to you about who she wanted to be her healthcare proxy?
Yes.
And is she speaking to you or writing this down?
She's speaking.
Speaking. So she's already been extubated at that point.
That's correct.
And she's speaking to you. And were you aware that Patrick Clancy was her healthcare proxy?
I was told that by her primary medical team.
And when you talked to Ms. Clancy, did she tell you who she wanted to take over that role?
She did.
And who was that?
Both her parents.
And you talked about that needing to be a consistent choice. How did you ensure that was a consistent choice with her?
Yeah, so we waited to make the change from Patrick Clancy to her parents until the next day for a variety of reasons. We wanted to ensure that that choice was consistent over time, and especially because the day that I saw her, she had just gone through some pretty major medical events, including she had a major spine surgery, a decompression and a fusion. She had gone through some oxygen desaturation overnight, so was not breathing as well. Her heart rate was up, all of which then led to her being what we call delirious. She was confused overnight to the point where she asked her nurse, "Am I delirious?" And she was also experiencing some visual hallucinations. So that was one of the reasons why I was called in, to make sure that she was able to make that decision to change her healthcare proxy. And then in addition, the team had also voiced, concerns that she had come in after a reported suicide attempt. And so making sure that she was able to make that decision of sound mind. And so we actually waited until the next day when she could be reassessed. At that point, her delirium had cleared, and she was continuing to make that consistent choice to change her healthcare proxy to her parents.
And in fact, you noted in the medical records that the hallucinations were part of an issue with oxygen.
It could be. That could be one of the reasons. Delirium is usually due to a variety of different medical reasons, and oxygen desaturation could be one of them. She had also just recently had anesthesia related to a surgery that she had on her spine, so that could be another reason. And then her heart rate was also actually quite elevated, so that could be another reason.
Is it common for patients who are just coming off of anesthesia from surgery, who have an issue with oxygen and other medical issues that you described, to have visual hallucinations?
They can. It's not that everybody does, but they can. And delirium can be quite common after surgery, and particularly anesthesia.
And those hallucinations that she was having, those were resolved by the next day. They were over by the next day, correct?
That's correct.
And her choice to change her healthcare proxy to her parents was consistent the following day, correct?
That's right.
You also talked about the patient has to understand the risks and benefits of the decision, correct?
That's correct.
How do you make sure the patient understands that?
Yeah, so one of the things we do is really ask patients to take us through their thought process of why they're making that decision and what led to them making that decision at that moment in time. So we're able to kind of see their thought process and ensure that they're understanding, what it means to remove one person and add another.
And what was Ms. Clancy's thought process in explaining that to you?
Yeah, she was saying that her parents are quite supportive to her, and that she was thinking that she would have to change her healthcare proxy from her husband to somebody else. And we didn't necessarily go into the reasons as to, why she would have to change it, but she explained that she was very close with her parents. They would see each other frequently, given that they lived in close geographic proximity, and that she felt that they were very supportive to her and would have her best interests in mind should we need to invoke the healthcare proxy, or that if she couldn't make her own medical decisions.
So was there a concern on her part that her husband wouldn't have her best interests in mind at that point in time?
Sustained.
Yeah, I was surprised. I'm like, objection. This is hearsay, right? And also, can't she testify to this? Okay, well, cat's out of the bag, but yeah. Okay. Good job, Mr. Reddington.
You also talked
I'm
about
gonna back it up.
their concern on her part.
Proxy, or that she couldn't make her
Just
own
backed
medical
it up.
decisions.
So was there a concern on her part that her husband wouldn't have her best interests at mind at that point in time?
Sustained.
You also talked about the patient. You have to make sure the patient's thinking about the information rationally? How do you go about doing that?
Yeah, so one of the things we do is really ensure that the patient understands the situation and all of the kind of parts around it. So this comes into play much more when it's about a specific medical intervention, like an invasive medical procedure, or something like an amputation or a surgery. With a healthcare proxy, one of the things you want to make sure is that the person that they want to change their healthcare proxy to or appoint as their healthcare proxy makes sense in the context of their life. And Ms. Clancy was able to talk about how her parents were quite involved in her life. And so that's one of the things that we would assess.
Okay. And then the last thing was making sure the patient understands the risk if the change doesn't happen. Did you go over that with Ms. Clancy, and how did you do that?
Yeah, I did go over that with her. We talked a little bit about how it could mean that she would not have a healthcare proxy were she not to appoint her parents. And so we went through that, it's always in healthcare, we always talk about how it's great to have a healthcare proxy just in case you become unable to make medical decisions, and who would you want that to be?
And during this conversation with the defendant going over all these points, did you ever have difficulty understanding her?
I did not.
Did she ever appear to have difficulty understanding you?
So the first day when I saw her on January 29th, she described herself as feeling confused, and I definitely witnessed that as well. We went through a bedside cognitive evaluation, and she definitely made some mistakes on some of the cognitive evaluation. Therefore, I did diagnose her at that time with delirium.
And then she was reevaluated the following day, and there were no issues with her understanding, and the delirium was gone, correct?
That's correct.
And were you aware during this evaluation that Ms. Clancy did not have a brain injury?
I'm sorry, can you repeat the question?
Were you aware that Ms. Clancy did not have a brain injury at that time?
One of the things that we look at is any kind of relevant medical information that might be available to us. And I noticed that her Glasgow Coma Scale, when she was transferred to Brigham and Women's Hospital, was a 10, which would indicate that she could potentially have had a moderate brain injury. But I don't recall thinking about whether, specifically whether she had a brain injury.
Were you aware that a CAT scan was done, page 110 of the records, and on the CAT scan, the impression was no acute intracranial findings, so no brain injury.
So you can.
CAT scan, correct?
I did review the head imaging that was available at the time. You can have a normal CAT scan and still have a brain injury.
Were you aware that she had multiple CAT scans that showed no bleeding in the brain, no skull fractures, no injuries, just visible injuries whatsoever?
I'm sorry, but can you repeat the question?
Were you aware that she had multiple CAT scans at South Shore Hospital and at Brigham and Women's that showed no skull fractures, no intracranial bleeding, no hemorrhaging, no visible damage whatsoever?
Yes.
Okay. And were you aware that she was evaluated at South Shore Hospital and at the Brigham, and she had no external injuries on her head either?
Yes.
Now, she was allowed to change her healthcare proxy to her parents, correct?
That's correct.
So if someone was had an injury, a brain injury, to the point where they didn't know what was going on, or they were having trouble processing or thinking, they wouldn't be allowed to change their healthcare proxy, correct?
It depends to what extent. Most patients that have either a head injury or severe mental illness, let's say, just anything going on with the brain, retain the ability to make most medical decisions. And we think about changing healthcare proxies as a pretty low risk decision. As I mentioned before, something like an amputation or a major surgery, invasive procedure is something that we would hold somebody to a higher bar. But a healthcare proxy is a pretty low risk, especially if it makes sense in terms of who they want to change it to.
And when was her Glasgow score 10?
I believe it was as she was being transferred from the outside hospital to Brigham and Women's.
And you're seeing her several days later, correct?
Correct.
And so when she was transferred from the outside hospital to Brigham, she was unconscious, correct?
I believe so.
Okay, so now she's conscious, correct?
That's correct.
And when she was transferred from the outside hospital to Brigham, she wasn't communicating or speaking or opening her eyes on her own, correct?
That's what the report said. I was not there at that time, but the notes that I read, that's correct.
So when you're speaking to her a couple days later, she's opening her eyes, she's communicating, she's responsive, she's interacting, correct?
Yes.
So it's fair to say that her Glasgow score would be higher than the 10 when you were speaking to her, correct?
Yes.
Now, you did a mental status examination of her while you were doing this evaluation about her decision-making capacity, correct?
Yes.
And it's fair to say under mood, you listed okay,
Yes.
that you listed her thought process as organized, goal-directed. Is that correct?
Yes.
You asked her if she was having hallucinations or delusions, and she, other than those initial ones the first day, she denied those.
During my evaluation, yes.
And she also denied suicidal intent and homicidal intent, correct?
Yes.
And you listed her insight and judgment as fair, correct?
Yes.
Her behavior was calm and cooperative.
Yes.
And you didn't see anything about her behavior that would indicate to you that she was responding to some type of voices or hallucination that you couldn't see.
At that moment, no. But as I mentioned, I did speak with the nurse beforehand, and Ms. Clancy was able to report to me that she reported visual hallucinations overnight.
Overnight after surgery.
That's right.
Okay. And then never again.
Not during my evaluation.
Okay. And did you speak to Ms. Clancy again on February 19th, 2023?
Yes.
And was the purpose for that to prepare her for a transition from Brigham and Women's to Spalding Rehabilitation?
That was one of the reasons.
Okay. And what were the other reasons?
So it was an ongoing safety evaluation, ongoing evaluation of psychiatric safety risk, as well as medication evaluation to determine if her medications were at the right level, the right dosage, and that she was on the right medications. And then just ongoing evaluation in terms of kind of her mental status.
And during that meeting, she denied suicidal intent, correct?
That's correct.
She denied homicidal intent, correct? She denied having auditory or visual hallucinations, correct?
Yes.
She reported her mood as okay, is that correct?
Yes.
And she told you she was looking forward to moving to Spalding, correct?
Yes.
She also denied any confusion or disorientation, is that correct?
Yes.
And again, you described her mood as okay on that day?
Yes.
And you described her as future oriented on that day?
Yes.
And then you spoke to her again on February 21st, 2023, is that correct?
Yes.
And on that day, is this the same purpose that you just described, getting her ready, assessing her mental status and getting her ready to transfer to Spalding?
Yes.
Okay. And during that time, you wrote that the patient reported feeling down about her current situation, her paralysis, and the events leading up to her hospitalization. Is that correct?
Yes.
And you also noted that she said her thoughts about what she had done were not constant throughout the day, correct?
Correct.
So she wasn't thinking about killing her children throughout the day, every day, correct?
Correct.
And she said she had no suicidal intent, no homicidal intent, correct?
Correct.
No auditory or visual hallucinations, correct?
Correct.
You also write no PI. What does PI stand for?
Paranoid ideation.
And there was none of that either.
Correct.
You also made a note, notes low mood today in the context of her physical and legal situation, but does not currently meet criteria for major depressive episode. Is that correct?
Yes.
So her focus seemed to be on her physical and legal situation, but being hopeful about moving on to Spalding.
Could I see counsel?
Yeah. Okay. So they can talk about legal situation in general, but they cannot talk about it specifically. She didn't really ask her specific questions. I think he really wants to see counsel about when they're going to break because, I'm very close to real time. I'm not that far off, and they're they're an hour ahead, so it is like 12:47 at the time. So I'm assuming they're wondering if when they're going to break for lunch. I think that's what they're getting to. Um, so I wouldn't doubt that very shortly they're going to break for lunch. But I have Zoom room, so let's go. Interesting.
That time appeared to be for
Why is the microphone all goofy now?
her focus at that time appeared to be her physical situation, her legal situation, and looking forward to going to Spalding Rehab.
Yes.
And then your last visit with her was February 22nd, 2023, correct?
Yes.
And again, she indicated she was hopeful about treatment at Spalding.
Yes.
She was future oriented.
Yes.
And she denied suicidal ideation, homicidal ideation.
Yes.
She denied audio hallucination, visual hallucination, and anything else of that nature.
Yes.
Thank you.
Attorney Reddington.
Afternoon. So, Doctor, from your testimony, and correct me if I'm wrong, was she, to your opinion and your experience, an honest patient telling you what her symptoms were, if any?
Objection.
That's an evaluation in the psychiatric.
I'll allow that question.
Yes.
In other words, she didn't go off and try to exaggerate to you and say, I'm seeing visions and I'm hearing voices and I'm suicidally ideated and I'm homicidally ideated. She didn't say any of those things to you, did she?
No.
She actually denied them, right?
Correct.
So this is not, in your opinion, someone who was trying to exaggerate her conditions for some legal reason, correct?
No.
And you obviously were in close contact with her for about a month, right?
That's right.
Just a couple of questions. Counsel asked you whether or not, and I think it may have been in the beginning in January, that you had difficulty understanding her. Obviously, after removing the tubes and everything else, you're able to talk with her, correct?
Correct.
And you knew that one of the concerns, if you will, was postpartum issues. You knew that, right?
Yes.
And in your experience as a psychiatrist, you're familiar with the concept of postpartum psychosis, correct?
Yes.
And you know that people can communicate and plan and act on plans, even if they're in the middle of a psychosis, right?
Yes.
You don't have to be drooling and stumbling and unable to walk and talk to be in a psychosis, do you?
No.
So in other words, a person can be in a psychosis and can communicate to friends, family, people, talk, correct?
Yes.
So you didn't, as counsel asked, you didn't have any difficulty understanding her. She wasn't slurring her words or anything like that when she was able to talk.
Right.
Okay. One of the things that when she was admitted, and then without going through, I'm not going to go through all the stuff we've already talked about with the medical condition and everything else. You indicated that she was very, very ill, correct?
Correct.
Did she appear to be cooperative to you when you would interact with her?
Yes.
As a doctor, as a psychiatrist, you're familiar with bipolar, the concept of a bipolar diagnosis, correct?
Correct.
Can you tell me what bipolar means?
Yeah, so bipolar disorder is a mood disorder, categorized as a mood disorder, where patients have distinct depressive episodes, as well as, depending on the type of bipolar disorder, either hypomanic episodes or manic episodes, to the point where they don't sleep for days, they still have lots of energy, there's this decreased need for sleep, there can be irritability, there can be impulsiveness, racing thoughts. A lot of patients describe that they're out of control of their behavior. And then severe episodes can also include psychosis.
And in reference to bipolar, as you were referring to, when somebody is hypomanic, what does hypomanic mean?
Yeah, it's a lesser degree of mania. So when patients are hypomanic, they don't always experience things like psychosis, but they might experience some of the other symptoms that I described, including racing thoughts, kind of moving too quickly, talking too quickly, being irritable.
And as it relates to the hypomania, would that include things such as somebody who is getting up early in the morning and exercising, or cleaning out their house, or selling their property out of a garage and having difficulty sleeping, and they're awake all night.
Yes.
As a psychiatrist, one of the things you were concerned about when you were first started to deal with her, as well as when you were releasing her, if you will, is the medication that she had on board, so to speak, when she came into the hospital, right?
Yes.
Do you remember, and I know it's difficult to recall offhand, but do you recall the medications that she was actually under from purposes of taking her blood when it was tested?
When she first came to the hospital?
Yeah, if you know.
I believe her medication list for, previous to the incident, she was on amitriptyline, diazepam. I believe she was also on prescribed lorazepam, and there may have been one other.
Okay. So looking at that, if I tell you that there was a toxicology report done on her as of January 24th by way of taking her blood. You're familiar with that, right? When they analyze for toxicology. And toxicology obviously would tell us what the medications, if any, what type of drugs she had on board, booze, cocaine, anything, right?
Yes.
And you're aware that the toxicology report, as well as the report from the Department of State Police, as well as the NMS laboratory, which would be in Pennsylvania. So that's an international or a national respected laboratory, isn't it? The NMS lab, if you know?
I don't know.
Okay. But you know that they did take her blood, they did test her blood, and it was at the state police laboratory as well as any other labs that tested it, right?
Yes, I believe I found that out later. I did not know that the first time I saw her because those labs take a little bit of time to come
Sure.
back.
And you treated her for about a month, so you were pretty
That's
close to
right.
her and got to know her quite well.
Yes.
Would you agree with me that one of the things that her blood reflected or that she was on was trazodone?
Yes.
And can you tell me what trazodone is?
Yeah, trazodone is an antidepressant medication. It's more often utilized as a sleep aid because of one of the side effects is sedation. And so patients that are often having difficulty sleeping are placed on trazodone.
And is trazodone, does that share some of the qualities of what I refer to as SSRIs, or SSRI, even though it's not an SSRI, it shares similar qualities?
Yes.
Can you tell me what SSRI means?
Yeah, so it's a selective serotonin reuptake inhibitor, and it's a class of medications that are antidepressants.
And the SSRIs, that would also include Zoloft, for example?
Correct.
Would also include Prozac, for example?
Yes.
Are you as a psychiatrist aware that Zoloft and or SSRI Prozac should not be prescribed to a patient who has bipolar?
Yeah, it can be prescribed. Oftentimes it's prescribed together with another medication that can be protective because patients with bipolar disorder may be experiencing depression. And so they may be prescribed an antidepressant, but along with another medication that what we call protective.
And in reference to the SSRIs, the selective serotonin reuptake inhibitor, what does that mean? Selective serotonin reuptake inhibitor, what does that mean?
Yeah, so oftentimes in depression, patients are kind of lacking serotonin in the spaces in their brain that helps.
Can I interrupt you? What is serotonin?
Yeah, serotonin is a neurotransmitter. So it's a hormone in the brain that works on the brain. It works in other areas in the body as well, but for these purposes, it works in the brain at nerve endings throughout the body. And that neurotransmitter helps with things like mood regulation. For patients with depression, they're often lacking kind of that ability to have enough serotonin in those spaces. And so a selective serotonin reuptake inhibitor prevents serotonin being kind of sucked back into the cell. So it allows for serotonin to be more available.
And what is an SSA? What does that mean? Antagonist, selective serotonin antagonist.
So those are medications that kind of do the opposite.
Okay. And you knew as a psychiatrist, at least looking at her history, you knew that she had been seeing psychiatrists immediately prior to her suicide attempt, correct?
Correct.
And you knew that she had been prescribed a number of drugs by these various psychiatrists, correct?
Correct.
And to your knowledge, was she prescribed diazepam?
Yes.
Valium? Was she prescribed buspirone, otherwise known as Vanspar?
Yes.
About Wellbutrin.
Yes,
And what is Wellbutrin? Is that an antidepressant?
it is an antidepressant.
Hydroxyzine. What is hydroxyzine?
It can be used for a number of reasons, but for psychiatric purposes, it's often used as an anti-anxiety medication.
And Klonopin.
Yes,
Is hydroxyzine, is that a, strike that. Klonopin, that's a benzodiazepam, right?
that's correct.
And then lamotrigine.
Yep, lamotrigine.
Sorry.
Yes,
What type of medication is that? Is that a mood stabilizer?
it is. Yeah, it's also an anti-seizure medication, but in the psychiatric realm, it's used as a mood stabilizer.
And then we talked about Prozac, that's an SSRI, correct?
Correct.
And what's Remeron?
Also an antidepressant.
So in addition to all of the drugs that I had mentioned, she was also prescribed Remeron, correct?
Correct.
She was also prescribed Seroquel or quetiapine.
Yeah, quetiapine, yes.
Quetiapine, okay. And what is Seroquel?
So Seroquel is an antipsychotic medication.
And she was prescribed, as we already talked, trazodone. Was she also prescribed amitriptyline?
Yes.
What is amitriptyline?
Amitriptyline is one of the older antidepressants. It's a tricyclic antidepressant that can often be used to help with sleep, but also mood.
And Ambien, correct?
Correct.
And Zolpidem.
Yep, Zolpidem is the generic name of Ambien.
Oh, okay. Some of these drugs, they also have what's called a suicide warning or a black box warning. Isn't that right?
Yes.
Can you tell me what that means?
Yeah. So in studies that have been done, some of them show that especially after starting an antidepressant, it can increase someone's risk of suicidality. Many of those studies showed that it was mostly in adolescents and young adults, but it can happen in adults as well.
And Celexa was also a drug. Is that an SSRI too?
It is.
And all of these drugs that we just went through were all prescribed from end of September till January.
Yes, September 2022.
4 month period.
Yes.
It's an awful lot of drugs to be prescribed in 4 months, isn't it?
Sustained.
Thank you.
Thank you.
Commonwealth redirect?
Yes.
Wait. I wanted to know what did she do with her? So she knew she was, so what medication was she on when she entered the hospital? He didn't tell us that. And then what is she on, or what did she prescribe to her? I don't know if they can get into that, but don't you want to know? Aren't those the questions you want to know? Let's see. Let me know in the chat. Hopefully they're going to break and then we'll talk.
Doctor, all those drugs that defense counsel just listed, you're aware she wasn't on all of those drugs at the same time, correct?
Correct.
And did you know that many of those drugs she took a very small amount of? Some she didn't take any pills at all?
I was not aware of that.
For Buspar, which is one of the ones he mentioned, were you aware the first prescription she only took 2 pills out of that bottle?
I was not aware.
Were you aware the second prescription a month or so later for Buspar, she took 0 pills out of that bottle?
I was not aware.
So you're just where are you getting this information about what she was on and when?
Yeah, so one of the things that we do is try to collect as much information as we can during our assessments. And so we look through the record in terms of what was prescribed. We also talk with other providers as to what they prescribe. But in the context of the assessments that we were doing, it did not require us to determine, what exactly she had been on before, because we were using a different set of medications to treat something, different symptoms that she was experiencing.
So you really have no idea what she was taking or when? You just know what was prescribed?
I know what was prescribed, and then we were also getting reports of what was being taken, what wasn't being taken. But
from the defendant?
Correct.
Okay, so she's reporting to you that she took those medications, but you'd be surprised to know that at least one of them 0 pills were taken.
I don't think I'm surprised. No.
Okay. And you talked about prescription and what she was taking. Were you aware that in the time frame just prior to her being admitted to the hospital, she was only prescribed trazodone, Valium, and amitriptyline, just 3 medications?
Yes, I was aware.
And you were asked about mania and exercising and cleaning out your garage and selling your belongings could be signs of mania, correct?
Correct.
But there are people who just exercise every day and they're not manic, correct?
Correct.
And there are people who have a messy garage and have accumulated a lot of junk and decide to clean out the garage that aren't manic, correct?
Correct.
And in fact, if someone is manic and attempts to do one of those tasks like cleaning out a garage, it's usually in a disorganized way and oftentimes they don't finish the task, correct?
Sometimes.
So if someone approaches a task like cleaning out the garage by organizing with another party, organizing the belongings, separating them into keep, sell, throw out, but that's pretty organized behavior, correct?
Correct.
And if someone sells belongings that they no longer need, that's not necessarily a sign of mania, correct?
Correct.
That's more if they're selling their stove and then they have nothing to cook with, correct?
Correct.
So if they're selling junk in their garage that they no longer need, that's not necessarily manic, correct?
Not necessarily.
Thank you.
Mr. Rankin?
So
on
if
that?
the person, as counsel said, they're exercising every day and they have a messy garage, that obviously would not be indicative of hypomania.
Probably
A
not.
normal person could have, as counsel said it. How about a person that at the same time can't sleep because the insomnia is so bad they go 48 hours without sleep? Is that something to be considered in the whole evaluation?
Yes.
How about the fact of a person saying that my brain is broken and that they can't concentrate, they can't think? Is that something that the person you would consider in conjunction with the messy garage and the exercise?
Yes.
Thoughts of hurting themselves, suicidal ideation, that's something that's important to evaluate?
Yes.
Homicidal ideation, telling your husband that you're having thoughts about hurting your children, that's something you consider, isn't it?
Yes.
In reference to counsel's comment about just 3 medications that she was on prior to trying to commit suicide, you're not aware of the doctors telling her to discontinue this medication, start a new medication, go on to a different medication, depending on the doctor. You're not aware of that, right?
No.
And finally, if you know, did she sign a DNR, do not resuscitate?
She asked to the day after the first evaluation that I did of her, which was the capacity assessment to change her healthcare proxy. But in the context of her reporting a serious suicide attempt, we did not change her code status. We continued to chat with her about that. And she ultimately came to the conclusion that it made sense to make sure that her mental health was stable before she considered her code status.
Okay, but her initial reaction or her conversations with you all was that she wanted to have a do not resuscitate status.
Correct.
Thank you.
Como?
Nothing further.
All right, thank you, Doctor.
Thank you, Your Honor.
Okay, hopefully they're gonna break for lunch. My headphones are having issues today. They're like, yep, it's a Monday. I don't want to work. I don't want to do anything. All right, but we still don't know whether or not what medicate. So I want to know, when she came to you and she was in this manic state or not manic state or whatever, she had her issues, you obviously needed to assess her and you needed to say, okay, what's working, what's not working for her? And then what was your treatment? What was your course? What's she on and what she's not on? I'm assuming they'll get to that. I don't know if she can get to that. I don't know if it's HIPAA violation. I don't know what. So hang on here. Let's see if what they do. Oh,
All right.
Can't
Mr.
hear
Chair, we're gonna take
anything.
the afternoon recess at this point. So I'm going to ask you to go back to her room and then we'll come back here.
Okay.
approximately 2 o'clock. Okay.
all right. They're on break. Okay, they're on break. I'm just gonna zoom to the end. Okay, it's time for chatty chats. It's time for chats. It's time for chats. So hold on just a second. I'm gonna go live on the Tickety Talk. Hello, Tickety Talk. I can probably take these off right now. Oh my goodness, my headphones are technical issues. Okay, hello and welcome everybody. I went live on TikTok. I'm live on the YouTubes, whatever. Okay. Hi, Catherine. Hi, Christina. Okay. Catherine says medical compliance is not a complication often seen in those suffering from mental health crisis. Oh, so you're saying that you don't think it's her meds. So that's interesting. Yeah, so like, okay, so there was this doctor, she was fabulous. You let me know what you think about doctor. Oh, sorry, I'm trying to read three things at the same time. All right, hi Shirley. We are on to talk about Lindsay Clancy. We're all talking about Lindsay Clancy trial. We just went through the morning thing here. Let me see if I can be live on Facebook too. Let's see if it'll allow me now. Okay, let's see. All right, let's see. Hold on. Trying to get everything together. Trying to chat. While they're on lunch, we can chat. Hi, Dawn. All right, let me just do some things. We're talking about Lindsay Clancy this morning and all the things that are going on. All right. Okay. So live chat is open on Facebook. Let's talk about, oh, I can't talk and chat at the same time. All right, so let me know in the comments if you guys are watching the Lindsay Clancy case. If not, I'll be happy to give you a recap of those of you who are on Tickety Talk Land who may not be able to know what happened. A lot happened. So we finally were starting to get there, and I knew that we would. I knew that we would sort of get there because we needed to hear from the doctors who were first we needed to get to the doctors who treated the children. And remember, part of the prosecution or part of the rules of law and rules of procedure is they need to pronounce that the children have passed, right? That's rule number one. So I think we're kind of past that. We're kind of past the children, what all the doctors did for the children. So some more doctors came in this morning to talk about what happened with the children, and that all three children. So they talked about Cora and Callan this morning, because where we left off on Friday, they had stated that Dawson had passed, but not yet Cora and Callan. So they had doctors come this morning to talk about how they treated those patients and what transpired with them. So we know that all of the children now are accounted for, and all of the children have been pronounced and are deceased, because that is one of the thresholds that the prosecution needs to meet in order to put charges on Lindsay. Okay. So then we got into testimony of the two nurses that were taking care of her. And so I think we can officially mark that Lindsay Clancy's cuts to her arms and her neck, they say, are superficial. It's been confirmed that they are superficial. They didn't have to. They ended up suturing her neck. Actually, I think it was a physician's assistant did her neck, and there was no sutures to her wrists. And if I'm wrong, let me know in the comments. If I'm wrong, I can be wrong, and it's okay. I don't mind if you call me out if I'm wrong, because my observations might be different than your observations, and you might be correct and I might be incorrect. It's okay. I don't mind. So that is that's a kind of a recap of who came in this morning. But the psychiatrist came in, and I don't know about you, but she was super compelling. I really, really liked her. She wasn't like Kelly. If you guys want to talk about Kelly, the ER South Shore nurse, or ER doctor, she was an ER doctor. Kelly, who came in, Kelly, the ER doctor. Anybody? Daniel, you didn't hear that. I heard they could be, I'm not sure what you're saying, Daniel, so you'll have to, I'm not sure. Kelly was not prepared whatsoever. You missed her. Lisa at the beach, you missed Kelly. Let me just say, I'll do reenactment of Kelly. Do you know what her condition was? I don't know. Do you know what her heart rate was? I don't know. Did you look at your report? Yeah. You you didn't like that she was smiling or smirking. She was like just stone faced and just had no expression, and she wasn't giving an inch to either the prosecution or the defense. Oh, the psychiatrist. See, okay. The psychiatrist was amazing. Yeah, I don't know. I don't recall. I mean, you would think that she was testifying at a Karen Reed hearing, right, Lisa? Because how many people? I don't recall. I don't know. And again, if you're a physician and you don't know what's going on, and he asked her, "Did you look at the records?" And she's like, "Yeah." So I don't know if she just didn't want to be called out on the specifics, and she was afraid if she answered specific questions, she was afraid of being like um, cross-examined or questioned about her exactness. It just was bizarre to me. That Rosie says that foolish doctor was terrible. Yeah, the Kelly, the ER doctor. Again, I don't know if she was trying to be protective of what she was saying so that she doesn't get sued, right? Or, you know, I will not answer your specific questions unless I know for sure. Now, I understand that they ask a lot of leading questions. If you know, you know, right? Leading questions are, I ask you sort of an overall broad questions, and you're going to take me down this path. Yeah, sometimes people smile when they're nervous, hoping she falls into that category. Um, if you're talking about the psychiatrist, I thought the psychiatrist was good. Rosie, yeah, he asked her to review if she reviewed her notes. And she said she did say yes, but apparently she didn't think she needed to have them as detailed as possible. And then I wondered, I would have asked her, have you ever testified before? That's what I would have asked her, only just to sort of like see what was going on with her. Um, I just, oh, Kelly. All right. Yeah, Lisa, Kelly. I just, yeah, I don't know. Oh, Melanie, you think that Reddington is arrogant and rude? Oh, sorry, Lisa. I'll go over what the psychiatrist testified to. She was fabulous. She was so good. Here, I'll give you, let's go. Lisa needs a brief on the psychiatrist. Okay. So one of the things that the psychiatrist's job is that she needed to make sure that this patient was safe. That was her first and foremost thing that she needed to do, right? This was a person who came in harming themselves, let alone harm the children. I'm sure she knew that. And that she wanted to make sure that she was safe. She was safe in the hospital. She was in a safe environment. Plus, also, if you guys seen The Pit, let me know in the chat if you've seen The Pit. How many of those nurses were attacked, etc., because a person comes in who is not mentally stable, right? So you also want to make sure that you're assessing this patient to see what their mental status is in order to make sure that your staff is safe, right? Oh, by the way, if you're on TikTok, I figured out how to make the hearts. So I don't know if it's Nana, I appreciate you. If you're making the hearts, you just press down on your phone, and you just press down on your phone and you go to do the hearts. So do the hearts, please. Just it doesn't cost anything. Just do the hearts. Okay. And then of course, if you're on, if you're on YouTube, Facebook, wherever, please make sure to like and subscribe. So those of you who are joining, do the likies, the subscribey things. If you're on Facebook, Facebook doesn't like me to live broadcast the YouTube thing. So once we're off of here, if you want to join me on YouTube, you can. and just, yeah, tap, tap, tap. Nana knows the TikTok. Nana, I need to have a conversation with you so you can tell me how to do better. Anyways, so that was her first assessment. Make sure that the patient is stable and understand the things. Then one of the other reasons why she was called in was because Lindsay Clancy wanted to change her proxy. What does that mean? Her husband was the person who was her proxy for her medical health. She wanted to change it to her parents. But she had just come out of surgery. She just had her spinal fusion, is what they said. So she was delirious from the medication, the anesthesia. She was having hallucinations, etc. So she couldn't make that decision at that moment. So they did change it. It wasn't until the next day. And how they did that was just ask her why she wanted it changed, etc. The prosecution was trying to get into it. Like, why do you want to change it from Patrick? And you can't get into that. First of all, and also it was all hearsay, but I digress. They got it in. So she did. She ended up changing the proxy to her parents. They also talked about a DNR, and boy, the DNR was like skewed. So it wasn't until the end that we got to the DNR. She has a DNR. When and where that was placed, I don't know. But then they came back to it and said that she talked about it afterwards. I don't know approximately when, but when she was in the hospital with the psychiatrist, they talked about the DNR. Tapping and hearts me get you to the FYP. Oh, thanks, Nana. I appreciate you so much. So later on, they talked about a DNR. She did not end up going through that route, which I thought was interesting, right? Because if you are, if you have thoughts of harming yourself, and especially knowing that you did what you did to your children, do you think that you want a DNR? I don't know. So that was really interesting to me. I thought that might come up later. So put a pin in that. That might come back later. Okay, so they talked about the risks and the benefits of her making the decisions. They waited to the next day because she had spinal surgery. And she talked about her parents being really supportive. They kept going on about her brain injuries. She had no traumatic brain injuries, period. They went back and forth and all around. In the end, no traumatic brain injuries. And that the risk of her changing her proxy was very low decision. If you have something that's really serious about your medical issues, like an amputation or something else, then they go through a different thing. Let's see. It's the feed's jumping, so I'm trying to get you. Is it Franceline? I think the psychiatrist kind of closed the DNR conversation, especially since she stated she was right. Gonna stay full code. Yeah, I think that's what I assessed. Patients automatically are full code when they come in unless they have a DNR on file. Oh, thank you. Thank you. That was great. See, you guys are so great and so supportive. You know the information. Okay, so then they were talking about her transitioning from Brigham and Women's in late February. Remember, the incident happened on January 24th. She was at South Shore, and then she got transferred over to Brigham and Women's. So now she's approximately about a month into her treatment at Brigham and Women's under this psychiatrist, right? So now she's going to be transitioned, right? She's stable. She's okay. She doesn't need to be in this hospital. She needs to transfer over to Spalding. And if anybody knows what Spalding is, I don't know if Spalding is, I'll Google it really quickly. Is Spalding, I guess what I'm trying to ask is Spalding, it's a rehabilitation hospital, but it's not like jail hospital. That's a terrible way of saying it. Because she's under arrest, right? She's under arrest. So I think that yeah, Spalding is just like rehab, but it's not the place that if you're under arrest. Because I don't know where she's being housed right now. I know she's like in a mental facility right now. and I don't know exactly where she's at. Remember, I'm coming into this not knowing everything, but I know she's under a medical facility / being arrested. Does this make sense? So if you know where she's at right now, let me know. Okay, so when she was being transferred from Brigham and Women's to the Spalding Rehabilitation Facility, she said her mood was okay. Now, I want to touch back on this subject because remember when her attorney Reddington showed her medical journal and how she was feeling, and she just said, I'm paraphrasing, one of hers was that she was having bad thoughts, right? But she wasn't specific. She's in Tewksbury Mental Hospital. Boy, Kirsten knows everything. She was at Tewksbury State Hospital, but you don't know if she still is. Okay. So remember she kept like a journal of her moods. What was she taking and what her moods were? And free him and lock him up. Oh, lock up her husband. Okay. So I've had people who I've heard some smatterings of people who say that her journal wasn't specific enough, right? And I'm like, why does that matter what her journal is? It's first of all, it's her own personal journal. And if she's sharing it with whoever is giving her meds, Jennifer Tufts and others, is she just generalizing, or does she not want to put exactly what her thoughts are, etc.? I'm not sure about that. But she's like, I feel like she's being generic. My mood is okay. Now, I don't know if this doctor can get into specifics. So maybe we're just kind of getting a generalized of because of HIPAA and whatever else. But okay. So they kept talking about her future moves, that she said she was okay. She was looking forward to the future. She was looking forward to going to Spalding. All right. On February 21st, her mental status to Spalding, she was down. And again, general terms. So, I mean, I don't know how you can, what you can do with, that. So her mental status, that she was down. Hold on just a second. All right, I'm just going to continue. All right. And why was she down? Well, she was down because of her legal issues and she was down because of her injuries. Obviously, at this point, she probably knows that she's paralyzed, right? So she was down. And then on the 22nd, which was the next day, she was hopeful and she wasn't having any hallucinations. And as you see that, sorry, TikTok keeps talking about my, no? Okay. All right. Go away. All right. He's talking to me about my microphone. So the prosecution, you guys let me know what you think about this. The prosecution kept going on about her. She wasn't having any visual hallucinations. She wasn't having this. She wasn't having that. Gabby said, I did that back. February 22nd, not even a month after she did this, and she was doing just fine. Yes, but why was she doing just fine? Oh, changing her proxy is significant to you? Oh, tell me, Sharon, why do you think it's significant? I want to know. But why? So they didn't talk about let's talk about it. I'm not sure why the prosecution did so because the point of the case is to prove psychosis during the event. Right. So here is because she wasn't in psychosis. You think she wasn't in psychosis. Okay. I want to know, with all of the medications, the 3 medications that she was taking or wasn't taking or whatever, I want to know when she entered the hospital, they were talking about her labs. What was she on or what was in her system? And what is she on now? And did this doctor see a problem with what she was on before? And what is she on now? And now that she's on what she's on now, is she better? Right? She lost trust in Patrick to make the right decision for her. Right. Took 1 pill from one of those bottles and none from the other. Right. Because again, we need to hear from the other doctors and we need to know why she kept getting switched to medication. Why did she take some but not the other? So those are the factors that I'm waiting to come in. Right. There were too many doctors prescribing meds. Right. 13 different meds in 4 months is insane. Right. And I don't have a complete list of what she was on when, what was prescribed when. I'm hoping that we will get that because, us as the at-home jurors would really like to know. So, wouldn't you like to know? I'd like to know. So Nana is telling everybody to tap. If you don't know how to make it rain hearts on TikTok, you just get your phone. I'm trying to see. You get your phone and you just hold it down and you can tap anywheres to make it rain. And if you haven't liked and subscribed and did all those things, please, 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 please do. I'm trying to get my numbers up, especially TikTok. I need to get, so if I get to 1,000, I can do other things. So let's get to 1,000. All right. So, okay. All right. So, as you saw, like the last minute rush before lunch, they were talking about what a manic person can do and what a manic person can't do. And I don't know about you, but I was so confused at the end. If they think there's an issue, they say follow up with outside doctors. Psych meds take weeks to give you the effect it needs to do, and they were changing them every few days. Erica. So that is very important. And I, as the at-home juror, need to know that from said doctor. So far, said doctor hasn't come in and said those things to me. So I'm waiting for that to come in. But a bad effect happens quickly. So, right. I'm sure we're going to get into it. I'm sure. So just hold on. I'm sure it's going to come in what these meds were, how it affect her, and how it was going to do the things that it did. Sorry, my TikTok is asking me to do things at the same time. Listen, I have not been diagnosed with ADHD or anything, or being neurospicy, but I definitely think that I am. I can only do certain things at certain times. I can't be everywhere. All right. So, can a manic person go and organize their garage? And is she manic? If she's not sleeping or she's excessively exercising, what's excessively exercising? What's excessively exercising? I want to know all of these things. Right. It'll come in defense. Yeah, I hope so. On context, yes. I think that she was destabilized because of the benzos. That is and bipolar. So yes. Thanks for bringing that up. We just got the bipolar. The bipolar just came in, and I'm super, super excited about that because remember that hi Paige, remember that in Kevin Reddington's opening statements, he mentioned that somehow or another she was diagnosed with bipolar. When did that come in? And what, if any, of these other medications that she was on? And he was saying, he testified, remember his, okay, so not sleeping can wake mania up, but mania can also cause insomnia, right? So it's like a dual-edged sword, right? She woke up at 4 a.m. weeks postpartum, ran miles, did an hour of cardio and an hour of strength training. That can work both ways. She even ran a 5K months after delivery. I saw that. She did. I remember she ran a 5K after delivery. That's amazing. So again, I appreciate all of the comments and stuff, but just remember, it hasn't come into trial just yet. So these are the questions that I need to have answered in trial for me to say, as the at-home juror, whether or not she's intent or is it insanity. So these are the questions that I need answered in the trial. It was mentioned that a safety med is given to those meds for bipolar. There are studies that low progesterones can cause PPP. Maybe that drop later. yeah, maybe we will see. Again, I need to have this evidence come in, and I'm assuming that the jurors do as well. The jurors are going to have a long you never know what a jury's going to do, right? The minute that you think that they're going to have a long one, whoopee, here they come. I want to know who leaves a wife at home and goes to New York that was in a mental facility. That, it's a great question. But here's the thing, right? Here's the thing. Until you're in that person's shoes, we never know what's going on, right? I always say there's always three sides to the truth. There's one person, the other person, and something in the middle, right? I think having the psychiatrist on the stand was a great start for the witnesses. Absolutely. I hope that they have some smart people on the jury to see through his lies. She was good. Is it true he remarried 4 months later? I don't know exactly the time frame when he remarried, but he did. You're saying Patrick was neglectful. I'm still waiting to hear some more evidence into that. But just remember, unfortunately, he's not the one that's on trial. Now, I did hear some smatterings and stuff like that, he got married in April of 2026. So just this year. The fact that he moved on so quickly is suspicious. Well, he moved with his new wife 4 months later. Yes, they're on recess right now. They're at lunch. Yeah, some people are saying he moved to New York 4 months later. Yeah, exactly. That's why. So somebody said, was he cheating? Now, and that might be the reason why she did what she did, right? Somebody mentioned that at some point in time. That is not facts that are in evidence so far, right? Because I would think that if I was a prosecutor and that is a fact that they know, well, then why didn't they say that, right? Right? If he was moving on, then why wasn't that, if he's moving on to somebody else, no one can have them and me either, right? But that was not a factor that they brought up. Could that be investigated even? Yes, investigations still go on through trials, just Hannah, if you didn't know. They do. They have a private investigator who is still on retainer throughout the trial because sometimes evidence still comes in during a trial. Karen Reed's trials 1 and 2. If you don't know, you know. We don't know why it took him so long to get into CVS, but remember, he's not on trial. She is. And so you have to be careful with what questions you can ask him. Annette, hi, welcome. We're watching the trial with me on my Facebook page. So if you go to Legalese123, I'm still live right now. And you go to Legalese123 on YouTube, just go find me there. And we're live. Currently right now, court is on break. But if you choose that you want to watch it somewhere else and not with me, that's fine. I have East Idaho News on, but Court TV is live streaming it as well. Cheating doesn't give her excuse for murder. Absolutely. Oh, yes. This is pretty much the same as Yates. I did not watch the Yates trial, but you're pretty much correct. I believe he stated he was writing an email in the car. They did go over that in his testimony. Do I think that she's going to talk? You mean take the stand? No. Lisa at the beach. I'm not live on Facebook when this goes on. So you can only join me live on YouTube to go over the trial. But I do come back on and talk on Facebook. The last lady was so biased. I like that you are staying unbiased. Thank you. Yes. Yates never wanted to leave her mental institution. I'm going to have to look that case up. Do you think Patrick is framing Lindsay? No. Why? Because there's no evidence. There's no evidence, right? It's Dane Channel, Legalese 123. Everything's legalese, all one word, Legalese 123. I wish I could send you a link, but I don't know how to do that, and I don't know if it will allow me to. Let me see if it will. Hold on. I don't even know where I'm at. I have like a gazillion tabs open. It's crazy. It's crazy. Hold on. Let's see if I can I don't know if I can send you a link or not. Okay, let's see. I'll see if I can send a link. There is my link to my Facebook, but I don't know if you can click on that. So, and thank you everybody. FYI, I made it to 5,000 likes or followers on Facebook. Thank you to whomever you are. If you're on me with Facebook, thank you. I did say a big thank you to everybody. So thank you. And if you're on the places in the spaces, make sure to like, subscribe, do the heart things on TikTok. TikTok, all you got to do is tap on your phone. It's free. Just put your finger down and tap, and then like the hearts will ring. Otherwise, so then people will know I exist, because nobody knows I exist except for you and my family. Oh, thank you, everybody. Thank you. Hi. It will, but it might send me a warning restriction. Well, I sent it and we'll see. I didn't get anything thus far. So whatever. Thanks, Lisa. Thanks for following me. But also, so just to let you know, I'm streaming the court on YouTube. I can't stream it on TikTok or Facebook. So if you want to join me as the court is going on, I try not to talk very much, but every once in a while I have to pause and say something. But you can write me comments and we'll go over your comments when I can. So just like TikToker, you can send me comments. How long do you think the trial will be? Well, they said it was anywhere between 6 to 8 weeks, but by what happened the first week, where they barely had anybody on the stand, was mind-boggling to me. So I want to say it's going to be shorter. I'm going to predict, if you know me, I got this crystal ball here. Can you see my little crystal ball? Here we go. I predict 6 weeks. I predict 6 weeks. Now, it will depend upon these doctors coming in and how long their testimony is going to be. How deep are we going to get into things? What do you think Eli, I'm not sure what your question is. What do you think it's going to happen? 6 weeks, geez, how many people do they have? They have 200 witnesses. And then if you didn't remember, at the end, Kevin Reddington added on 4 people. Dr. La Posada was one of the doctors that he added. And if you don't know who Dr. La Posada is, she is the brain doctor who came in to the Karen Reed trial #2. And she talked about the Glasgow coma scale. She talked about all the brain injuries to John O'Keefe and like how that happened and what have you. Now, remember, this doctor and the prosecution testified. When I see the prosecution testify, both lawyers are testifying, right? They're asking questions that quite haven't been yet presented to the jurors as evidence, but they're saying, did you know? Like, they're asking things. She's asking things. Hi, Kimberly. Yeah, she was good. She knew her stuff. But they asked her about her brain injuries, and they went over and over. It's like they're asking things 5 ways under the sun to get it in. And they kept asking over and over and over again about her brain injuries. And it seemed to me she didn't have any. Like in the beginning, she did, because she's incapacitated. She can't talk. She can't speak. So yeah, her Glasgow score wasn't high. But then once she regained consciousness and she was able to speak, plus who knows what medications she's on. Yes, the doctor who was Kelly, the ER doctor at South Shore. I just call her Dr. Kelly. It was Dr. Kelly McDonough, I don't know, DONOUGH. I spelled it. Yeah. She was crazy. Okay, so let's go back to the psychiatrist. In the end, they were talking about, are you manic? Are you not manic? Well, you know what? Jackie Ann. She was not only annoyed with Reddington, she was also annoyed just to be there because her demeanor was pretty similar, the same to the prosecution. She said, I don't know. She said the same thing, if I could look at my records, etc. But what happens is just law nerd stuff. Sometimes they don't want you to look at your notes. They want you to sort of remember off the cuff because they want to catch you, right? They want to catch you in something that they might be able to question you about or get you to say something that might lead them to something else. And she was not given an inch. She's like, if it doesn't say it on here, you can't see my notebook, might not. If it doesn't say it in my notes, I'm not saying anything. Now, the psychiatrist, yeah, it makes you a bad witness. The psychiatrist, she kind of gave them a little bit of, I'll give you a little bit here and I'll talk about this. I thought there were a couple of times I was like, lady, you might be talking out of turn. You might be saying a couple of things that you probably shouldn't be saying, but they went ahead and allowed it. I would have objected. I would have objected and be like, you can't testify to this. But these lawyers are so out of all of the cases that I've reported on, and I've been doing this I've been a law nerd forever. But out of all of the cases that I've seen, this is the second time where all the lawyers and the judge are just sitting there. No one's objecting. Everything's just coming in, except for the point where he objected to her talking about Patrick. The psychiatrist was going to be talking about Patrick and the proxy. And I was like, please object. The relevance of the mania. We'll go over that in just a second. It's not synonymous with criminality. So the mania to me is because if you're in a manic state, right? If you're not sleeping, that's what that's what the defense is trying to allude to. She's a manic, depressive, bipolar state, and she was misdiagnosed with her meds. That's what they're claiming, and that's what they're getting into. And so, but I don't know about you, but it felt like it was very disjointed. They're talking about the mania as if, oh, you can be normal and do these XYZ things, but then you can also be manic. I'm like, you can't talk out of both sides of your mouth at the same time, right? Yeah, bipolar can be manic. So I think they're going to have to get into this more clearly, and I'm wondering how they're going to get it in. Who's going to come in to testify that? Right, maybe, but they didn't clarify the relevance. When you're in that state, you see and you hear things that aren't there. Very much so. Right. I don't know about the psychosis, but I did like that Reddington brought it up. And I was like, okay, here we go. Here we go. This is the first that we're talking about the psychosis. But you can still drive and function. Yeah. So, when do we verge from driving, going through your garage and organizing things, excessively exercising, which I need to know more about that, to, okay, now I'm going to unalive my children. Where's the break? And I'm sure. Oh, Nana, thank you. I don't know what that means, but thank you. Nana says our community just teared up. I don't know what that means, but I appreciate that. I saw that the doctor that diagnosed Andrea Yates is going to testify for the defense in this case. Oh, what's the doctor's name? Tell me. I want to write that down. Remember, I'm going into this not knowing things, and I'm like, la, la. All right. I don't know about the psychosis personally, but because, that you had a manic episode and went into, you did? Tell me how about that. I don't know if that's true, and that's not what I saw. I'm not sure. Andrea Beck, I don't know what you're talking about. I ran away from my house and went into my mom's, climbed her fence, and went in through the dog door. Oh my goodness. Medications can be life-saving, but wow, they can destroy someone. Oh my gosh. So listen, I appreciate you sharing that information. That is so amazing. please educate us, because I don't know, and it's important for our audience and our community to know. All right, Sarah Rose says, do you think Lindsay will testify on the stand? No. Sarah, no. And I've said this many times. She shouldn't. Why? Because one, and this is my opinion, she's not the same person that she was then, right? And whatever her state was then is not the same state that she's in right now. Plus, when she's on the stand, the prosecution gets to ask her a lot of questions. They can ask her pretty much anything. And me, if I were her defense attorney, I don't want that. I don't want her to say anything. Plus, she's going to get super emotional when talking about the kids. And what she's already emotional, we can see, right? You don't want an emotional person to be on the stand. You just don't know what they're going to say. And anything you say can and will be used against you. The answer is no. And if she does, I will be floored. And the meds did not work the same for everyone. Clonopin, Limicel, and they changed my life. Oh my goodness, that's great. It was real as it could be. I still don't know what was real and what wasn't. I stopped trying to make it make sense. I don't think she's stable enough to take the stand. Right. Yeah. And if she is still suicidal, she's still on 24/7 watch. She has made it clear that if she ever got a chance, she will. I'm not sure what you mean by that, Morgan 123. Who knows, at some point, someone may interview her down the road, perhaps. She cannot be interviewed right now. That would be stupid for her because anything will be used against you. Karen Reed, may I say? I wonder if she will do a book after her story. Well, just remember that. So Sarah, yes, that makes sense. Thank you. Yeah. Just remember that even if she's found insane, she's going to be in a mental hospital. So she's not free. She doesn't get to roam about the country, right? If she were to do a book at that time, there might be some caveats that whatever monetary she might get from that, money she might get from that may not be able to go to her. Right, she's paralyzed. The meds that you're on now work great. I've only had one episode and I'm almost 40 and they don't know why. Oh my goodness. Wow. Yeah, the trial's going to continue today. SMC 11. They are on lunch break. The judge this morning stated they are going this afternoon. So they are going to go until they can go. So I assume that they're going to go until about 4 o'clock today is my guess. You have somebody close to you that had occasional psychotic episodes, very much so harm. So harm to themselves, though never to others. Yeah, you see, that's why. So that's another reason why I'm covering this. I usually don't like to do it when it's children, but I'm covering this because I want to know. And if this by chance helps somebody who might be in, like they have these thoughts or they have these feelings or they're postpartum or whatever it is, and you're talking about it, that person might be like, oh yeah, that's me too. And you're discussing it can be like, well, maybe I'm not the only one. And maybe I should go get some help. And so you might be helping somebody you just don't even know. Stopping the stigma and people help is so important. Yeah, exactly. Maybe you're talking about it, us discussing it might help someone else. So thank you. Thank you so much. I really appreciate this. So if you haven't done the likies, the subscribey things, plus if you're on TikTok, you can do the hearts. Apparently I learned that if you press down on your phone and you go doo-doo-doo-doo-doo-doo, you can make it make hearts. And it doesn't cost you anything. So, okay, Sarah Rose says, I wonder if the husband has anything to do with her doing this. Not that it makes makes it right. I do believe she has some mental illness. I'm hoping from what I see with this case that they can talk about this more. They talk about the medications she was taking at the time of the occurrences. I'm really interested to see what plays out in this. I feel like we're finding stuff that we didn't even know about. Yeah, Sarah. I mean, now some people already know, but I'm going into this almost similar that seems like you, that I didn't know things, and I want to see what comes in. And women's mental health postpartum or not is so important. Absolutely. I'm just curious, honest with providers. I'm curious how honest with providers. Not sure what you mean by that, but I think you mean what's going to come out. This case is so sad. Yes, Ms. Rivera, it is super, super sad. And just to be honest with you, there are no winners in this case, right? There are no winners if she's found insane, and there's no winners if she's found guilty of intent, right? Oh, okay. So it looks like the camera's moving, so we might be back. So just FYI, if you're joining me on Facebook, I have to disengage because Facebook does not like me to do live streaming of YouTube. So you'll have to go find me on YouTube. I'm on YouTube. I'm live streaming on YouTube. So you can go to my channel Legalese123, and the same for TikTok. I'm sorry, TikTok. YouTube does not allow me to do that. I mean, we can get on here and talk, but I don't do the chat in between things because I'm writing things down, etc. So if you're on TikTok, you can go to my YouTube page, Legalese123, and we can chat on there. But I can't do everything. I can't live chat on TikTok. I can't because I want to hear the testimony. So I'm listening to the testimony and I'm writing it down, and I'm also live reporting on X and Facebook at the same time. So I can't do it all. So the camera moved, but they're not back yet. So just FYI. And just to let you know, it's 2:00 their time in Boston. I'm Central, so it is just 1:00 my time. So they're not on just yet. But if you want to hop onto those spaces, if you want to pop on over to YouTube before it begins so we can watch it together. I know you can't see it, but see, you'll see I have like picture in picture. So it's me, and then the YouTube, you can hear it with me. So only advocating for me, it was awful and hard to get. Uh-oh. All right. I don't know why I was disconnected from TikTok. It's telling me some weird stuff. I don't know. On TikTok, you can play the sound just as background on. You don't have to engage. Oh. Well, I'm not sure how to do that, Nana. Let's see. Let's see. Add source. Let's see. Add video, image, link. Okay, let me see if this. No. Thanks, Sarah. Thank you, Kimberly. Court's not back yet, just FYI, so don't worry. I'm watching it. It's over here, and I remember I have like 15 tabs open. Oh, I don't have a green screen. I mean, I do, but so I'm trying to look to see if I can add just audio. So here's my window capture. Hold on just a second. Let me see if I can manipulate this. Mm-mm. Mm. So it's there. You can see it behind me. So let me see if I could do this. And we'll try it, okay? We'll try it. We'll see, okay? But if I get flagged off of TikTok, I might have to just yeet. I'm sorry. So you might be able to hear it, all right? So we'll test. Yeah, my username is the same as my YouTube. Legally is 123. I don't know where it's at, if it's up or down. I don't know. Just Nana, thank you. I appreciate you so much. Help me manipulate this tickety talk. Make sure to do the likies, the subscribey thingies, everybody. Even on TikTok, you can like and subscribe. Also, I forgot to tell you, turn on notifications. Why? You just never know when I'm going to pop on live, because who knows what the heck is going on in the world. Who knows? Okay, so now I just changed my Facebook. I'm not even centered anymore. Here we go. Oh, I appreciate everybody. Thank you. Yeah, I'm a little... Somebody on X said, what about patient privilege? Apparently, they must have waived that. They have to in order for it to come on in to trial. Yeah, it was really interesting when they were talking about the manic and whether or not a person can be manic, whether or not a person can't be manic. It just was interesting. Oh, plus also her body temperature. Oh, I wanted to talk about that too. Her body temperature. Okay. So somebody else talked about the body temperature. So she was what, like 80 degrees or something like that. So somebody likened it to the John O'Keefe case, John O'Keefe, Karen Reed case. Let me know if you know. So John O'Keefe was found in the snow. He had apparently been there, if you believe one theory, which is that at, I don't know, before 1 a.m., he was out on the lawn until 6 a.m. to 8 a.m. when they found him and transported him to the hospital. It was blizzard, it was snowing. So you would think that his body temperature would be way less than that. Now, some people say he was put on the lawn at 3 a.m. So between 3 a.m., 6 a.m. to 8 a.m., whenever he made it to the hospital, what was his body temperature? Because his body temperature was, I forget what it was, but it wasn't as low as hers. Is what somebody had said. Oh, I think I lost it. Okay, let's see. Lindsay Clancy had a body core temperature of 82 degrees after less than an hour being out in the snow. Yet the same Commonwealth would have us believe that 6 hours, John O'Keefe's body had a temperature of slightly 80 degrees. That was what somebody brought up, and I thought that was really interesting. But again, not a doctor, not a medical professional, so I do not know. So you think that because her severed spinal cord messed with her body temperature? That could be very well. Due to the blood loss, yeah. Oh, John O'Keefe. Are you joking, or you know who John O'Keefe is? I don't know, because that's a whole nother story and a whole nother stream we have to go over the Karen Reed case. Are you saying that would make her have different thoughts? I don't. You don't know the John O'Keefe? Oh my goodness. Okay. We'll have to have a chat another day all about the Karen Reed, John O'Keefe. I'll briefly tell you. Karen Reed, it's a Boston, Massachusetts case. Karen Reed was charged with unaliving her boyfriend, John O'Keefe. He was a Boston police officer. They say that they had gone to this house so they had been partying. They had gone to one bar and were drinking, went to another bar and were drinking. They were invited to a house of another Boston police officer, where there were a whole bunch of other people in the house. There was a party already in existence. Now, mind you, I'm just glossing over. I'm giving the Cliff Notes version. John John O'Keefe exited her car. She didn't really know the people. He kind of did because they live in the same town. She's not from the town. He exited the car. There's a lot of shenanigans. She might have backed up and hit him, although the experts say she didn't hit him with her car. He was found dead on the lawn of 34 Fairview in Canton, Massachusetts. She and the defense say that he went inside the house and there was a fight and he fell and hit his head, and they put him on the lawn later on that day. The prosecution said she backed up her car and she hit him. He did like a pirouette and yeeted himself and landed in the yard several yards away. Sorry, if you know, you know. And so she was on trial not once, but twice for hitting him and yeeting him. So she was found not guilty. So the first trial was a mistrial. The second trial, she was found not guilty. And she was convicted of a DUI charge because she was sectioned and taken to the hospital, and they'd drawn her blood, and that's how they know that she was intoxicated. So could Lindsay also have two trials? Unless by chance they acquit her, right? If they find her not guilty on anything, they find that she wasn't insane and that she didn't have intent, sure. I don't know if he was a cheater. That hasn't come in. So I'm waiting. I'm looking at the evidence that's coming in. So I'm like waiting. Okay, the camera's moving, just FYI. So we might be going back to trial. Oh, John O'Keefe, was he a cheater? No. Could they take Patrick to trial if she's found not guilty? Well, they have to have evidence that Patrick did it. Susan Smith. I know about the Susan Smith case. Yeah, body temp matters because he was in the snow for longer than her. Right. Did the snow insulate him? Just giving questions out there. Because, you know, one thing leads to another and leads to another and leads to another and on and on and on. Okay, why do they care if things were superficial? Because what they're saying is it's a hesitation wound, right? If you were serious about harming yourself, you would do it. And especially with her being a nurse, she would do it. That they wouldn't be superficial, which means that they're not that deep. That's what they're saying. That's what they're alluding to if you didn't get that. Does that make sense? Let me know if you need me to clarify more. Yes, Lindsay's trial has nothing to do with guilt or innocence, but they could, I mean, technically, they could find her no on both ends. They could. It determines if she goes to state hospital or state prison. She's already pled. Oh, she already pled guilty. Thank you, Blizzy. Yeah. Oh, you're right. Busy, you're right. I'm wrong. I'm totally wrong. You are totally right. She did. She pled guilty to the children. You're right. I'm wrong. What's a hung jury? A hung jury is where they all have to decide unanimously. Every one of them have to agree to one way or the other. If they do not decide and they are, even if it's just one person, that's called a hung jury. So you have to say yes, guilty, yes, not guilty, and all 12 jurors have to agree. And if there's just one person who says no, it's called a hung jury. That make sense? You know, I'm not sure if the body temperature is so important. Well, what they tried to say earlier was that she wasn't bleeding so much, so they didn't really have to take care of her injuries because she had hypoxia. That's what the judge was trying to allude to, was saying that because your blood would coagulate, meaning it wouldn't be, you know, gushing out as much. So the defense is saying, well, she was cold, so therefore her blood wasn't gushing. Layman's terms, right? And if I'm wrong, if somebody's in the chat and knows more, then let me know. That's what my assessment is of that. Because they keep going on stating that those injuries weren't so bad. It would be hypothermia, not hypoxia. Thank you. Busy's in our end. Busy, can you be our consultant on this case? It probably did when she was warm because pictures show that. Yeah, because Patrick didn't say it looked like someone sprayed the room. Yeah. No, they're not finished for the day. They're on a break. They're on their lunch break, and their breaks just are weird. The judge said this morning that they're going to go until this afternoon, which means like 3 or 4 this afternoon. So we're just waiting for them to come back from lunch. What do I think happened in the John O'Keefe case or Lindsay Clancy's case? Okay, that's what I thought. I had that they were coming back at 2, but checked and didn't see. Yeah, this one. Oh, in Lindsay's case, what do I think happened? Oh, so based upon what's in evidence so far, it appears that once he left, she did the deed, and the deed was done. From what I gather, if I'm wrong, you can let me know. From what the prosecution said in their opening statements, was that it was done by the time he had called her from CVS. So within 10, 15 minutes, maybe less than that. And then I feel like she panicked. I feel like she panicked and she was like, I don't know what to do. And she was like, it perhaps maybe in a manic and psychosis state that she just didn't know. And then she was just, because it's alluded to that she harmed herself. I have to be careful what I say. I don't want to get dinged on these platforms. She harmed herself, then she ingested some medication, and then she went out the window. So to me, that was like, if this doesn't work and this doesn't work and this doesn't work, then yeah. But so he was at the CVS parking lot for a couple of minutes before he went in. So that's why I'm taking that time there. So by the time it took him to go from CVS to, he was sitting in the parking lot doing an email or something like that, and then he went into the place looking around and then found it. Whatever that time frame is, that is when apparently to the prosecutor that she did it. Yeah, she asked for the DNR after she coded or before. It was afterwards. We got that from the psychiatrist later on. She clarified that. She asked to get a stool softener for the kids, like it's escaping me what the name of it is. It's a stool softener to help regulate. Okay, we're back. Hold on just a minute, everybody. Okay, so I have to say goodbye to my Facebook friends because I know Facebook will not allow me to do this. So Facebook, if you want to join me over on YouTube, please go do. It's the same channel, Legalese123, but we'll be back afterwards to chat. So I have to say goodbye to you. So I'm goodbye. Okay. TikTok, I have it behind me. So let me, when it comes on, it's quiet at the moment. Let me know if you guys can hear it. And we'll kind of go from there. All right, hang on.
For the jury? Sure, yeah.
Oh, they're approaching. All right, let me know, TikTok, if you can hear it. I know that can you hear the beeping? Oh, sorry, YouTube, hold on. Let me get it up for us. 1 second. Here we go. There we go. Hi. All right, if you have not done the likies, the subscribey thingies, and follow me, please do. So we can all chat and stuff. Now, as we get going, I might not be able to chat and do 2 things that can't chew gum and walk at the same time. So they're at sidebar at the moment, and we're live, so I have no Zoom room. So I take notes and I take pictures of things, so I post it on my Facebook or X, same channel name, same channel name. So it's important that if you like me here, go like me over there, because I do, especially Facebook, I post a whole bunch of stuff. I do everything. I do the motions and everything in between. Okay. So we're coming back.
All right,
Let
and
me
with
know
that,
if you
you
can
ready
hear
to
it on
adjourn?
TikTok.
All right.
All right, we are on witness number 26. 26. When they go to sidebars, the lawyers go over and talk. We don't get to see them. The camera pans, but you can't hear what the sidebars are. Oh, you can hear. Yay! All right, let's see if they'll allow me to keep this on here. It's behind me, so you can't see it. And I'll try not to talk over witnesses so you can hear. So, if I'm quiet for a minute, it's just because I want us to hear the witnesses. You don't want to hear me. I think about 6 weeks is my guess for trial. It's just my opinion. In my opinion. It's day 5. Hi, everybody.
This court's now in session. Please be seated.
Okay, I'm going to be quiet,
The record, we return back to the trial.
but I can type
Commonwealth
it to you.
versus Lindsay Clancy. All parties are present, including the defendant and including the 18 jurors.
All right, thank you, Madam Clerk. Commonwealth, you ready to call your next witness?
Yes, Your Honor. The Commonwealth calls Dr. Biswas.
All right, Dr. Viswas. I don't know how to spell that. Let us know. Oh, thanks, Justine. I appreciate you. It's the prosecution's case so far. These are all their witnesses. Oh, thanks for answering questions.
Doctor.
Okay, I'm going to be quiet.
Commonwealth, please.
Thank you, Your Honor. Good afternoon. Can you please state and spell your first and last name?
Yes, my name is Jillam Biswas. My first name is spelled Jhilam, last name spelled Biswas.
And your date of birth?
Date of birth is 9/12/1982.
What do you do for a living?
I am a forensic psychiatrist and I work at Brigham and Women's Hospital.
And what is a forensic psychologist or psychiatrist? Pardon.
Well, I'm a forensic psychiatrist by specialty training, and we work in the courts often doing forensic evaluations of individuals, but I'm also an adult psychiatrist, and I work at Brigham and Women's Hospital as an adult psychiatrist on the consult liaison unit.
And can you just briefly describe your education and training background that qualifies you for this work?
Sure. I grew up in the South Shore. I went to Dartmouth College, and then I went to medical school at UMass Chan Medical School. I then did my psychiatry residency at Harvard Longwood, which consists of Brigham and Women's, Beth Israel, Boston Children's at the time. And after that, I did subspecialty training after my psychiatry residency in forensic psychiatry, again at UMass Chan Medical School.
And focusing in on January of 2023, were you working at the Brigham and Women's Hospital?
I was.
And specifically on January 25th, 2023, did you interact with a patient there named Lindsay Clancy?
I did on January 26th.
26th, okay. And in what capacity did you interact with her? As a forensic psychiatrist or as a member of the staff at Brigham and Women's?
I interacted with her as a member of the staff, the psychiatry staff at Brigham and Women's Hospital.
And did you have a particular role that day on January 26, 2023?
Yes, I was on the consult liaison service, which is the psychiatry service that's called by medical and surgical specialties to help evaluate and provide psychiatric recommendations.
And did you meet with Ms. Clancy on that day on the 26th?
I did.
And was that around 2:14 p.m. that you had that interaction?
I think it was somewhere between 2 and 3 o'clock. Yes,
And when you met with Lindsay Clancy, was that in her hospital room in the ICU?
it was.
And was she intubated at the time?
She was.
And was she awake?
She was awake.
And was she oriented?
So she was intubated, so it was difficult for her to really answer a range of questions. And so she gestured to me to be able to write. And so we knew that she was really exhausted and anxious from the entire experience and the evaluation. And so we didn't ask her all of the questions around orientation.
When she gestured that she wanted to write, did you give her something to write with or something to write on?
I did.
And what did you give her?
Paper.
And did you also give her a pen or something like that?
I did.
Okay. And was she able to, when you asked her certain questions, was she able to answer those questions by writing the answers on the paper?
She was.
Okay. And did you ask her about her mood that day?
I did ask her her mood.
And what did she write?
She wrote horrified.
And what was her affect during this interaction?
At the time that I saw her, she was intubated, and that in and of itself is very uncomfortable. And so she seemed very anxious.
And did she write anything else on that paper that you saw?
Yes, the entire evaluation was done through writing because she couldn't speak.
So what types of questions were you asking her, and what was she responding with?
So we asked her, how are you feeling? Horrified. And then she wrote down, do I have an attorney? And I said with my team that at this time, we're just getting to know you and getting to know the case, and we're not sure exactly, what is happening. And we asked her, do you have questions for us? And she asked, is my body broken? Are my legs straight? And she then asked about, can she have visitors? And, where her family is.
And when you are asking her questions, what is the goal of the questions that you're asking her? What are you trying to address or assess?
It depends. Psychiatrists are called for all kinds of issues that happen in the hospital. In this situation, we were asked around, diagnostic clarity, that there was a likely suicide event that occurred. Can you evaluate her for safety at this time before she goes into surgery?
And I know that she was intubated, so she's writing her answers. But based on the answers she wrote on the paper, did she seem to understand the questions you were asking?
Yes.
And her responses, did you understand those?
Yes, she was anxious and she needed breaks. And I said, anytime you need a break, we can leave. But she did write to us those particular answers.
So what she was writing, even when she asked if she had a lawyer, those were things, what she was writing made sense given the situation. She wasn't writing, is there a unicorn in the corner, right?
Correct.
Like that.
What? I'm sorry, I didn't hear that. What?
If there was a unicorn in the corner. So what she's asking, do I have an attorney? Are my legs straight? Is my body broken? Those all made sense given the situation she was in, correct?
They were relevant answers and questions she was asking.
Okay. And are you familiar with the characteristics of psychosis?
Yes.
Okay. And what are the typical signs or symptoms of someone who is in psychosis?
It really depends, and it ranges across a spectrum of symptoms. So we have a whole category of different types of symptoms that we look at for psychosis, and they are different for everyone. But, they can be what we call negative symptoms, which are more internal, isolating, not responding, not reacting very much. And then we have symptoms like positive symptoms, that's what we call them in psychiatry, but they're a little bit more outward focused where objectively you can see what those symptoms are, like being paranoid, darting your eyes around, responding to internal stimuli, which means you're responding to voices, and, you know, being within a delusion. So there's all kinds of symptoms and they look different for each and every person.
In your conversation with Ms. Clancy, did you notice any internal or external signs of psychosis?
At the time, I documented that I did not note those.
And did you also note that, you know, she was, her thinking was linear, goal-oriented, thoughtful, and she didn't appear to be responding to internal stimuli?
Yes, that is typical language in psychiatric mental statuses, and I did document that.
What is internal stimuli?
Oftentimes, it's very difficult for our patients to be able to articulate what they're hearing. They may have perceptual disturbances like hallucinations or auditory hallucinations and maybe hearing voices. When it's really active, we often see those individuals interacting with those voices. I didn't see that in that particular moment.
So, for example, you could see someone engaging in a looks like they're engaging in a conversation with someone, or looks like they're looking over at something, thinking something or someone is there when they're not. Is that
correct? That's what responding to internal stimuli is. Yes.
And you didn't see any of that present with Ms. Clancy?
Correct.
And would it be fair that some of the obvious signs of psychosis would be someone whose thoughts are disorganized, that their thinking isn't linear, that they're not making sense, things like word salad where they're just throwing in words, making sentences that don't make sense?
So you describe symptoms that we can see in people with serious mental illness who have a psychotic disorder with active symptoms.
And you didn't see any of that with Ms. Clancy, is that correct?
Not in that snapshot moment of time.
Right. And to be clear, you only saw her for a limited amount of time on that one day, correct?
That is correct.
And this is January 26th, 2023, about a day and a half or so after she's admitted to Brigham and Women's.
That is correct, yes.
And she's still intubated.
Yes.
And one of the first questions she asks is, do I have a lawyer?
Yes.
And did you have any, based on your training experience, did you have any thoughts about her awareness or thoughtfulness about the questions she asked or the answers she gave?
I don't know what that means, objection.
Okay, if you could rephrase that.
Did you have any assessment professionally of the responses and awareness that she had?
Yes, at that time, I was trying to assess, you know, is she confused or oriented? Is she completely disorganized? Is she so anxious that she won't be able to sleep? I was assessing suicidality mostly. I was being called into the room for that. And so there were a lot of things that I was assessing all at the same time before the surgical intervention that was going to happen. And did I answer your question?
Yes. Okay. All right. And so in doing that, in evaluating all of those things, did you have any concerns at that point in time that she couldn't make a decision to have the surgery, or that there was some cause for concern there in her behavior?
I felt she had the capability to make the decision for surgery at that time.
I have no further questions. Thank you.
Thank you.
Mr. Reddington.
Afternoon.
Good afternoon.
So just a couple of questions. When counsel was asking you about psychosis, apparently you've dealt with people, some of your patients, while you're working in the hospital that in fact were florid. They had psychosis and symptoms of psychosis.
Yes.
So you've dealt with people is it a fair amount of people that would actually hear voices?
Yes, I've seen many patients that are hearing voices.
And were they, to your knowledge, were they involved with command hallucinations, things of that nature?
My patients in the past?
Yeah.
Yes.
Yeah. A fair large amount of people that you've treated over the years that have suffered from command hallucinations, hearing voices, delusions, things of that nature, right?
In my career, yes.
And do you know whether or not there had been any indication from Lindsay as to, well, in the hospital, having any delusions or psychosis symptoms of that nature, if you know?
So I saw her, she had only been in the hospital for a day and a half.
Right.
And I hadn't heard about any psychotic delusions
And that's
from anybody.
what you saw, though. I mean, as far as you, like, how often would you see her?
I see. I saw her one time.
Once. Okay. How long did you, how long were you evaluating her?
It's not me. It froze.
Probably because she was intubated.
Oh no, it's not me.
Probably because she was intubated.
It's not me. Oh shoot, hang on. The live feeds just went geek. We'll give it a second and see. If not, maybe we'll see if there's another live feed. Okay, it's back. We didn't get the answer. Oh no. Hang on. Oh no. Hold on. Live streaming is dynamic. Live streaming is dynamic. Oh boy, let's see. Hold on just a second. I assume all the feeds are this way.
Absolutely. And for some, it can be more continuous. It really depends on the patient. And
okay, hold on just a second. I might have to switch feeds. Give me just a second. Sorry. When you're live streaming, it can be very dynamic. Okay. Port TV has it. I don't know why Idaho.
Their illness.
Okay. So basically, you're saying that it would be case.
Okay, we're back. Hold on.
Specific?
Yes.
All right. And in the 20 minutes or so that you had when you're dealing with Lindsay, were you aware of her prior medical and psychiatric history?
When we get consulted on a case, we...
I'm sorry, I didn't mean to interrupt you. I'm asking, were you aware of her medical and psychiatric history?
I was aware of the portion that was in the medical record before I saw her.
Okay, so that would deal with, as far as postpartum psychosis?
Could you ask that question again?
When you looked at the medical record and when you were involved evaluating her on behalf of the hospital, because you weren't a psychiatrist that her mother or father had retained and asked to go see her, right?
Correct.
You were working for the hospital.
I was working for Brigham and Women's Hospital.
And you had spoken to a number of people before you interacted with her for the 20 minutes that you saw her while she was there for a month, right?
No.
Okay. Now, were you aware of her history of documented postpartum depression?
I was aware of mostly the postpartum anxiety that was in the record, yes.
And postpartum anxiety, the symptomology would be insomnia?
Yes,
and
can be.
Did she have insomnia prior to seeing you for 20 minutes?
Yes.
And do you recall the length of time that she would be suffering from insomnia? Was it like a week, a day, a month, or what?
I don't recall the timing exactly.
Do you recall that at one point that she was on medication and actually went for 48 hours without sleep?
I don't recall that exactly from the record, that number.
Do you recall, in addition to the insomnia, that she was concerned as asking you if, in fact, her brain was broken?
She asked me, is my body broken?
Okay. Did you see in the records that she was concerned about the effect of the drugs and whether or not her brain was broken, quote unquote?
I did not see that language in the records.
How about acting on command hallucinations, conversations or statements to the effect that she was having thoughts of suicidal ideation? You know that, right?
I did know about the suicidal ideation, yes.
How many times did she express to people that she would tell people that she had been concentrating on committing suicide? If you know.
I don't recall the number of times.
So in any event, you know that she was insomnia. You know that there was a significant period of time that she was suffering from insomnia. You knew that she was expressing suicidal ideation. How about homicidal ideation? Did she express that?
Not from my review of the records.
Okay. Would that be indicative of a person that could be in psychosis expressing concerns about homicidal ideation?
No. Overall, allow it.
Sorry, I don't know that question. Could you repeat that question?
Sure. Is that one of the factors that one would be concerned about as a psychiatrist if a person was expressing homicidal ideation?
I would be concerned about that as a psychiatrist.
And in fact, in this case, you knew at least about the suicidal ideation that she had been expressing, right?
Yes.
But you didn't know about any homicidal ideation she was expressing, right?
From the records or
prior
from...
to coming to see you for 20 minutes?
I knew that there was an event that had occurred and that
3 children died. That's the event you're referring to, right?
Yes.
Okay.
Right. Next question.
Now, as far as the period of time that she was involved with, by the way, what's hypomania?
Hypomania is sort of the gradual increase towards mania, the symptoms that we see in somebody who might have bipolar disorder. And with bipolar disorder, we see mixed depression and we see mania and we see symptoms that kind of gradually increase to mania. And we call that period hypomania.
Did she exhibit, to your knowledge from the medical records, any periods of hypomania? Excessive cleaning, exercise, or activities, being awake at night, things of that nature?
At that moment, on January 26th, I don't remember reading about that.
Okay. Do you have any memory of reading about it at all? Other than that moment? As a treating physician, a doctor, psychiatrist?
I don't remember.
So what is your purpose at the hospital? I mean, you're not treating the person for any illness that they have as far as their mental condition, right? You're not treating them.
We are.
Oh, you are?
Yes.
So you're concerned about, obviously, their symptomology, if any, that they present at the time that you're looking at them and talking to them, or in this case, she couldn't talk, but
She couldn't talk and she was going into surgery, and we had recommended suicidal precautions. We had recommended trauma-informed care so that she was getting the care that she needed. She was going to go into surgery. And then after that, we were going to continue to follow her and assess her and make sure that we were evaluating her appropriately and making recommendations to the surgical team for the care that she needed.
You all set?
Objection.
So when you're dealing with this person that's going into surgery, did you know what type of surgery she was going in for?
At the time, we knew that she was going into surgery for her spine.
Did you know what happened with her spine?
I knew that she had injuries to her spine.
Did you know that there was a transection injury, that her spine was basically exploded in T5, T6, other thoracic vertebrae fractured, including the cervical vertebrae up by her throat? You knew all that?
We were reading about it. It was all actively happening at that time.
Was she in pain?
Yes, I'm
Yes.
sure she was.
Was she on medication?
Yeah, she was on She was on a few medications related to pain and blood pressure.
So she's brought into the hospital. You knew from reviewing her records as a psychiatrist that in fact she coded the day before, right?
I don't recall her coding the day before I saw her. I do recall from the records that she had a coding event after, I think on the 27th or 28th.
Okay, so you were not involved with her when she coded. Did you know that she had any events of that nature right after she was brought from the South Shore Hospital?
I don't know what you're referring to.
You know what a code is, right?
Yes.
Did she almost die before you saw her?
I think it was after.
Okay. How about perfusion, blood in the body and tubes being inserted into her chest? Did you know that from looking at the records?
I think that happened after, but I don't recall because I don't have the records on me.
Okay. So did you know that she had massive transfusions?
Not at the...
On this jury that it was after she saw you that she coded, had transfusions, had double tubes put into her both sides of her lungs. It's your testimony that it was after she saw you? You don't know, do you?
My understanding is the surgery happened after I saw her.
Oh, the surgery did. I'm asking you about the massive transfusions. I'm asking you about the tubes being inserted so that the 300 milligrams or whatever it is of blood can be perfused or taken out of her chest cavity. I'm asking about whether or not you knew that she had coded. I'm not asking about the surgery. Obviously, that took place after you saw her, right?
Objection asked and answered.
No, overruled.
Because that's why you were talking to her, right? To see if she could make an informed consent to a surgery, I guess.
No, I was called for the suicidal ideation.
Okay, I'm sorry. I thought you said that you wanted to talk to her about the surgery as well.
No.
The suicidal ideation continues to this day, does it not?
Objection.
Sustained.
Did the suicidal ideation that you were concerned about continue the time that she was in Brigham and Women's Hospital for a month?
I saw her one time.
Right, I know that, 20 minutes, right?
Yes.
Okay. So you know nothing about suicidal ideation after you saw her intubated and then laying in the bed, and then you talked to her as you've discussed with the jury, right?
That's correct.
That's it.
That's correct.
How about the cops? How many cops were there?
I don't recall.
There were some, right? There were armed men in that room, were there not?
I don't recall. I think they were outside the room, if I remember correctly, from 3 years ago.
Okay, I know it's been a while. Do you recall armed police officers being outside the room?
I think I don't recall.
Do you have any memory of any police officers being outside the room where she was laying in that bed?
I knew she was in custody, and generally in custody.
No, not generally. Let's talk about Lindsay Clancy.
I can't recall.
Okay. Did you know that she couldn't even have visitors in the sense that the police would not even let her mother or father visit with her?
I can't recall.
Did you know that when you were dealing with her, was she handcuffed to the side of the gurney or the stretcher?
She had a soft restraint, according to my documentation.
Soft restraints, okay.
Yes.
Did you have any conversation with the police at all?
No.
And after you spoke to her for 20 minutes, that really ended your involvement with Lindsay Clancy until today, right?
That is correct.
Okay, thank you.
Thank you.
Redirect.
Doctor, when you were being asked about these records that you reviewed, what records did you review?
I reviewed the records in EPIC, which is our medical record at Brigham and Women's Hospital.
And so you didn't do a deep dive into Ms. Clancy's entire psychiatric history prior to coming to Brigham and Women's, correct?
I did, as you do, as is protocol for a consult, you look at the records and you make sure you have an understanding of what's been happening with the patient.
But did you have access at that time to all the records for all the treatment providers, Ms. Clancy had seen regarding her mental health for the last 6 months?
You know, I don't even know. I had some of the records. I don't know if I had all of the records.
Okay. And so you reviewed what you had, correct?
Correct.
And then you met with the patient, correct?
Correct.
And in meeting with her, where she's, you know, she's had these events happen. She's had the tubes in her chest. She's about to go into surgery. One of the first things on her mind is, do I have a lawyer?
I'm going to
Correct?
object to that, move to strike that. First of all, it wasn't part of cross. Secondly, this is the fourth time the council has tried to accentuate that.
Oh, well, I'll allow that question. Go ahead.
Well, that was one of her first thoughts was, do I have a lawyer? Correct?
She wasn't able, she was exhausted. She was intubated. She could barely talk. She was writing and she was getting ready for surgery. And so those were the few questions that came up.
Right. She's exhausted. She's anxious. She's in pain. She's about to go in for surgery. And she wants to know, do I have a lawyer?
Objection. Sustained.
So given the condition she was in at that time, you know, the defense counsel asked you about the pain she was in. Defense counsel asked you about the surgery she was about to go into. Those are the issues that she was focused on. In your conversation with her, am I broken? Are my legs straight? Do I have a lawyer?
Yes.
Thank you.
She wasn't focused on much while she was exhausted, in pain, anxious, and concerned about the future surgery that she was imminent, was she?
If you could speak up, ask that question.
Sorry. She wasn't focused on much of anything while she was exhausted, in pain, unable to talk, and anticipating imminent surgery, right?
That's correct.
Thank you. That's all I have.
Anything, Como?
No.
All right, thank you, Doctor.
Thank you. Thank you.
Oh my goodness. I have to pause. I have to pause. Holy smokes. Okay, so just FYI, that's what I live for. I love when these lawyers go after each other, but not the witness. This poor witness, she only assessed Lindsay for 20 minutes, right? So like, what can she say? But here's the point. So anytime you always ask yourself, why is this witness being called? Whether it's for the defense or for the prosecution, what information is it so pertinent that they get in? And we all know it's because she asked for a lawyer. That was what the other one testified to. That's what this one testified to. So it's not necessarily about what her mental state is, etc. It's about the lawyer. So when you're listening to these things, think about what and why these lawyers. And when Reddington, her defense attorney, he's going hard at her. Why? He didn't need to. He didn't need to go hard at her for any reason, but he was trying to get her to say things. So if you could see, he was kind of like confusing her, and he was confused himself, right? Reddington. And you missed it earlier. I asked him, does he even know what witness is on the stand? Is he paying attention to what's being asked? Because he asked the MSP trooper, was she a chemist? Just like, Reddington, what the heck are you doing? So this witness who only saw her for 20 minutes, right? She can't diagnose Lindsay in 20 minutes. She, again, was there to do what the other doctor told her, to go and look and see the safety measures for her. And I don't know the time frame of the other doctor. So it is bonkers to me why he went after her. He is just so aggressive. The poor doctor, somebody said, I think she's going to cry. Absolutely. She's like, I'm just a psychiatrist. So again, I think I've said this before. Both lawyers are asking questions that they're trying to get the jury to understand, knowing that this particular witness can't answer that. So to me, the lawyers are testifying. The lawyers are testifying, right? They're trying to get things out and say that, they're trying to get evidence in. And just remember, The jury is only supposed to hear what the testimony from the witnesses are, and that's the evidence, not the lawyers asking questions, not the opening statements or the closing statements. Just so effort. And yeah, he's doing his job. He's advocating for his lawyer or his client. So absolutely. Yeah, it's just credit the doctors. Absolutely. He's doing what he's supposed to do. So, all right, we're going to continue. Thanks for the chat, everybody. It's great. But I mean, so I live for Reddington, just FYI. He's great. So you get to see my reactions in real time. Okay, let's continue. Okay, we are on witness number 27 for the Commonwealth or the prosecution.
Commonwealth would call Robert Flynn as his next witness, please.
Robert Flynn. I always like to play a game when we see him. Is he doctor? Is he...
Attorney Buckingham, please.
Thank you. Good afternoon. Could you please tell the jurors your first and last name?
Robert Flynn, Flynn.
And how are you employed, sir?
From the Duxbury Police Department.
What is your current rank or assignment there?
Currently, I am a patrol sergeant.
How long have you been with the Duxbury Police?
About 7.5 years.
Going back to January of 2023, what was your assignment then?
I was assigned to the Detective Bureau.
So if I draw your attention to January 24th of 2023, were you working that day or were you called in?
Both. I worked the 8 a.m. to 4 p.m. shift, and I was called in later after my shift.
Okay, so you became aware of an incident that occurred in the town of Duxbury approximately 6 p.m. that evening?
Yes, ma'am.
And so when you come back in after working that day shift, where do you go or where are you directed to go?
I was contacted by Sergeant Detective Jamali, who informed me to respond to 47 Summer Street.
And so while you're en route to that location, are you monitoring the radio?
Yes, ma'am.
And are you monitoring communications with other Duxbury officers?
Yes, ma'am. I had a department-issued vehicle that I took home, and I responded to it in that vehicle, and I had scan on, which is getting all surrounding agencies, including fire, Pembroke, Kingston, Marshfield.
And while you were en route and had that radio on, could you hear officers screaming and it being chaotic?
Yes, ma'am.
When you arrived at 47 Summer Street, were there already other first responders there?
Yes, ma'am.
And is it fair to say that when you actually arrived at that location, you were made aware that the children that were on scene had already been transported?
No.
Okay, so what did you know when you arrived? What did you
I knew that there was an incident involving children. I learned that when I initially responded and spoke to Sergeant Homestead. He was the one that informed me that it appeared that a mother had killed her 3 kids.
Okay, but when you got there on the scene, were the children still in the house?
So I was under the impression that they were still in the house because most incidents I've had involving a sudden death at a house, the fire department declares them on scene and it becomes a police matter and we help with the investigation.
Okay, and that was your understanding based on the information that you had, correct? But did you come to learn that the children had been transported?
Yes, ma'am.
And how about the individual, the person, the 4th person, if you will, on scene? Were you advised that there was a woman who had been transported from the scene as well?
Yes, ma'am.
And as a result of kind of the nature of what you believed you were coming into, did you call for extra help?
With our own department or?
With an outside department?
Yes. So the Massachusetts State Police has jurisdiction over any death investigation in town of Duxbury and other communities. So we are to notify investigators of the state police.
And as a detective at the Duxbury Police, you're familiar with that relationship with the state police, that oftentimes when a death investigation occurs, that you work in connection with the state police detectives unit of that jurisdiction to conduct an investigation, correct?
Yes, ma'am.
And so in this instance, when you went there, you believed that the children had already passed, so you made that phone call to the detectives unit, correct?
That's correct.
And certainly, sometime thereafter, you were advised of the children's passing and that this was a death investigation, correct?
That's correct.
Once the children had been removed from the scene and the defendant had been removed to the scene, did you and your other officers from the Duxbury Police Department do anything to secure the scene?
Yes, so once we gathered more information and I notified the Massachusetts State Police, we decided to conduct a security sweep of the house. This is to make sure that there was no further suspects or further victims or any other people in the house that we may have missed.
In regards to this security sweep, what is the goal? You just described it to kind of identify if there are other people, but as far as your observations and your contact within the house, you try to minimize your contact within the house in those instances?
Yes, I'm not searching for any type of evidence. I just have different observations that I obviously notice.
And what areas of the house did you go into prior to the arrival of the state police?
I entered with three of us, Sergeant Patrikas, who's from the Kingston Police Department, and it was Lieutenant Weiler at the time. So we all kind of went into our own separate rooms and separate ways throughout the house. But I think ultimately all three of us went to all 3 floors of the home.
Okay, and so talking first about the main floor of the house, did you go into the kitchen area?
Yes, I did.
And did you make any observations in that kitchen area?
I observed, it was clear to me that there was young children living there. There was some paintings on the wall. I noticed a takeout food bag. The only word I remember from that is it being Mediterranean written on the receipt.
Okay. And if I may approach with a picture. Showing you the pictures just accurately depict the kitchen area that you observed.
Yes, ma'am.
I've moved to admit
That may be admitted.
Just kind of showing you on the screen what's now been marked as Exhibit 44. This is the kitchen at 47 Summer Street, and in the middle of the photograph is a takeout bag, correct?
Yes, ma'am.
And you're aware that in the background here of the photograph where there's a kitchen table, there's kind of a door next to it.
Yes, ma'am.
And then there's, on the other opposite side, there's a slider door, correct?
Correct.
And in addition to making those general observations about the kitchen area, did you go in other areas of the main floor of the house?
Yes, I did.
And in the living room area, I'll show you what's been marked already as Exhibit 25. Is that familiar to you as well?
Yes, ma'am.
And again, upon your kind of sweep of this house, what stood out to you about the living room area?
There appeared a young child lived there, and there was food on the couch, a snack.
And in this photograph, can you see a couple bowls, a bowl here on the bottom of the photo and a bowl further up on the couch?
Yes, ma'am.
Now, in that main area of the house, you didn't find any other individuals, correct?
Negative.
And had you been made aware that the husband, Patrick Clancy, had been on scene and he had also been transported from the area?
Patrick Clancy was on scene when I was there.
Okay. At some point, did he go in an ambulance?
Yes.
Now, in that second floor of the house, or well, let me ask you, what's the next area of the house that you recall going through in this sweep?
Into the basement.
Now, were you advised that things had occurred in the basement?
I think so. I'm not really.
And fair to say, this was still, upon your arrival, a pretty chaotic scene.
Correct.
There was a lot of firefighters around, a lot of equipment going around.
Correct.
Okay. In that basement, did you do a full sweep of every room in the basement?
Like I said, 3 of us combined and made sure that we at least hit every part that a human or something could be in. So, yes.
Okay. But as far as you yourself, fair to say you just kind of went in on the left side?
Yes, I went into the left.
And did you see a lot of the firefighters' equipment still left behind?
Yes.
A lot of medical supplies?
Yes, ma'am.
Now, going up to now the second floor, did you go to the second floor of the home?
The top floor?
Yes.
Yes.
And did you enter into the master bedroom?
Yes.
And is there anything that kind of struck you about walking into that master bedroom as far as the temperature of the room?
It was colder than the rest of the house.
And did you notice that there was, in fact, a window open?
Yes, ma'am.
So I'm just going to show you what's been marked as Exhibit 43. Is that familiar to you as the window that you observed open?
Yes, ma'am.
And as far as the furniture in that bedroom, did you make any observations of a bed in the room?
Yes, ma'am.
Was there anything that stood out to you on the bedding or in the area of the bed?
The bedding itself?
If it stood out to you.
Not necessarily, no.
How about
the
the
first time.
items on the bed?
Yeah, so Sergeant Patrikas pointed out that there was a cell phone on the bed.
Okay, I'm just going to show you. It's already been marked as Exhibit 42. Let me see. Is an object. Is that how it appeared when you first entered into the bedroom?
Yes, ma'am.
The phone. At some point, were you able to go out to the backyard of the home?
Yes, ma'am. So after leaving the upstairs, we went back through the kitchen, and that's what we talked about earlier, and went up through the back slider.
And were you able to make observations of the backyard area?
Yes, we came up to a porch and took a left, which would have been the back right side of the house. And there was some matted down snow and some other medical equipment, which we believed was the window that Lindsay Clancy came out of.
And from that area or that vantage point in the backyard where you were, could you see into other areas of the house?
Yes.
And what areas of the house could you see into?
Near where that area was, there was a basement window that kind of went into, but later learned what it was, but a basement window to like an office or gym area.
Show you Exhibit 38. Is that familiar as the backyard view?
Yes, ma'am.
And fair to say there's an area here of the photo that I'm pointing to with my pen, which is kind of on my right. That is a window well. Is that the window you could see into?
Correct.
And then again, in this photograph, do you see the open window that you observed when you went into the bedroom?
Yes, ma'am.
As far as that open window, when you were in the backyard, did you see any screens or anything around the property that would give you any indication of how that window was open or the condition of the window?
No, to me, it appeared that the screen was just pushed up.
Now, again, as you and the three other investigators did that sweep of the house, you didn't touch or move anything, correct?
Negative.
And once you did that security sweep, is there a protocol in place to make sure that the scene remains as it is until the state police arrive?
Yeah, so there was one of the officers was logging individuals that were in and out of the house. Crime scene tape was put up around the property. The doors were secured, and around this time is when I received a phone call from Trooper McKellican.
Okay. And did you remain on scene?
We remained on scene until some troopers showed up to the area.
Okay. And while you were on scene, did you attempt to help coordinate other members of the Duxbury Police Department to take care of other things like going to the hospitals and securing coverage?
The decision for who was going to the hospital was made by our command staff, but I met some of the troopers back at the station to coordinate further.
Okay, and when you were back at the station, were you aware or advised that a search warrant was sought for the residence?
Yes, ma'am.
Did you go back to 47 Summer Street with the team when the search warrant was received?
Yes, ma'am.
And did you participate in the execution of that warrant?
I was present during it.
Okay. Fair to say, though, you didn't, you weren't responsible for searching any particular location or collecting any evidence?
No, ma'am.
That was reserved for the state police?
For the most part, yes.
At the conclusion of that search warrant, were you asked to go back into the house?
Yes, ma'am.
And what were you asked to go back in the house to do?
Once the search warrant was completed, my lieutenant told me to go back up into the house and close the window in the upstairs bedroom.
And when you went back and got closer to that window, did you make any observations of damage to the window or the window screen?
No.
And were you able to close it and secure the window?
Eventually, yes.
Fair to say there was blood in that area that kind of was in the way?
Yes, and the bed was kind of pushed in front of it.
So did you have to move the bed in order to get to the window?
Yes, ma'am.
As far as anything removed from the home, did you go back into the basement at somebody's direction?
No, ma'am.
At some point, had you helped to remove some medical equipment that the fire department had left behind?
That was during the search warrant.
And is that the only items that you yourself removed from the home?
Correct.
As part of the follow-up investigation, did you work with Trooper McGilligan and some of the other troopers from the State Police Detective Unit to conduct follow-up interviews and gather more information?
Yes, ma'am.
Is it fair to say that the state police were the primary investigators and they took over pretty much everything from that point on?
That's correct.
I have nothing further. Thank you.
All right. Mr. Raythan.
I have no questions. Thank you, sir.
All right, thank you, sir.
Thank you.
Commonwealth calls Mark Farioli.
Okay, so I'm not sure why this trooper is on the stand. I guess maybe like they're talking about chain of custody and who took what and who did what, and he was one that closed the window and he helped get the medical supplies and stuff. Do you feel like this one was repetitive? Like what? Remember, we're talking about why was this witness on the stand at this time? What information did he provide to you as the at-home juror that would solidify you going one way or the other? And remember, yeah, maybe because of the phone, but that was already been testified to because it's already in evidence. That picture with the phone on the bed, this guy didn't collect evidence. Remember, the other dude came in and collect the evidence. So I don't know. All right. That was witness number 27 for the prosecution. We are on number 28. Thanks for joining me, Law Levies. I appreciate you. Let's go.
Good afternoon. Do you solemnly swear that the testimony you give which is your written reflection, not an opinion between the Commonwealth and its Senate clash, and the truth, the whole truth, and nothing but the truth, so help you God? Thank you, sir. You may have a seat.
All right, good afternoon, sir.
Afternoon, Your Honor.
Can I?
Yes,
Thank you.
please.
Good afternoon. Can you please state and spell your name for the record?
I'm Detective Mark Farioli, Farioli.
Where do you work?
The Massachusetts State Police.
How long have you been a state trooper?
Since 2005.
And back in January of 2020, where do you work?
The Massachusetts State Police.
How long have you been a state?
I'm.
All right, good afternoon, sir.
Afternoon, Your Honor.
Can I?
Yes,
Thank you.
please.
Good afternoon. Can you please state and spell your name for the record?
I'm Detective Mark Farioli, Farioli.
Where do you work?
The Massachusetts State Police.
How long have you been a state trooper?
Since 2005.
And back in January of 2023, where were you assigned within the state police?
I was assigned to the Plymouth County State Police Detective Unit.
And were you involved in a limited way in the investigation regarding Lindsay Clancy?
Yes, I was.
And specifically directing your attention to January 27th, 2023, were you aware that a search warrant was obtained on that date to collect the blood and urine of Lindsay Clancy from South Shore Hospital?
Yes, I was.
And then directing your attention to January 31st, 2023 at 10:25 in the morning, did you go to the South Shore Hospital to collect the blood and urine of Lindsay Clancy?
Yes, I did.
And where did you collect that from?
The lab at South Shore Hospital.
And was that from the specimen process supervisor, Melissa Arcadepane?
Yes, it was.
And do you recall how many vials you collected?
In total, I collected 7 vials.
And was that all blood or urine or both?
6 were blood vials and 1 was urine.
And once you collected those vials, where did you bring them?
I brought them directly to the Massachusetts State Lab in Lakeville.
And did you drop those off at the state lab at approximately 11:15 a.m. on January 31st, 2023?
Yes, I did.
And do you recall who you gave the vials of blood and urine belonging to Lindsay Clancy to at the lab?
Leah O'Connell.
Thank you.
Mr. Reddington?
We have stipulated to the chain of custody for the blood.
All right, any questions?
No, I don't have. Thank you, sir. I have no
All right.
questions.
All right, thank you.
Thank you.
He is a Massachusetts state trooper. He was the one that collected the stuff. Again, Wrightington just stood up and said, we're not disputing the chain of custody. So, but again, the prosecution has to have this in there. They have to say chain of custody. They have to say who did what, where, when, how, and why. It's especially since, just FYI, Massachusetts State Police is under fire in Massachusetts. It's a mess. Trooper Michael Proctor, you messed it up for everybody, right? So it is important for them to say, look, not all Massachusetts State Police officers are not following procedure. So I think it's important that it comes in. That's my opinion. You can let me know what you think, but 5 minutes, come in. What did you collect? I think it's important. All right, we're going to continue. Number 29. Who's up next? By the way, I write notes. So if you see me writing, I write notes. I get everything down. I post them. I'll tell you after I'm done where I post everything. Oh, did you hear who's next? I think the McConnell girl is next. All right.
Hi, good afternoon.
Good afternoon, sir.
All right. Counsel?
Thank you. Good afternoon. Can you please state and spell your name for the record?
My name is Leah O'Connell, Leahoconnell.
Where do you work?
Currently, I'm employed with the Massachusetts State Police as a trooper.
Back in January of 2023, were you also employed with the
Hang on,
state
I got to get
police?
her last name.
Counsel?
Thank you. Good afternoon. Can you please state and spell your name for the record?
My name is Leah O'Connell, Leahoconnell.
Where do you work?
Currently, I'm employed with the Massachusetts State Police as a trooper.
Back in January of 2023, were you also employed with the state police?
I was at the crime lab.
And what were your responsibilities at the crime lab at that time?
So I was a forensic evidence technician, so we would receive evidence submitted to the lab for testing.
And once you received that evidence at the lab, well, first of all, who would you receive that from? Would that be chemists? Would that be troopers? Who would it be from?
It was local, state, sometimes federal agencies, but there was also scene evidence gathered by chemists that we would have to log into the system.
And so would it be your responsibility to take that evidence, log it into the system, and move it along for a process through the lab?
Yes.
And were there tracking numbers or lab numbers that you would assign to evidence in order to keep track of it as it progressed through the lab?
Yes, every case gets its own number.
And directing your attention to January 31st, 2023 at 11:15 a.m., do you recall receiving 6 vials of blood and 1 vial of urine belonging to Lindsay Clancy from Trooper Mark Farioli?
I did.
And when you received those items, did you log them appropriately into the system with her case number?
I did.
And how were they stored after that point?
So they go into a heat sealed pack. So it's like a plastic bag that gets heat sealed, initial and dated, and then it goes right into a fridge.
Thank you.
Attorney Reddington?
I have no questions. We stipulate to the blood, so.
Okay. All right, well, thank you. They stepped down. Thank you.
Listen, I appreciate them. Chain of custody.
John Santos.
They've got to do it. It's fine. As long as it's quick, right? All right, number 30. John Santos. Don't fall asleep just yet. We might get somebody who's exciting that we're like, oh my goodness, this is going to determine everything. Don't panic just yet. He's not coming into the courtroom. I hope he's outside. And I have no Zoom room, so we're in real time. Maybe you need to go get him. So it is 2:12 my time, 3:12 their time. I believe they're going until 4 o'clock. Don't quote me. He said till the afternoon. I don't know what the afternoon means to him. Judge Sullivan is not quite descriptive, and I feel bad for these jurors. So it is what it is. But we're here together, and we're going through it together. Thanks so much for joining me. If you haven't done the heart thing on TikTok, I found out all you got to do is put your finger on your phone and just tap your phone, and it'll make it rain hearts. If you would do that for me, please. Make sure to like, subscribe, follow. Turn your notifications on. Okay, John Santos looks like another trooper or our police person of that matter. Thank you. I see the hearts. Yay!
All right, good afternoon, sir.
Okay, I'm going to mute myself.
Tree Sprague, please.
Thank you. Good afternoon. Can you please state and spell your name for the record?
Good afternoon. My name is John Santos, JOHNSANTOS.
Where do you work?
The Massachusetts State Police.
And what department are you currently in?
I'm assigned to the Division of Investigative Services.
And back in January of 2023, what was your assignment?
I was assigned to the State Police Detective Unit in Plymouth County.
And were you specifically on January 24th, 2023, were you part of a search warrant team at 47 Summer Street in Duxbury?
Yes, I was.
And what was your role in terms of where you were assigned to search within the home?
I searched multiple locations to include the basement, the kitchen area, and then the master bedroom on the second floor.
Okay. And specifically directing your attention to the kitchen area, did you search a cabinet in the kitchen above and to the right of the stove?
Yes, I did.
Showing you a photograph. Is this a clear and accurate depiction of the items you found in that cabinet on January 24th, 2023?
Yes, it is.
Could have this photo marked as an exhibit.
That may be admitted. Maybe admitted.
Showing you exhibit 145 on the screen here. Focusing your attention on the top shelf, there were several notebooks and books that were seized. Is that correct?
Yes.
Were those taken out of the cabinet and cataloged by the state police?
Yes, they were.
Show you 5 items. If you could just look through these and let me know if these were the items that were taken.
We'll stipulate that those are the items that were in her kitchen.
Okay.
If I could have these marked as the next 5 exhibits, please.
Do you want the 5 separate, 5A through?
5 separate.
Okay.
Please.
But we at home probably won't get to see. We'll probably get bits and pieces. So if you're on TikTok and you're not watching, this trooper served a search warrant. There's cabinets of books and notebooks, and they're now putting it into evidence. And Reddington stipulated he doesn't have a problem with it, just put it into evidence. but we probably don't get to see what's in them. But I assume that some of these might be her journals, as far as like her meds and stuff. She had like a postpartum journal that they already put into evidence.
All right, thank you.
And sir, showing you what's been marked 146. Those appear to be discharge paperwork from McLean Hospital for Lindsay Clancy.
Yes.
And this discharge paperwork on the third page included a list of medications. Is that correct?
Yes.
So we have lorazepam 1 milligram, melatonin 5 milligrams, and trazodone 50 milligrams, correct?
Correct.
Along with description of when she used to take those medications, correct?
Correct.
There's also instructions on the 6th page in about resources for therapy and community services, correct?
Correct.
And then Exhibit 147 is a notebook. Inside, it had postpartum depression and anxiety patient information sheet, correct?
Correct.
And then a detailing of different medications and the amounts taken and the dates they were taken, correct?
Yes, correct.
Then there was a book, Good Moms Have Scary Thoughts.
Okay, hold on just a second. I'm trying to grab these pictures, and she went so fast. So give me just a second so I can grab these pictures. I take these pictures and I put them on X and Facebook. So if you haven't joined me over there on these spaces, you can see that she went so quick. So I'm doing my best to take pictures of them and put them on there. I do it after the witness is done, so in real time. Wow, that one was so quick. It's so blurry. I'll do my best to take a picture of it, but I don't think you're going to be able to read that one. Okay, sorry.
Then there was the book, Good Moms Have Scary Thoughts, item 148, correct?
Correct.
And then 149, a postpartum, pregnancy and postpartum anxiety workbook, correct?
Correct.
And nothing is filled out in this workbook, correct?
Correct.
And then finally, Exhibit 150, a notebook labeled Callan Patrick Clancy, correct?
Correct.
And inside this were messages back and forth between Lindsay Clancy and the nanny, correct?
Correct.
Now, you
Okay, hold on.
mentioned,
I've got to go
that you
back.
searched several rooms in back and forth.
Correct.
And inside this were.
So did you hear her? She said that inside this folder about patch. So two things that she said. One, she said that the postpartum workbook hadn't been filled out. And two, that this is looks to be like a folder or maybe a notebook that she was communicating to the nanny about Patrick Clancy. Just wanted to, sounds really important to me.
Labeled Callan Patrick Clancy, correct?
Correct.
And inside this were messages back and forth between Lindsay Clancy and the nanny, correct?
Correct.
Now, you mentioned that you searched several rooms in the home, correct?
Yes, correct.
How do you divide that up? How is it decided who's going to search where when you're doing a search like this in a home?
It's somewhat fluid. We try not to send too many people in one room at a time because we end up tripping over each other to a certain extent. So usually it's kind of as we go along because we don't have an idea of what the layout of the house is before we get there. So it's difficult to plan that. So the supervisors who are overseeing the search will direct different troopers or investigators to search different rooms.
And so you said you searched the kitchen area, correct?
Yes.
Were you present when prescription medication was found in the kitchen, or had you already moved on?
I don't recall the medication being found while I was there.
And when you search a room, are you the only one searching, or are there other team members searching different parts of the room, kind of a divide and conquer?
Exactly. That's how it is. We divide and search different sections of the room.
And you said you went to the basement area. Do you remember what side of the basement you searched?
I was in the office portion of the basement.
And had anyone already been in that room, or were you the first to go in, or did you know?
I believe somebody had already been in that room when I made my way down there. I don't recall who was in there, but I don't think I was the first person to make my way in that room.
And you didn't collect anything in that room, correct?
I did collect
Oh, you
some
did?
items
Okay.
in the office, yes.
What items did you collect in the office?
There was, I believe, 2 laptop computers and a external hard drive.
And so you collected those items from the office. And when you do a search warrant, is there one trooper assigned to keep track of everything that's found, where it's found, who found it?
Yes, there is.
Okay. And so do you recall who that person was in this case?
I don't recall, no.
But when you do find something, is it you bring it to that person and they kind of log it, and then you move on and keep looking for other things?
Normally, the evidence officer would come down. We assign them and label them the evidence officer for each search warrant. They would come down to the area where the item was being recovered from, and we'd also have crime scene services photo the item in place as well before it was collected. So the evidence officer would come to us.
Okay, so for example, with the laptops, photos would be taken of them in the office, and then they would be logged, and then they'd be taken out of the office.
Exactly.
And is that what happened with the books and the notebooks that we discussed earlier?
Yes.
And you said that you then went up at some point to the main bedroom, the master bedroom?
Yes.
And what did you do inside the master bedroom?
I assisted with searching the master bedroom. I don't believe I recovered anything within there.
Do you recall ever looking in the nightstand drawer or anywhere near the nightstand by the open window?
I don't believe I did, no.
Okay. And is there any reason why you wouldn't have gone into that drawer or looked in that drawer?
Somebody else was probably already searching that area, would be my guess.
What area did you search in the bedroom?
I believe there was a closet. When you walk into the bedroom, I believe there was like a closet area to the left. I was in that area. And then I made my way at some point, to the left side of the bed as well.
And did you find anything in the bedroom of note?
No.
Now, when you're doing a search warrant, right when an investigation happens, how do you know what to look for?
Well, it depends on what you're investigating. This case specifically, we knew the facts what we knew at that time. So, I mean, when I noticed those notebooks in the cabinet, certainly I thought that information was pertinent to this investigation based on what we knew. But every investigation is a little bit different. The facts are different. So, yeah. I mean, clearly you want to look for items that relate to the suspect, victims, or any associates of them, and it might relate to the incident that's being investigated.
When the search was being done in the home at 47 Summer Street that night, did officers already know that Miss Clancy had crushed up pills and taken them with lemonade?
No.
Okay. Had you learned from Patrick Clancy, the husband, that Miss Clancy had been prescribed some medication?
I did, yes.
Okay. And were you aware at some point that medication was found in the kitchen?
Yes.
Okay. I have nothing further. Thank you.
Thank you.
Mr. Reddington?
Who found the medication in the kitchen?
I don't recall, sir.
It certainly wasn't somebody randomly off the street. It was a cop, right?
Yeah, a police officer or
State
investigator,
police.
sir. Yes.
And-
Well, we had some local officers there with us as well.
Yeah. So it was law enforcement that found the pill bottles in the kitchen, right?
I believe so.
And seized them. Is that correct?
Correct.
And documented that they had seized them in the kitchen, feeling someone, whoever it was, that it was relevant material to this investigation, right?
Correct.
And the books that we've just gone through, Clancy would be relevant material to this investigation, right?
Correct.
Right?
Yes,
Along with the pregnancy and postpartum anxiety workbook, right?
correct.
Along with the good moms have scary thoughts, right?
Yes,
Along with the documents pertinent to the McLean Hospital where she had been discharged from, right?
yes,
Along with another notebook that had postpartum depression and anxiety, correct?
yes,
There were also other documents that were, items, I should say, that were seized in the house that have already been introduced to the record, 781. And looks like a diary, 783, slept well last night, things of that nature, that was seized as well, right?
I believe so, yes.
You know why all these were seized?
Why the books that I seized were seized?
No, your investigation. Are you a lieutenant, a sergeant?
I'm a captain, sir.
Captain.
Yes, sir.
And back then, what was your captain?
I was a lieutenant at that time.
You were the ranking officer in the search?
No, there was also a detective lieutenant assigned unit commander at that time.
So, but you're up there enough and you knew from the investigation what was relevant and material in the investigation, right?
Yes,
And obviously you or somebody else working with you determined that all of these items, the pills that were seized, the books that were seized from the kitchen, et cetera, were relevant and material, correct?
yes.
Do you know who searched the bedroom? I know you said you were in there. Did you search the bedroom?
I was part of the team that searched the bedroom. There were a number of other officers that searched the bedroom as well. I believe in the report, it documents who seized what from the bedroom.
Okay.
So I don't know off the top of my head who that was, sir, but I know it's clearly labeled in the report.
Okay. Do you have the report?
I do not know.
Do you recall how many law officers were actually involved in that little bedroom searching?
I would have to guess approximately 5.
5? And as counsel asked, when somebody discovered something that appeared to be relevant or material, they would log it in. Somebody that would kind of be the record keeper would log it in, correct?
Yes.
Is there any, one of the things that you would also, you yourself, I believe, seize would be the laptop computers that were downstairs in the office, right?
Yes.
And you seized also, collectively you, I mean, you or the other 5 people, seized the cell phone that was on the bed.
Yes, I believe there was a cell phone seized from the bedroom.
So it made sense as an investigator that electronic media and things of that nature would be important, correct?
Yes.
Was there an Apple Watch involved in this investigation, if you know?
I believe there was an Apple Watch recovered after the fact. We didn't recover at the search warrant, if I recall correctly.
Do you know when it was recovered?
I don't know exactly off the top of my head, no,
The
sir.
Apple Watch that I recovered with Pat Clancy?
I believe so, sir. Yeah, I believe there was a watch that was turned into us after the fact that wasn't recovered during the search warrant.
So looking at this drawer, do you recall that next to the bed or in the bedroom, there was a nightstand and there was a drawer? And inside the drawer were a bunch of pill bottles, an Apple Watch, sleeping aids, things of that nature?
I didn't search that drawer, sir.
Okay, I don't mean to embarrass you, I'm just asking.
Yeah.
Why nobody bothered to search that drawer?
I don't know that it wasn't searched. I just know that I didn't search it, sir. So it may have been searched, and maybe whoever searched it didn't feel that that information was pertinent to seize. I can't speak for them, but I can tell you that I didn't search that drawer.
Redirect.
No, Your Honor.
All right, thank you, sir.
Thank you, Your Honor.
So just FYI, I need to tell you. So while this is going on, I'm writing notes, I'm taking pictures, I'm posting on X and Facebook. So if you missed some of these pictures of what was seized and et cetera, you can go to my Facebook page or X, same channel name, Legalese123. I'm trying to post in real time. I'm trying to do too much. But I thought this was interesting. Why not search the drawer, right? Why did you miss the drawer? And he's like, that wasn't me. And so everybody's like pointing fingers. Did you ever see I think it was the Donald Adelson case in Florida the prosecutor, she posted this picture of 3 Spider-Mans, and they were all like pointing at each other. So I wasn't me. So it's somebody missed it. Is it pertinent to the case? Maybe, maybe not. Jocelyn, you asked, could he have made a call from her phone, her Apple Watch? I'm not sure what you're asking. So, yeah, searching a whole house can be, overwhelming. And again, it's not like it's not a who done it, right? They know who did it, right? But do they have to search through everything, etc.? I mean, if you guys remember the Corey Richins case, if you remember that, they went back and searched that house about 10 different times looking for stuff. So, I don't know. But I thought it was interesting that he went after him. So, we'll see. All right. That was witness number 31. Somebody by the name of Corey Mello. And that name sounds very familiar to me. I know Ken Mello. If you know Ken Mello. But Corey Mello, I think I've heard that name before. So we'll have to see who that person is.
For 1.5
Uh-oh.
1 hour plus. And not
Okay, hold on. The
intervene
feed
about
just
killed me.
totally jumped. Hold on just a second. I don't know why the feed jumped. I don't know what we're doing. So give me just a second. Let me get us back to where we need to. Okay.
Good afternoon, sir.
Good afternoon, Your Honor.
Bring Bucky in, please.
Thank you. Good afternoon. Could you please tell the jurors your first?
Hang on. We have a question. Do you think that him being mean to the witness makes him look bad? Yeah. So just FYI, it's always the defense attorney's number one goal is to make the police look bad. And sometimes it's not super hard, especially with these troopers. Was Lindsay told that she did it, or does she remember doing it? Well, they had the doctors come in afterwards, and she asked about her family. I don't know at that time whether they told her or not. She asked for a lawyer, which to me makes it seem that she knew what she did. Because why would you ask for a lawyer if you didn't know when you're in the hospital after you've come out of your coded coma that she knew? I think she knew because she asked for a lawyer.
And last name?
Okay.
Corey Mello.
And can you spell your first name for the record?
Cory.
And your last name?
Melo.
And how are you employed?
I work for the state police.
In what unit or what's your current assignment with the state police?
Currently, I work for the commercial vehicle enforcement section.
Going back to January of 2023, what was your assignment then?
I work for the Plymouth County District Attorney's Office at that time.
With the state police detective unit?
Correct, yes.
And I'm going to draw your attention to January 24th, 2023. Were you involved in the investigation into the incident that occurred at 47 Summer Street in Duxbury on January 24th?
Yes, I was.
And fair to say that when state police got involved in that investigation, a large group of the state police detective unit went out to Duxbury to work that investigation.
Correct.
Were you the case officer in that case?
I was not the case officer.
Your role in that case, was that to assist in things like search warrants, neighborhood canvasses, interviewing of witnesses?
Correct, yes.
And in this particular investigation, you're aware that there was a search warrant executed at 47 Summer Street after the incident had occurred, correct?
Correct.
And as part of the search warrant execution, were you involved in searching the home?
Yes, I was.
And did you search the various floors of the home, meaning the basement, that first floor, and the second floor?
Yes.
In searching that home, there were a number of other detectives and troopers also searching, correct?
Correct.
Do you recall locating a phone in the upstairs bedroom, a laptop, some workout bands in the basement that were hanging on the door?
Yes, I do.
And when you recovered these particular items or located these items, did you then turn them into an evidence officer, direct an evidence officer to things that you thought might have some evidentiary value?
Yes.
At some point after the search warrant was over, you're aware a lot of items were brought back for further examination, correct?
Correct.
Is that common that when you're working on a search warrant, things are kind of... Mhm.
You all right?
Fit.
Is
I'll
it
be.
common that
I'm.
a lot of times search...
I'm going to be right back. I have to go to use the restroom. I have not used the restroom since this morning. So don't worry. I haven't like disappeared or anything. I'm going to leave this going. I have my headphones on. I can listen. So don't worry. I'm not disappearing on you. I'll be right back. I just need to go use the restroom. So hang out without me. Listen to the testimony.
warrant, things are collected and brought back for further examination.
Yes.
Is that because it's kind of chaotic there and can't really examine things thoroughly on scene?
That's correct, yes.
So in this particular circumstance, were you asked to review some books and journals?
Yes, I was.
And I'm just gonna... If I may approach the witness.
Sure.
I'm just showing you an item. Is that familiar to you?
Yes, it is.
You didn't locate this on that night, did you?
No, I did not.
But you had the opportunity to review the contents of it at a later date?
Correct.
I would move to admit this brown journal.
No objection.
All right, that may be admitted. Kelsey, can I see you sidebar just for a second?
We're in real time, so we have no Zoom room, and I feel bad for whoever's coughing. And I think that they want to ask either A, can the person get whatever they need to take care of their coughing, and potentially, I think that he might be asking like how far they're going to be for the day. Oh, I do have a little bit of Zoom room. Okay.
Trooper Mello, just in...
Okay. We're back.
Trooper Mello, just in relation to now what's been marked as Exhibit 151, the Brown Journal, and just noting that when the journal opens to the first page, there's no dates on it, correct?
Correct.
And in those first few pages, just highlighting page 1, you reviewed these handwritten entries, and at some point in this paragraph, it says, obsessed with his sleep and nap schedule like to the minute. Says hearing him cry for 1+ hours and not intervening just about killed me. I even said the words, "I want to die" to Pat while he was crying. After that, I became obsessed with his sleep and nap schedule like to the minute. That's one of the entries you reviewed and noted.
Yes.
Page 2 says, I also feel like I did it wrong because I did it when he was overtired, so it made it harder. Now I have horrible insomnia and anxiety. You recall reviewing that in the journal?
Correct, yes.
Page 4 of the journal says, why else I feel guilty? He's not really hitting his milestones. Again, that's a page that's not dated in this journal, correct?
Correct.
Page 8. I'm completely overwhelmed trying to take care of the 3 kids. I feel like I'm drowning every day. Again, another page that's not dated.
Correct.
At some point, there are some dated pages in this journal, fair to say, right?
Yes.
And there's one on November 18th. And November 18th, that page reads, it's like I'm so desperate to get a mental break from taking care of everyone that my mind is trying to make something physically wrong with me. You recall reviewing that in the Journal.
Yes.
Now, in addition to the Brown Journal, when you were back at the office, you also had the occasion to review some of the other journals collected, right?
Correct.
This journal I'm holding up, exhibit number 147, is that familiar to you?
Yes.
And again, this is a journal that has handwritten notes in it, very similar to the handwriting in the Brown Journal you reviewed.
Yes.
And fair to say, the entries in this notebook only span a few pages and only go from October 13th as the first entry and the last one being January 18th, correct?
Correct.
And this third journal that you reviewed after the search warrant, exhibit number 50, the yellow journal with Callan Clancy's name on it. You recall that?
Yes, I do.
And you are aware Callan Clancy was one of the children.
Yes.
And in this instance, did you see similar handwriting from the other two journals that you reviewed?
Yes, I believe there was two separate.
Okay. At some point in this, these entries, you began to notice there were other handwriting.
Correct.
At the time you were looking at this, did you know who the other handwriting was?
At the time, no.
Who it belonged to? Okay. And fair to say, reviewing the contents of it, it's a pretty detailed list of a schedule for the baby.
Correct.
I have nothing further.
All right. Mrs. Reddington.
So one of the things that the district attorney did was read to you certain entries from what is referred to in your report as the Tree of Life Artisan Journal, correct?
Correct.
And when you refer in the report to the Tree of Life Artisan Journal, is that this here? What do you call the Tree of Life? Is there a diagram, a picture of the tree?
Should have a tree on it, yes.
But in any event, you would recall that that particular diary or notebook set forth on a number of pages her feelings dealing with her children. Is that fair?
It's fair to say, yes, sir.
And you wrote in your report on page 19 of 63, counsel asked you first about her stating that she had horrible PTSD from sleep training Callan, hearing him cry for 1 hour plus and not intervening just about killed me. I even said the words, "I want to die" to Pat while he was crying. He would be the baby, right?
Correct.
And this is her saying that not being able to go to her child because they were trying to do sleep training, she indicated that it was just about killing her, correct?
That's what was stated, yes.
And after that, I, meaning Lindsay, became obsessed with his sleep and nap schedule. Like to the minute, I would tell Laney, and you know who Laney is, right?
Yes.
Who's Laney?
The other child.
The what?
I'm sorry again. What's this?
Laney.
Laney.
Laney. Laney. Laney.
Don't recall this time.
Do you recall that she had a young lady, or they had a young lady that was in their home helping with the baby while to put him down at 10:36. I would also drive him around for car naps for hours every day, feeling guilty for doing this to my baby. Do you recall making that notation?
Yes.
I also feel guilty we did it too young, parenthesis, 1 week shy of 4 months, end parenthesis, right?
Correct.
You also noted in your report that I also, quote, I also feel like I did it wrong because I did it when he was overtired, so I made it harder. I now have horrible insomnia and anxiety, which is causing depression. I have no appetite. I don't know what's wrong with me. I want help. I want to be well. You saw that in there, didn't you?
Yes.
And then she went on and said, I think the anxiety started after sleep training. Doctor said it was okay to let him cry. I need to get a good night's sleep and take care of him, rocking him to sleep every nap in bed in the middle of the night. She noted that, right?
Yes.
Noting further in separate occasion, he's still a very happy baby despite his sleep training. Why I feel guilty is not really hitting his milestones, not rolling over, although he almost is, exclamation point. And he's babbling, which is a new milestone. She wrote that, right?
Correct.
She wrote, I have crazy brain fog. I feel like I can't make a plan. I can't carry it out. Like I just live moment to moment, waiting for the next nap time. I'm terrified of Cal getting overtired now because I feel I can't help him. She wrote that, right?
Correct.
She then wrote, I'm really worried about going back to work and not being able to function with the brain fog. I feel like I should start with a 4-hour shift and see how I do. I can't tell if I am withdrawing from Ativan and Benadryl, or is this my new baseline? I feel completely disconnected with my baby. I feel like I'm going through the motions every day. She wrote that, right?
Correct.
And there were a number of other entries that you put in your police report about that. One of which was that I feel horribly guilty about my marriage. I want to connect with Pat again. I know he needs it. I need it. I'm terrified because I'm terrified of the relationship. She needs to get birth control first. She made reference to her inability to have conjugal relations with her husband, right?
I believe so.
She indicated further on into her travels, I am completely overwhelmed trying to take care of the kids. I'm drowning every day. I feel guilty that I'm spending my family's money and not making any. I feel like I spend way too much. She wrote that, right?
Correct.
I'm terrified of Callan getting sick. He's a sick baby. A sick baby is miserable. He's sick now with a double ear infection. Clearly has a bellyache. It's miserable. I feel like the other kids are going to get him sick all winter long. She wrote that, right?
Correct.
I always feel strongly against sleep training. I feel like it's abusive to let the baby cry and not respond. But I made the decision. I did it with Cal. It is way too much crying. It's incredibly stressful. She wrote that, right?
Correct.
He's okay. He will be okay. It's not harmful in any way. The doctor said it was okay. Plenty of people sleep train their kids at that age. It's necessary as a third child, is what she wrote, right?
Correct.
I feel incredibly sad and guilty about not breastfeeding anymore. That was the one thing I could do to help his immune system, and I can tell he really doesn't like the formula. I'm very sad about this. I know at this time it's what I needed to do for my mental health. She wrote that, right?
Correct.
And then the statement started getting smaller and smaller as time went by. One occasion, it's like I'm desperate to get a mental break from taking care of everyone. My mind is trying to make something physically wrong with me. My mind never shuts off. It's constantly thinking of the next thing someone needs. I can't shut it off. I desperately want to go back to work, but now I don't know how I'm going to function, and it worries me. Wrote that, right?
Correct.
There were two pages that were blank that she didn't even write on. And then on the third entry, affirmations. She wrote affirmations. On November 22nd of 2022, I am calm. I will remain calm today. There is nothing that needs to be on my mind. The weight is lifted from my mind. I will sleep tonight. She wrote that, right?
Correct.
Continuing on into November, I slept well last night. I will sleep again tonight. Today will be a great day. I will go back to work on Sunday. I will thrive. I can feel like myself again. That was November 23rd. She wrote that, right?
I believe that's the day, yes.
Gratitude. I'm grateful for Sue, who's always listening. That'd be a mother-in-law. You knew that, right?
Yes.
So I'm grateful to Sue for always listening and trying her best to help me. Kids are sleeping great for Pat. Pat is handling nighttime stuff. Julie for making a plan for me. A big thing is I feel disconnected with myself. Time, reality. I think going back to work will help with that. She wrote that, right?
Correct.
And then there are numbers of pages, 22 of 63, 24, 25, 26, 27, 28, all reproducing what council asked you about and what I just went through that were from those journals, right?
Correct.
Did you have anything to do with the search of the house?
Yes.
Did you search in the bedroom?
Yes.
How many other people were with you searching in the bedroom?
I don't recall how many other people were with me at the time.
You know why nobody looked in the drawer and found pills and sleep aids and Apple Watches?
I'm not aware.
Did you see the drawer?
I don't recall.
What?
I don't recall.
Okay. That's all I have, Judge.
Redirect.
Nothing further. Thank you.
All right, thank you, sir. You may step down. All right, Counsel, could I see you at sidebar?
Hang on, we're gonna chat. Hold on. I think they're ending for the day. Oh my gosh, what a bomb at the end of the day. I could not write fast enough. They were all testifying. I just could not write fast enough. I think they're gonna be done for the day. Let me see. Okay, hang on.
We're going to break at this point. Till
They're
tomorrow.
stopping.
All right, and talking to council. My expectation is we'd have similar schedule tomorrow. The hope would be we'll go in the morning and it should go into the afternoon, but just to give you that's the best estimate that we have. All right, and so I'm going to excuse you till tomorrow. Remember, I'm going to ask you those questions. Don't listen to anything. Don't talk about this. Don't take any road trips or do any research on this. Put this out of your head as best you can till tomorrow morning. Hopefully the rain has stopped and we'll see everybody tomorrow. Thank you so much for all your work here today. Thank you.
Order. All right. Good. Please close your notebooks, place them on your chairs.
Okay. All right. Yes, I know I'm behind. I'm sorry. I had to go back a little bit to write down all of the things. I'm just looking to see if they put anything else on the record. Probably they won't. They usually don't. So I'm just listening for that. And then we will chat. We'll chat. Oh, hold on. We got so much to talk about. I forget who it was just like, oh, this is boring. Oh, this big bombs dropped at the last witness. See? Pay attention. I got to put my lip gloss on. My lips feel dry, and I just love this lip gloss. All right, I don't think oh, poor Lindsay. I'm just seeing if they're going to put anything else on the they're going to talk about anything else. Nope. Okay. Everybody out. Yeet. Okay. All right. Holy smokes. Holy smokes. Wow. Okay. First of all, let me take these off. My headphones have been bothering me all day. My hair's a mess. All right. I don't even know where to begin. I don't even know where to begin. Okay. So I know. Thanks, Liz. Liz, thank you. All right, I'm going to go scroll through some of you guys are talking about some things. If I missed something, I'm sorry. Just ask your question again. When you say he failed, Amanda, I'm not sure what you're talking about. I'm kind of going back and forth. Sleep training, we're going to talk all about that. So if I missed your question and you're like, I need to know an answer, put it in the chat again. We'll go over it. I would believe she did it if she remembers doing it. Otherwise, they should investigate further. I know who's making her do the sleep training. We're going to talk about that. They weren't sleeping together, the husband and wife. Yeah, we're going to talk about that too. Sleep training seems forced onto her. Hopefully they'll get into that. Failure of an investigation to look into the husband. The last part was tea, I know. Yep, we're going to talk about it. It's giving Gone Girl. That affair will drag out everything. Again, the affair has not come into to chat yet. So if there is, or if it hasn't come into evidence yet, where was Patrick when he's doing this? I've been saying this too. I think the lawyer failed today. I don't know what you're talking about there. You talk which lawyer? Probably with the girlfriend. Okay. Are they done for the day? Yes, they just finished. Or I just finished. They finished a few minutes ago, but it's okay. Why are we changing our medical proxy is the big question. Oh, they changed. Yeah, I don't know why she did that. Maybe she felt like Patrick wasn't. If they introduced the affair, wouldn't that give her motive? Absolutely. And so I stated that earlier, that if that was the case, if she knew if there was an affair and she knew about an affair, why hasn't the prosecution or anybody brought it up, right? They did bring up the fact that the prosecution in their opening statement alluded to the fact that one of the reasons why she did what she did was because nobody else could take care of her kids like she could. That was what was said. And that is kind of what I'm holding on to. And when they say that, they're talking about like the nanny journal that just was introduced, right? Is she controlling, etc. So they're saying all of these notebooks and all the things that she's saying is a controlling, obsessive nature, right? And just remember, so when this started, when the notebook started, I about jumped out of my seat. The prosecution cherry picked the statements, right? They picked and choose what they thought should be relevant. And then the defense came in and said, well, isn't this and this and this and this and that, which I found very interesting. And so, wow, wouldn't you like to get a hold of that journal and read everything? Because context matters. Remember what Patrick said on the stand? Context matters. You're just cherry picking these things, which are going to make her look bad. And then the defense picks these other things, which makes you look bad. And who and how is this all going to come together? It is amazing. Okay, so let's go back and read some of your comments. I don't know if he ever saw her again. I know that he said that he didn't talk to her for 6 months when she was in the hospital after she moved to the other care facility. The defense opened the Pandora's box of journals today. Well, the prosecution started it. They're the ones that brought it into evidence and started reading it. So, can they release the journals? Probably not. Probably not. It's probably only going to be for the jury. Again, you guys talking about an affair. We, as the at-home jurors, it has not come into evidence that there's been an affair. Now, when we see these things, do our minds go there? Absolutely. Absolutely. Who found the bodies? The husband found the bodies. And then he called the police, and the police and the paramedics came. They all helped out. The jury will get the entire journals for deliberations. Yes. Controlling. They are pulling at strings because that is normal caring mama bear things. Yes, I'm going to talk about that in just a second. Has part 2 of the live trial started today? Yes. This morning was like nurses and first responders, etc. This afternoon and psychiatrists. I think I'm melding everything together. Then some more psychiatrists, some police officers. Once I'm done on my live, you can go back to my YouTube channel and go to the live and watch it. These affair accusations are unfounded. People are assuming things so listen, for me, until it comes into evidence that there was an affair, I can't say for certain. So I'll put a pin in it. So they're done for the day. Yes. The emergency room doctor, she just had answers the question, no details. Right. We're calling your ER Dr. Kelly. Let's see. Well, see, I think she's writing the truth. Why? Because I feel like this is a snapshot in time. And I'll tell you about my experiences with sleep training, and it seems very, very accurate. Okay. The DR from today saw her 20 minutes. Yeah, I know. Made it sound like a long care relationship. I know. She really drove that out, didn't she? And I was like, I wondered how long she'd seen her. And then the feed cut, and I was like, oh no, I didn't get it. How long? 20 minutes. 20 minutes is not a lot to be on the stand for 30 minutes telling you what it was that you did or didn't see. He could have disposed of the journal. Boils down to, maybe he didn't even know that they existed or where they were. Plus, also remember, Patrick, after the time that this had happened, remember, Patrick was so incapacitated, he got taken to the hospital immediately. So if you think that he has some nefarious things, he didn't have time to get rid of the evidence because he was taken to the hospital. Boils down to, she could spend her life in jail or the hospital. You can't properly assess anybody in 20 minutes. Nope. Yeah. No, listen, no one's accusing anybody of anything. So this is an open, listen, we are an open community and the chat is fine. Say what you want to say in the chat. It's perfectly fine. I'm just letting you know what my thoughts and opinions are. He remarries 3 months after the tragedy. We talked about that before. Did they ever test or check to see how long the babies had been dead for? When the first responders arrived, the children were already deceased. When Patrick Clancy testified, he said when he saw Dawson first, and that he knew instantly that Dawson was unalived. Cora and the baby, I believe, were face down, so he probably couldn't see them, but first responders were there really quickly. So first responders came to Lindsay, and he stayed with Lindsay, and then he ran down to the stairs to go see where the children are. Because remember, when he went into the house, it was very quiet, and he was like, "Where is everybody?" And then that's when he scrambled to go look. He found Lindsay out the window first, went to Lindsay first, called 911. Responders came. Once responders were with her, he ran to the basement, saw Dawson first, and then by the time he figured everything out, there were other first responders there quickly and assessed the children. And as stated, Dawson was already deceased. Cora was pretty much, she got transported to the hospital, and she was pronounced almost immediately. And then Callan had a heartbeat, was transferred to Boston Children's Hospital. He was on life support. It took a couple of days for them to assess his care and stuff, but the doctor this morning testified that he never really regained any consciousness. He didn't have any brain function, and they waited for the family to come and see him before they took him off life support. So that's why he lasted a couple more days, just after FYI. Did they do toxicology on the kids? I'm probably sure that they did, but there's no reason to bring that into evidence. They didn't discuss anything, whether she gave them anything. I think I know where you're going. Did she give them something to sort of sedate them? If I'm reading what you're putting down, there's no evidence of that. So you're asking how long they had been dead for. I had heard, I think I want to say it was the prosecution, but I could be wrong. We talked about this morning, where that by the time Patrick left and went to CVS, and when he had called her and she missed the call and called him back, the children were already deceased. So that is in a quick, I'm estimating 10, 13-minute time frame. And if you're asking me, is that possible to do? The answer is yes. I did do a Google search, and it's just like that. It's very quick. So the cuts are more like scrapes. People are blaming her husband. No toxicology on the kids. Yeah. Did they investigate him or collect information? I assume they did some investigation into him, who, what, where, when, how, and why. They talked about they collected her cell phone, and they collected laptops. So we'll see when and if any digital evidence is coming out of that. I don't know. Oh, that's so cute. Did I do that? Did I make the heart? Somebody made a heart. I don't know how that happened, but that's so cute. Okay. They didn't take fingerprints. I'm not sure why they would have to take fingerprints just to see. Well, the defense admits that she did it, so I don't know why we're taking fingerprints. Pink Sunset said this is her town. Are people thinking that he did it and she's covering for him? I don't have evidence of that, so I don't know. They didn't say who was in the room when Callan was taken off of support. Oh, it was a gift. Oh, thanks, Laura. I'm new to all this TikTok stuff, so I don't know. Talking about crush meds. I don't know if she gave them anything. There's been no toxicology on the children that have come in through so far, so we don't know whether she did or she didn't give them anything. Okay. All right. I think I don't know if she was wearing the watch when she killed them. I do know that I heard rumors that her phone and her Apple Watch connected. And so somebody says there's some evidence that goes on there. I just want you guys to know that I'm coming in from this not knowing a lot of the background behind the scenes. I just know bits and pieces because I wanted to come into this as what you call an at-home juror. I had somebody on my Facebook call me out. They're like, you can't be a juror and be listening to this stuff. And I had to explain that I'm an at-home juror. So I don't know all the answers to your questions. And to be honest with you, I've only Googled some things I don't want to know because I want to know what evidence the prosecution has that they make their claims. I want to see what the prosecution has they're bringing into evidence. I want to see what the defense has. Okay, we're going to talk about the journal and sleep training. All right, I wrote down as fast as I could, so do not quote me on this. If you guys want to, and there's a vote in the chat, you can make a 1 in the chat if you want to. We can go over that and go a little bit slower as to all the things that they said because they were reading it off really quickly. We can go back and look, but we kind of already get the gist of it. She was obsessed about his sleep schedule. Okay, why? Because she was sleep training him. And if you know anything about sleep training a child, it is painful. To hear a child cry for an hour and a half is deathly painful. It's like you like nails on a chalkboard, right? Or for me, it's also like a balloon where somebody like scrapes the balloon. It's like, you're like, ah. I can imagine how she would feel with that. I can imagine feeling just terrible. So and also when you stop breastfeeding a child. So for me, for all 3 of my children, I was like their pacifier. I kid you not. I did not give my children a pacifier. And just FYI, if you have children or you're going to have children, a pacifier could be a godsend for some people. Some people say don't give it to them. There's so many sides to the coin on how to take care of your kids, and there's no right or wrong reason, but I know that people are going to pick up on this, and you're going to see lots of TikToks about how bad of a mother she was that she's tried to sleep train her child. I can already see it coming. But why was she sleep training her child? I don't know if we're going to get into that. It would be really interesting to find out who told her to do this. And maybe she felt compelled to do this because she was going back to work. And she needed to figure out how her child was going to do XYZ because now she needs to be on a schedule, right? She needs to sleep. She needs to do these things. I don't know when the nanny was coming, during the day, during the night. I don't know. But she felt as a mother that she needed to sleep train her child. Her husband was on board with this because he too is allowing this child to scream and cry for an hour and a half. In my opinion, in my assessment of sleep training a child, it was very difficult. So mine was a combination of stopping to breastfeed a child and to sleep train because what do? They would breastfeed to sleep, and that's what they would do for their nap. So I was trying to get my husband to sleep with my child so that he didn't need me, and it did not work. It did not work. It did not work. I also tried to have them sleep train by themselves. It was terrible, 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 terrible. So it was hard for me. Each parent has their own experiences. You have your own experiences. Is she a bad mother? Is she a bad mother because she was sleep training? Okay. See, Coffee Addict says, I can't do it with her son. Yeah, I couldn't do it either. Also, the reason why, so then she talks about she had to stop breastfeeding because she needed to go on these medications. So there's we get a little bit about that and why she's trying so hard to train him and to get him into a schedule. A, she's going back to work. B, somebody else is taking care of him. So she's struggling mentally. Now she's struggling as a mom to help take care of him. He's not hitting his milestones. Remember, she's also a medical profession, right? She's a medical profession, and she feels that maybe she's getting pressure from the people in her medical world, right? Remember, Patrick's mom is a labor and delivery nurse, so maybe she's getting pressure from there. We don't know. Until it comes in, we don't know. So here we're starting to see a bigger picture of her and what's transpiring with her in her mental status and her children, especially Callan, right? She wants to be well. Is that not a cry for help? She has anxiety over the sleep training. She's having trouble sleeping at night. He's not rolling over. She has crazy brain fog. She's living moment to moment. She can't feel. She's wondering if she should do a 4-hour shift because he's not ready for her to go back to work. Should she go back to work? That she also had that dilemma as well. And we'll get to that one in just a second. I'll come back to that one. All right, so this is all Kevin Reddington stuff. Oh, she was okay. Let's talk about the baby for a second. Then Callan was sick. He has a double ear infection. She's worried that he's going to get the other kids sick. Can you just imagine taking care of 3 sick kids? So, in my opinion, I feel like Lindsay Clancy I called her a type A person, right? She's worried about what other people think. She's worried about her children and what other people think. I can guarantee that. She's worried about medical professionals and what medical professionals think. Why do I know this? Is because he's not hitting these milestones. How is she getting this information? She's getting this information probably from her medical provider that says he's not hitting these milestones. And we all know, we know that not every child hits the milestones exactly where they're supposed to be. But she felt this internal pressure that he wasn't doing these things and she felt personally responsible that your child's not doing XYZ. What can she do better? What can she do differently? Right? Right. That is another point. Just think she's writing all of this down and she did mention her husband. We'll get into that in just a second. But these are like her internal thoughts about her child and what she's going through. And remember, she keeps saying the doctor said it was okay. The doctor said it was okay. So we know she's getting this information from the doctor about the sleep training. She's sad. She's guilty about breastfeeding. She knows that he doesn't like the formula. She needed to do it for her mental health. Her mind never settles. She can't shut it off. She's desperate to go back to work. And then she writes her manifesting. Okay, so she's desperate to go back to work. I had wondered this question, which is, Patrick Clancy answered this question about her going back to work. Her first child, she went back to work. She was working like 20-hour shift. The second child, she went back to work, but she was only doing like 1 shift. So what would this last one look like? She said just going for 4 hours. Why did she need to go back to work? Did she need to go back for her mental health? Did she need to go back for money? Patrick Clancy testified that she didn't need to go back for money because he had everything situated. So why in her mind does she think she has to go back to work? And then she also writes, she feels guilty because she's spending all of her family's money. To me, I feel like she is painting a picture. She is painting a picture that her mind is cuckoo bananas. And that's my term. That's my term. Don't come for me. Her mind is all over the place. All right, so let's go through and see. So Carolina says it is torture. Let me see what some of you guys are saying. Yeah, so many moms can relate to that journal. Michaela and Liz, I don't know if you guys are fighting. Amanda, I'm so glad that you got support and the right help. So Liz, if you feel like she is guilty, that's your opinion. Everybody be nice. If somebody has an opinion that diametrically opposes what you think, it's fine. We're here. This is a community. I want everybody to feel safe for what they're going to say, because one person's opinion, it's like we're at home. We're the jurors, right? If one person's opinion is that she feels guilty, that's her right to have that opinion. If you feel that she's not guilty, that's your right. And you can put your supporting evidence in your comments, but please be nice to everybody. All right. Sounds like she needed a break from being at home. Yeah. You had a great support system. The meds they gave me couldn't even be a mom. Wow. Miss Rivera to Amanda. That was really nice. Chrissy, I'll catch you up later. Yeah, we have to look at the evidence. So I'm looking to see what comes in to make up my mind. By the way, I haven't made up my mind just yet. Back to work to keep her benefits. That's a great question. We don't know. That didn't come into play. He did it before his time frame doesn't match. Yes, she went to CVS, but I don't think he did. I'm not sure. I can't follow you. It's tough enough for sure. It wasn't explained to me after birth. Thanks, Sheila. Time frame doesn't add up though. They showed up in court with video footage. Her temp at the hospital was 82 degrees. With the temp, her body was there with a lot longer than that. Yeah. Carly says she's on the fence. Today was a lot of new information. It was. My sister Chrissy's in the chat. I keep calling her out. She says, please like and follow this page. Yep, all is good. It's just speculation in this chat. Some is crazy. That's fine. It's fine. Everybody's entitled to their opinions. And in fact, I want your opinions, because you might have some insights that I didn't see, and I might have some insights that you didn't see. As long as we're nice, play nice in the sandbox. My son cried nonstop for 18 months, and it was beyond. Oh, I missed it. The feed jumped. Oh, I'm sorry. Okay, 18 months, and it was beyond hard. Never did I once think to cause. Okay, so I'm going to tell you about my middle son. My middle son was born 6 weeks premature. And so first, he's underdeveloped, right? He was in the hospital for 13 days. He was in the NIC unit. And at the time, my husband was working full time. And so I had an older child my older child was 14 months. And I was at home while my husband was working, and my son was in the hospital, and I could not attend to him until my husband got off work. So I was at home with the oldest child. And then when he got off work, I went to the hospital and stayed with him for several hours. And it was devastating. I cried and I cried and I cried. And everybody's like, just hug your oldest son. So me and the oldest son would totally hang out, and I would just be like hugging him. And then when my milk would come in, it was like the second. So I was in the hospital for 2 days with him and got to see him, but he was not nursing. He wasn't nursing right away. He had a feeding tube. And then I got to go home. And then my milk came in, and I was like, what do I do? So I had to go, and I rented a breast pump because I knew it wasn't going to be long term, but I rented a breast pump, and every time I would pump, I was crying, and I pumped and pumped and pumped because I didn't know what he needed. I didn't know what they were going to give him. I didn't want them to give him formula, but I know that at one point they did. It's a long story. And then, when I went to the hospital, I would pump. I was pumped because, a kid eats every 4 hours or 2 hours or whatever. So I would get up in the middle of the night, even though I didn't have to pump. And I would just cry and cry and cry because I didn't have my child. So long story short, I finally went to the hospital and they're like, oh, you can feed him. And I was like, what? So I did. And I was like, if I could, like, when can I take this baby home? So he was only in the hospital for 13 days, but it was 13 very painful days. And I had to jump through hoops to get him out of the hospital. And one of the things I had to do to jump through hoops was the doctor or a nurse, somebody said to me, there are 3 things when he can come out of the hospital. One was he had to maintain his own temperature. I'm like, well, you have him in an isolette and you only have like a onesie on him. Like, how is he going to maintain his own temperature? He needs more clothes on. So I was like, okay. Then the second one was he needed to take a bottle, and I'll go over that in just a second. And I forget what the third one was. And I was like, well, he's going to be exclusively breastfed. So, but I know he can take a bottle because you guys have given him one because you didn't know where my breast milk was. That they found out that they had transitioned him from the ICU unit to a not so much ICU unit, a transitional care unit. And he wasn't in the ICU anymore. And the nurses were 4-to-1. I don't know if you know what that is. That means that they take care of 4 babies. It's 1 nurse to 4 babies. And I was like, how the heck are the nurses doing this? And so basically I just said, what care can the nurses provide to my child that I can't at home? I'm a stay-at-home mom. So give me my child. It's basically what I did. And so long story short, I just said, he's not going to be bottle fed. He's going to be breastfed. So, and we also lived a couple of blocks down from the hospital. So I was like, if we need something, we'll be here in a heartbeat. So give me my baby. So that to me was very torturous. So I have some firsthand experience with that. All right. So she's spending the family's money. So this is another thing. So she's bringing up Patrick kind of, secondarily, and then, okay. So then I don't know if you guys heard this, but she talks about that she's not sleeping with Patrick. They are not having intercourse. She says she feels guilty about her marriage. She's terrified of their relations and that she needs to go on birth control. So Carolina says, referencing to the sleep training, it is torture. It is. All right. Does anybody have any experience with that? Not having relationships with your husband. Now, I don't know when she wrote that. I don't know if that was an entry journal that was specific to that day. But just remember, so, and she also said that Kellen's birth was not traumatic to her, right? The other two she had some traumatic things. And so that might, increase your time that you can be intimate with your partner. And so she's worried about her husband and she's worried about having relationships with him. And now those who have the conspiracy theorists of whether or not he is or isn't having an affair, that might be credited to your thoughts. But again, until there's evidence of an affair, I don't know anything. And again, I would think that if there was an affair, and if that is one of the reasons why she did what she did, the prosecution would totally use that, right? There's motive right there. She did it because if a potential divorce or the marriage is ending and she doesn't want anybody to take care of her kids better than her, then that's a motive. You would think that prosecutors would have brought that up right away. You would think that they would have questioned Patrick right away, and you think the defense would be on that right away. But none of that was said. So to me, I'm thinking, no. All right. So if you haven't done the likies, the subscribey things, what have you, I appreciate everybody. My TikTok currently is at 700 and something. I'm at 787. I need to get to 1,000 so I can do some other things, but it's okay. Everybody, we're doing great. We're doing great. So make sure to do the likies, the subscribey things. Also, if you haven't joined my other spaces, I'm on X if you're on X. I'm also on Facebook. Facebook is really where I will put a lot of things. So hello everybody. I'm Missy K. I bring law cases to you, and it's not just Lindsay Clancy. We're going to talk about a whole bunch of other things that are going on as well. So sometimes I go in trials knowing a whole bunch, and I read all of the motions. I bring you along with me. We go over motions and stuff before, because that's where all the tea is at, by the way. All the stuff coming out before trial is in the motions. So I'll bring you coverage before the coverage. Today, I did not talk about the Idaho 4 case. What would you like to talk about? I'll tell you everything about the Idaho 4 case. So I read the motions beforehand. We go through the motions, so I do that as well. I also will put up pictures and stuff. So Facebook is where most of that dialogue goes through that. And then live gavel to gavel coverage. This is what we're doing. It's live gavel to gavel coverage of the Lindsay Clancy case that we can talk about it. Well, now on TikTok, we can talk about it in real time. You can also message me on Facebook, or you can message me on TikTok and Facebook. I didn't go live on Facebook. I think I should probably do that right now. Whoopsies. It's okay. We'll bring Facebook into it. Facebook does not allow me to share. So if you're on YouTube, you can see me, you can see the trial at the same time. So that is where we can talk about things. I can also share motions and stuff. When I'm reading something, you can see what I'm reading. TikTok doesn't like that. Neither does Facebook. So YouTube is the way to go if you want to see the trial with me and we can talk about it. You can also chat in that as well. Same channel name, Legalese123. So I'm on TikTok, X, and YouTube. I'm also on Instagram too. My Instagram's not doing well because I had to put a underscore between legal and ease because legalese was already taken. And so some people can't find me, and it's okay. Listen, I'm not trying to be popular. I'm just trying to do the things that I can to bring you what I love and share my love with you. Oh, Liz. Brian, okay. You asked my opinion. Brian Koberger was the sole person who did it, okay? And that's my opinion, and I'm sticking to that opinion. There is nobody else. There has been no other evidence or DNA of anybody else in that room or in that place except for him. So, and remember, he's the one that said he did it. So he said he was guilty. Yes, the roommates took so long to call. And the reason why that is because the roommates in Idaho, they've been up since 9 a.m. that morning. If you saw the picture of them with the girls on top of their shoulders at the apartment complex across the street from them, they had been up early. They went to a game that morning. Idaho had a game. And then it was also Parents Weekend at WSU. So they were up since 9 o'clock, and now here it's 4 a.m. They had been partying. They had been drinking, and I believe they had done some illegal substancing. Some of them. I don't know who, what, when, where, but I think that they did. And so by 4 a.m., she's hearing things and stuff, and so she thinks it's all made up. She's not sure what's true and what's not true. And that is evidence in some of the filings that were made in reference to when the defense was trying to, the defense was going to go at Dylan. This is Dylan we're talking about. Dylan was the one that ran down to Bethany's room. We're talking about the Idaho 4 case, Brian Koberger, Moscow, Idaho, etc. When Dylan was running down to Bethany's room and they were texting each other, Dylan did not think that what she witnessed was true. She thought she was seeing things. Plus, remember, it's also a party house. People are coming and going in that house all the time. So maybe it was somebody else. She thought it was Xana at one point in time, remember? So I think that they had gone downstairs. Her and Bethany had talked about it. And I think that they just sort of just lost it and went to sleep. I think they went to sleep, and then when they woke up and that nobody was answering, then they started freaking out. Okay, Liz. I think Brian was the sole person who did it. Was there any reason he said? I'm not sure what you're asking, Liz. So, if you don't know, I lived in Moscow, Idaho before the unalivings happened. I moved just about a year and a half before it happened. And I go there. I go back there. Yeah, most likely passed out. Rosie says most likely passed out. Did Brian Koberger know them? If that's what you're asking, the answer is yes. Why? I think we don't know for sure, so I'm kind of speculating based upon some of the evidence, the digital evidence that was missing. They went back and they searched for like keywords. So we know that he went to Mad Greek, which is a restaurant in town, and that I believe it is Maddie and Zana worked there. And he was a vegetarian, or he's vegan. Rosie said, I think he knew them. I believe he had blended into a party at the house a few times. Yeah, so Cy Ray, who is his defense expert, I had heard some smatterings that he had said that, yes, he had been in the house before. And the reason why I do think that he was in the house because he knew the layout, right? And yes, so if you oh my gosh, I could go on. If you didn't know, the pictures of the house were already online. Because when you go sell your house, you know how they take pictures of the house? There is, if I don't know if it's still there, but if you go to like realty.com and you type in 1122 King Road, they had pictures of the layout of the house. Could he have easily found that? Probably. Did he? I don't know. But, just saying. But I do think that he was there in the house because he knew the layout and everything, in my opinion. There's also speculation that he was also at a pool party. We know he was at a pool party that was about, let's say, a few blocks away from where the 1122 King Road was. And there was a pool party. Remember, some person came out and said that he was creepy and she was talking to him. And then he was at that party. And they think maybe some of the girls from the house were there. Rosie said, plus Maddie said she felt someone was lurking outside once or twice when she walked the pup Murphy. Yeah. So if you looked at the house, I have been back to Moscow a couple of times since this happened. The first time I know where the house is located. I couldn't go. I was so upset because it just happened. It just happened. I was there in February and he was just found in January, right? Just Christmas time was when he got picked up and I was there in February. I couldn't go look at the house. The house wasn't demolished yet. The house wasn't demolished yet. But there is like just a little bit of woods in the back of their house, but it's not like a big thick woods. There's just some trees that are randomly, here and there. But you could park up there. And I think that he had parked up there and had gotten out of his car and he was watching them. And that's when so that's kind of like their backyard. And that Murphy was out there barking. We do have accounts of that as well. They didn't, at that time, they hadn't knocked the house down because at that moment, they didn't knock the house down because the university didn't own it yet. The person who owned the house eventually gave it up to the university and the university knocked it down. The university, I think, knocked it down because it is like a mark on the university and the town, and they wanted to get rid of it as fast as they can because they don't want everybody coming to go look at the murder house, right? So, even though people do, they still do. They leave flowers and gifts and stuff there as well. All right, so I went back the following year to Moscow and I went to the house. The house had been demolished then. It's all gated up. There's like a big fence around it. And right now, if people show pictures every once in a while. Right now, it's just all overgrown, like as if it never existed. And if you didn't know, if you're walking by and you didn't know, you had no idea that there was a house there. No idea. It's I don't know what the university is going to do there. I think they said that they're going to like make some sort of like they're going to put a building or something on there. There is already a memorial place for them on campus, and it's really nice and really pretty. If you ever look at Kaylee's mom, Christy Gonzalez, she's got a Facebook page. It's called the Gonzalez family. If you ever go and want to see that, she talked very highly of it. Now their family does not like the university and the way they handled things, so they're big proponents of not saying things. It's sad. It's sad, and it's sad that there's this person who wasn't even from the area, this person who didn't even live in the area, know the area, came into two environments, came to WSU, and then came to this quaint, beautiful town and did what he did. It's the town slowly healing. The town is made up of people who work for the university, professors, people who maintain the university, people who own the businesses there. Plus, it's farmland, and it's not people like, oh, Idaho, it's about potatoes. There are no potatoes there. They grow wheat, and if you ever Googled it, they grow most of America's wheat. It should be known as the wheat town, not Idaho, not potatoes. So there's wheat fields everywhere, and it's gorgeous in the springtime. It's all green and wavy. And then, like the song America the Beautiful, amber waves of grain. That's what it is. That's really what it is. It's beautiful. Plus, they also grow canola oil, or the seeds. It's yellow. So you'll go through the fields and you'll just going through, and it's like either brown or green. And then all of a sudden you see a field of yellow. It's also called, I'm going to say grape, but it's really that R word, seed, canola, grape seed. If you know, you know. So, all right. Any more questions about the University of Idaho? And Brian Koberger. Oh, and by the way, if you're going to ask me, because Koberger says that he wants to change his plea, what's going to happen with that? Nothing. And I'm sorry to burst your bubble. Nothing's going to happen. Why? And why is he doing it now? Why is he doing it now, and what's going to come of it? So he's going to get a defense lawyer. Judge Hippler went ahead already and gave him a defense lawyer. They're going to get transcripts and everything from the case, especially his guilty plea. They're going to go through that and they're going to review that. They probably are going to go talk to his lawyers and find out what his claims are, that he was coerced into signing this agreement, even though, as we all know, when he pled guilty, he was asked these specific questions. Are you under the influence of anything? Did anybody promise you anything? Did anybody coerce you into doing this? And he also made this with the cooperation of his family. That is the first time that we heard that. His family was also involved in this decision. So he knowingly and willingly pled guilty, and that's that. But legally, he still has rights, so the judge has to go through these things. Will there be a hearing? Will Judge Hippler hear this? So we're waiting for the defense to go back and file their motion as to what they're going to say his claims are. Then we also hear from the prosecution. The prosecution gets to state what they're going to say. And if you guys know the prosecution, they call him Santa, Bill Thompson. He has retired. Will he come out of retirement for this? I don't think so. So it's going to have to be the girl prosecutor who's going to have to come back and make some statements. And then the judge can either look at the motions and decide right there, nope, done, and there's no hearing, or he can decide to have a hearing. And because you follow me, I'll bring that to you when we have that information. So make sure you have your notifications turned on so you know you can get everything up to date, etc. I usually post those things on like Facebook or X if you want to know the tea right away. All right, do we have any more questions about Brian Kohberger and any of that shenanigans, etc., going on with that? By the way, there was a new brief that was filed in the Sandra Birchmore Matthew Farwell case. I just saw that. I'll read that in just a bit and see kind of what's going on there. That case is going to be going to trial in September, but it's a federal case, so we can't cover it gavel to gavel. But I'll cover it from people who were in the courtroom, so I'll bring that to you. Let me know if you want to know what the Sandra Birchmore case is. It's another Massachusetts case, my Massachusetts people. I guess they're just talking about expert witnesses that are going to come in. Sorry, getting a text. Hold on. Oh, thanks. Okay, sorry for the noisiness. All right, does anybody have any comments, questions, concerns, thoughts, ideas, etc., 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 etc.? Today was an okay day, you know, like we did get through, we got information from the psychologists. Those came in, didn't get all the answers. We got some information from the big bombs at the end about her mental status and her notebooks. And, you know, just a lot of thoughts and chats and great things from everybody who has joined so far. So I really, really appreciate you. All right. Does anybody have any more thoughts, questions, ideas? And so since TikTok, I can do this on TikTok. Guess what, Law Lovies? We'll be back on tomorrow. I'm so excited. So tomorrow morning, I come on at 8:30 in the morning Central Time, 9:30 Eastern Time. I don't know where you are, so you'll have to Google what that is. So check your spaces. I'll be back on tomorrow live with all of you. Oh, Cassie. Okay. So Cassie just came in and she says, I just found out of this case. Fill me in. Send me pages to catch up on. Cassie, what are you talking about? Are you talking about Sandra Birchmore? Are you talking about Lindsay Clancy? You're talking about Brian Cope? We just talked about 3 cases all in one. Cassie, be more specific. Clancy. Okay, I'm not sure what you mean by send you pages. I'll give you a brief synopsis. Lindsay Clancy unalived her 3 children with exercise bands. She was having some postpartum mental illnesses prior to this, allegedly. We're in day 5 of the trial. And her husband came home. So she was having some mental problems. She's been to a couple mental facilities. I'm giving her the Cliff Notes version. She'd been to a couple of mental facilities before this. She was on lots of different drugs. She was taking some, she wasn't taking some. She went to a couple different doctors. So the defense says that she was overtired, over-medicated, and it's not disputed that she did it. It's what they're deciding is whether or not she was insane, but the prosecution said that this was premeditated, she planned it, and therefore she needs to be found guilty and go to jail. And the prosecution's saying, we said that she did it, but here are the reasons why she did it. We think she's insane, and so therefore she needs to go to a mental facility for the rest of her life. That's the gist of it. Yes. So if you, yeah, if you want to go see documents of things, you can go to my Facebook page. But I don't have too many things about Lindsay Clancy because I don't have any emotions about her because I'm coming into this fresh. But Cassie, if you want to see, to get you kind of up to speed, you can go. The best place to go to is my YouTube. And if you go to YouTube and it's Legalese 123, if you go to YouTube and you type in Lindsay Clancy, you're going to get long-term videos like 3 hours plus because we're doing this live. But you can also go to my shorts. My shorts will kind of give you little updates about the things that are going on. So I do like a 2 or 3 minute video of who testified and hit the high points. So that'll get you caught up if you can. Or you can also go on to TikTok, but I think TikTok, it doesn't like parse out. It just gives you all the stuff I've talked about, and I talk about a lot of things. So okay, so Rosie asked about the DNR. So why she didn't want a DNR? She's so young to not want a DNR, plus why she wanted to change it from her husband to her parents. Okay, so if you missed that point, at some point in time, the psychologists were ordered to come to her bedside to talk about whether or not she could give proxy of her medical health directive from her husband to her parents. And I mean, you can kind of see why, right? If she unalived her children, her husband probably is not happy with her. And so do you think that that would be the best person to talk about her medical situation? Probably not. So she wanted to change from her husband to her parents. And so they needed to make sure that she had the mental capacity in order to make that change. So that's why the psychiatrists came in to talk to her about that. But then there was all this hubbub about DNR, and I was confused for a little while as to what time and space we're talking about this. And it ended up that it was after. So, as you know, Lindsay Clancy hurt herself. So, after she did the stuff to the children, she went to her bedroom. She superficially did some stuff to her wrists and her neck. She crushed up some medication and took it and then yeeted herself out of a window. She is paralyzed for the rest of her life. When the paramedics found her, she was kind of unresponsive. She was sent to one hospital. They stabilized her. They realized they could not care for her, but she was unresponsive. And just remember, they put the breathing tube down her neck or down her throat. So she was sedated. So when she moved from one hospital to the next, she was completely sedated. And then remember when she went to the other hospital, they had done the MRI and then they took her to the ICU unit and then she coded. They had to resuscitate her. So they did that. And then like the next day or so, when the 20-minute lady came in, and the 20-minute lady psychiatrist came in to talk to her, she still had the breathing tube down her neck. She couldn't talk. Remember, she was only writing with the thing. You can't tell someone's demeanor by what they write down, right? You need a face-to-face interaction. It's like when you do text messages to someone else, or like even in these chats, I don't quite understand all what you're saying because I don't have your emotions, your reflections, what have you. So she's just writing notes in a 20-minute conversation. So don't get me started on that, doctor. So to me, it seems like they were asked, I don't know who or why a DNR came up. I don't know if it was her parents or whatever, but they decided not to do a DNR. I hope that answers your question, Rosie. I'm confused as much as you are. So yeah, perhaps you're right. Maybe her care team suggested that she have this change. I think so too. Yeah, it's a lot. It's a lot, right? And then, so just remember, thanks for trying. Thanks, Rosie. I appreciate that. And also remember, so I also want you to know. So Abby says the defense did not do well today. Well, let me know how you think that they didn't do well. So it was brought up on many occasions that she asked for a lawyer. So by her asking for a lawyer, and just remember, I guarantee you, put a pin in this. I put a pin in this. I guarantee you that there will be an instruction to the jury at some point in time about her asking for a lawyer, and that you cannot assume that she's guilty. That asking for a lawyer does not equal guilt. But remember, she's already said that she did it. So that's not in dispute. So is it a nothing? Is it a big thing? The defense already said she did it. Yeah, maybe somebody suggested a lawyer to her. Absolutely. Amber, you're talking about ER Dr. Kelly. Dr. Kelly. We're calling her Dr. Kelly, the one who came in and just was like, I don't know. I need to see my report. I don't know. She was giving you nothing. She did to both sides. She did to both sides. All right. So if you didn't like, if you say, listen, if you don't like and subscribe and follow, you're missing out. I'm just letting you know you're missing out. You're missing out. So if you haven't had a chance, please do those things. Again, I'm on all the places. If you're like, I don't know where to find you, if you go to my Facebook page, and I think on the side it says the About, you can see all the places that I'm at, and etc. And follow wherever you feel comfortable at, etc. I felt like when he talked to the 20-minute psychiatrist, he was focused on, yeah, I agree with you. He was like all over the place. I agree with you. So Abby, what he was trying to do, and both the prosecution is very, very guilty of this as well. Both of them are testifying to the jury, meaning they're asking questions that they probably, bye Kimberly, they're asking questions that maybe this witness can't answer, but they're testifying, getting things in that aren't evidence yet. And they're asking things through one witness that they're supposed to call to get it in through another witness. Even though what lawyers say isn't evidence, but once you hear that, how are you supposed to not hear that, right? So you guys let me think. Let me know what you think in the comments. Do you think that if you hear something, if you're a juror, you're an at-home juror with me. You're an at-home juror, you hear them ask a question and you're like, oh yeah, what's that? And you write it down. And then that person can't answer that question. That leaves you with an unanswered question that you want to know the answer about. And is it going to come in through this person? Is it going to come in through somewhere else? And if you leave the jury with questions, they're going to seek out the answers. And if you don't answer them by your time is up, then what's going to happen? They're going to seek it out themselves. It is a known fact. They're going to seek it out for themselves. So, okay. It is almost 4:00 my time and I need a break. So I appreciate everybody. Does anybody have any more questions before we end? And then I'll kind of give you the picture of what tomorrow is going to look like. So first of all, you guys are going to make me cry. I appreciate you guys so much. I appreciate that everything that everybody has done. I appreciate all the likes, the subscribing, what have you. It means so much to me because I too am in a transitional state in my life where my kids are getting older. They don't need me. And if I go and I join the workforce, I'm not going to get paid my worth. I had some really high profile jobs. I've been out of the workforce because I was taking care of my kids. I decided to be a stay-at-home mom. And so I want to go back and be a lawyer. But if you become a lawyer, then you've got to deal with all of these other things. Plus, it's a lot of money. So I was like, okay, what can I do? What can I do? And this is my passion. And this is my passion. And I'm like, how can I share my passion with others? And I just appreciate you coming on here, sharing your experiences, sharing your thoughts, your opinions, etc. It just it warms my heart. So thank you so much. Okay. Law Lovies. This is what's going to happen tomorrow. We will be back live on TikTok, just like this, at 8:30 a.m. Central Time. I'll make a TikTok of it, but I don't know what you see or what you don't see. Again, if you also join the other spaces, you can see what's going on. I try to post every day and tell you what's happening. If you don't like this format on TikTok, this is not the way you like it. You want to see what's happening. You want to be with me? Join me over on YouTube. On YouTube, you can see me, and then you can also see everything that I post. You can see any documents that I post. You can see the trial that's going on with me. But I'm starting at 8:30 a.m., which is a little bit less than what time they start. So don't panic and don't worry. We'll catch up to them. We always do in real time. And, you're not going to miss anything. And then also, just as you may know, I'm also like covering the people and what they say and stuff in real time. So I post it on X and Facebook. So if you missed something, don't worry. And also, if you missed anything, just go to my YouTube page. When I'm done with this live, you can be on the replay crew. You can go back and watch, and you can zoom through things if you don't want to hear me talk or whatever, or wherever you follow cases. And just FYI, I'm not a gatekeeper. This is being covered by a whole bunch of other people. If you don't like me, you can go join them. You can go watch Court TV. You can watch East Idaho News if you don't want to hear me chat. But if you want to be part of a chat and you want to talk about it and you want a safe place to talk about it, here we are. So TikTok and YouTube is where we can talk about things. Facebook, we can only chat when we have the ability to chat. Facebook does not like me posting the YouTube-y things. So I'll get yeeted. And I've worked so hard to build up my numbers that I do not want to be yeeted off of those pages. So, all right. If by chance you have a question for me and you're like, oh, I didn't get to it, either you can bring it up tomorrow, or you can on TikTok, I know for sure you can send me a message, or if I posted something in Facebook, you can send me a message and, I'll answer you as best as my ability. All right, law lovies, I appreciate everybody. Thank you so much for joining me. I will see you again tomorrow. Bye. Thank you so much, everyone. All right, bye-bye to my Facebook and my YouTubies. Love you all. We'll see you again tomorrow. Thanks for watching Legalese 123. If you like what you saw, please like and subscribe for more content.